Hmm. Hello. So, hello everyone. Am I audible? Just check so that we can start the session. So, yes, dear students, am I audible? Let me just check. Okay, so I am audible. So, for today's session, what we are targeting is the histology session, and it's a very important topic. And for understanding histology, we have to see many images. So, once you see the images, you can correlate with the histological aspect. So, it's very important that multiple images I will show you. And if I talk about the histology important topic, yes, Osama, Vicky, and Jay Chandra. So yes, today's session, all important topics are related to the histology I am going to discuss. So exactly, if I talk about the most important topic, which is often asked in the examination, and it's very important that you should have an idea of these topics. So one is the epithelium. So let me just enumerate the topics which I am going to cover up. So one of the topic is the epithelium, which you have to know. So after that, I would like to give you the brief of other structures, like you should also be aware of the connective tissues. You should be also aware of the cartilages. So I have skipped the bone because it is covered up in the general anatomy part. So, and other important topics, if I am watching, if I want everybody to know about, is the lymphoid structures. So, and not only this, I have also covered the general histology part, and I have also covered the systemic histology part, in which I have covered up the so what is the plan? I'm not still covered up, but I will definitely cover in this session is the histology of the GI tract, histology of the respiratory tract, histology of endocrine system. Yes, Shri, good morning, dear. Good morning, everyone. Yes, good morning, everyone. I feel everyone is fresh to study histology session. Okay. So actually, so many things are there which I want to cover up in this session. So let's start with the first topic, that is epithelium. The first topic which everybody should understand is that of epithelium. Yes, Sachin Rathore, good morning. Yeah, everyone, good morning. So, if I just want everybody to understand what is the definition of epithelium, what do you understand by the topic epithelium? As we know, epithelium is the seat of cell. Actually, it is made of number of cells, which is not only covering the external aspect of the structures, but it is also forming a layer on the internal surface of the hollow structures, viscera, and lumen, cavities, and all. So in other ways, what you can say that epithelium is acting as a barrier. So what epithelium is acting as it is acting as a barrier. So it's a barrier membrane. What you can say, it's a barrier membrane which is exactly located on the external as well on the internal aspect of the viscous structures, hollow viscous structures or cavities. So that means you have to know the epithelium types on the entire body. So what I have done, firstly, I will make you understand exactly what is epithelium, what are its apical extensions, and what are those modifications, how the cells are interconnected, the epithelial cells are interconnected with each other. So that is very important for you to know. Then what I want everybody to understand is the types of epithelium. So when I'm going into the details of types of epithelium, I mean that you should be aware of the simple type of epithelium and the multiple layered epithelium. Okay. So let's start firstly. So I will go in sequence, don't worry. So everyone, is it okay? Everyone is aware of what is the definition? It is not only surrounding the, I'm just checking your messages also. So it's not only surrounding the part in the internal aspect, but it is also giving it is also forming a layer on the outer aspect. So that means epithelium is protecting the structures from external invasion and also from the internal invasion. So that is an important aspect, and at different places the epithelium has got a role of different structures. So it is having a different role to play, and that is very, very important for you to understand the whole detail of the epithelium. Now let's talk about the broad classification of the epithelial tissues. So in this flow chart, what I mentioned here in this flow chart, what you have to understand, if you want, I can slightly enlarge it. Yeah, so it's okay. So in this flow chart, you have to understand the broad classification of epithelial tissue. So exactly when the epithelium is forming a surface lining, when it is lining the surface epithelium, in that context, so in that context, it is having two functions to go. It is having two important functions which it provide. One is the protection and other is the absorption. When the epithelium is forming a lining of glands, so when it is on the glands, when I am talking about the glandular epithelium, it has a function of secretion. It is also lined on the, it is also acting as a neuroepithelium. And when we will talk about tongue, and we will see the location of taste buds, and there I will show you that where is the neuroepithelium located. So here, if I talk about its function, epithelium has got a function of sensation. It is also having a function of sensation. Other than that, epithelium also has a function of contraction, and when epithelium is doing the function of contraction, then it is called as myoepithelium. So in other words, what you can understand, epithelium has got multiple function to perform. It is having a function of absorption and also protection when it is lining the surface. If it is present in the glands, it has got a function of sensation, secretion, and if it is present in taste bud, it has got a function of sensation. And on the contract, it also acts as a contractile tissues when it is present in the ducts of the near the ducts of the serous acini or the mucous acini, that is called myoepithelium. Okay, everybody, till now is it okay? Okay, any doubt, you just let me know. Now let's talk about the general features of epithelium. Now the next important thing is you should be knowing about the what are the important general features of the epithelium which you have to know. So if I talk about epithelium, again it has got multiple functions to perform. So it is having multiple functions to perform. So it says cellular sheath, which is either made of single layer or it can be multiple layered, which I have already told you. Epithelium is also adherent to each other by means of junctional complexes. So there is junctional complexes. So there is junctional complexes, and because of the presence of this junction complex, what happens, they are interconnected with each other. So at certain places there is a seal, nothing can pass in and out, and certain places there is certain gaps in which some of the ions and the structures can traverse in and out. Very little intercellular material is found between them, and the deeper aspect, if I am talking about the deep aspect or the basal aspect of epithelium, it is resting on which structure? Basement membrane. So epithelium is resting on which structure? It is resting on basement membrane. Okay, so it is resting on basement membrane. Now the presence of this basement membrane, which is on the deeper aspect of the epithelium, is separating the epithelium from the underlying deeper vascular connective tissue. Okay, Osama. So that means till now what all we have discussed about epithelium is that epithelium is adherent to each other. There is a less space and there is little intercellular material which is found in between the epithelial cells, and they are much adherent to each other. The junction by which the epithelial cells are interconnected, we are going to discuss in detail, don't worry about that. Epithelium rests on a deeper structure which is called as basement membrane, which is separating the epithelium from the underlying vascular connective tissue. Okay, now so continuing with the features of the epithelium, the next other features of the epithelium which I want everybody to understand is basement. Now I would like to give you the details of the basement membrane on which the epithelium is resting. So if I talk about the basement membrane, the epithelium is having two layers in it. So if I talk about the basement membrane, the epithelium has having two layers. One is the basal lamina and the other is reticular lamina. So basement membrane is consist of how many structures? The basement membrane is consist of two structures which has been written here, A and B. The A means basal lamina, which is exactly the product of epithelium. The other is reticular lamina. Now, there is also, other than that, a superficial aspect is there of the epithelium which is called as the apical part. So we are just seeing the basement membrane, which is having two components, the basal lamina and the reticular lamina. Reticular lamina will be more closer to the connective tissue layer, which is lying deep to the basement membrane, and the basal lamina will be exactly the product of epithelium itself. Then we have got a free end or superficial aspect, which is called as the apical aspect of the epithelium, which is exactly exactly connected to the fluid or air, and this will show certain modification. So it is also important that we should be knowing about the modification of the apical aspect of epithelium. We know that the epithelium has got one basal aspect and one apical aspect. According to the function to be performed, the apical aspect of epithelium is having microvilli, cilia, stereocilia and glycocalyx layer, which I am going to describe in the further images. So now we have talked so much about this. Now I just want everybody to see this image, which will help you to understand the parts of the epithelium. What I told you, the epithelium, these are the individual cells. The nucleus is in the is in the center, circular, and you can see they are interconnected to each other, and this interconnections or the junctions will also be described. Other than that, you can see the individual epithelial cells. So if these are the cells, if these are the epithelial cells, these epithelial cells are resting over basal lamina. Where they are resting? They are resting on the basal lamina. As I told you, they are resting on the basement membrane, which is having two layers, the basal lamina and the reticular lamina. Here reticular lamina is more closer to deeper connective tissue, and basal lamina will be the product of epithelium itself. Done? Now, I would also like to pay attention to the continuing with the list of the general features. So we have already discussed many features, but I want to add on few more details about the epithelium. Then we can go into the other structures. So let's start with the first feature. So I just want everybody to concentrate on the general features. So I would like everybody to concentrate on the first general features. Blood vessels and the lymphatics are found in the so if I talk about these blood vessels and lymphatics, it is not of its own, and there is no blood vessels and lymphatics which is found in the epithelium nourishment. So the other doubt which will be coming in your mind, that then how the epithelium is getting nourished. So epithelium is provided nourishment with the diffusion of the adjoining structures, adjoining tissues and supporting structures. It derive its nutrition and nourishment. So it is not having the arterial supply or the lymphatic drainage of its own. This is one of an important feature which you have to know about the epithelium. Continuing with the other feature, epithelium is having a good regenerative capacity. If I talk about this, your doubt will be it is not having the the vascular supply and lymphatics of its own. So how it is regenerating? By the process of diffusion, it extracts by the process of the adjoining neighboring structure, it extracts its blood supply and lymphatic drainage. Epithelium also invaginates and infolds and subsequently grow into the underlying connective tissues. So it can also act as a specialized gland. So that is an important function of epithelium. It is also have invaginations and infoldings, and it can grow. It has an additional features of growing in the underlying connective tissues. Now, talking about more, so functions of epithelium is also important. As in the classification part, I told you the epithelium function and its classification depends on which area the epithelium is performing which action. So either it can go for absorption function, it can go for the protection function, it can go for the secretion, excretion, lubrication, sensation, reproduction. So Osama said, ma'am, please embryology bhi karwa dena. So, a student is asking about the embryology session. Yes, dear, why not? Let me, I will complete today the whole of the histology, and then again I will have a session of embryology. So, the date is not fixed. Let me just check my engagements, and then I will tell you about which date I am going to complete the embryology part. The most important, exactly in one session from top to bottom, we can't complete the whole of it because embryology is a conceptual thing, but I will try to cover up most important topics of the of the embryology part, as I am today covering most important topics considering your entrance exam, not only for NEET PG, INI, CT, but also for FMGE exam. So Osama, is it okay? Now, So these are the functions, and the naming of epithelium will be also according to its function. Now, epithelium is derived from all the three germ layers. So this is talking about the embryology part. So epithelium, if I talk about the epithelium, it is derived from three germ layer. Okay. So we know that in the third week there is gastrulation process occurring, and we know that there is the formation of the three germ layers. So if I talk about this three germ layer, for example, skin, the epithelium is derived from the ectoderm. Respiratory and digestive system, the epithelium is endodermal in origin, and cardiovascular system, the epithelium is muscular in origin. So in other words, we can say it corresponds to the three germ layer. So exactly, again, we have come across all the details of the epithelium and its function, and we have come about its characteristic feature. We have talked about the important functions of the epithelium, how it is connected to each other, and how it is classified according to the function, and what are it is having no blood vessels and lymphatics of its own, and how it is embryologically derived of the three germ layers. So these are general features. So till now what I have told you about the epithelium is the general features of the epithelium. Coming to the intercellular junctions, so let's talk about, it's also important that you should be aware of intercellular junctions or junctional complexes of the epithelium. So if I talk about junctional complexes, epithelium is adherent to each other. So epithelium is quite adherent to individual cells. As I told you, epithelium is made of epithelial cells. So they are interconnected with each other, and there is not much space. There is no space through which somewhere there is some slits, which I will talk, and there is a connection via intercellular adhesion molecules. So there is intercellular adhesion molecules which is found in an interval between the plasma membrane of adjacent cells, and that is important, that which type of junctional complexes or the types of junctional complexes which is present in epithelium, which has to be known to it. So let's talk about that. Now, exactly if I talk about the junctional complexes, okay, so I just want to first enumerate it. So basically, I would like to first talk about the first junctional complexes. So this is the first junctional complexes, that is zona occludens. I will show you the image also, don't worry about that. Ashok Ram, ma'am, please take a separate class for healthy histology and pathology histology. Okay, so my dear, today is healthy, means the normal histology. What I am taking in the anatomical aspect is the healthy and the normal histology. And yes, Ashok Raj is absolutely right. If you are not going to understand the normal histology, then you are not going to understand the pathological aspect which we see under the microscope. So if you are not understanding what is the normal histology or characteristic feature of an important structures, how you are going to know the pathology, what changes histologically seen in the pathological aspect. So that is absolutely right, as Sokraj. So let's today concentrate on the normal histology. Okay. Okay. Now, the first of the junction which is seen in zona occludens, which is also called as tight junction. This junction, if I talk about the tight junction, it is located near the apical part of the cells. So as I told you, if I individually talk about epithelial cell, it is having an apical aspect and it is having a basal aspect. So on the apical aspect, we have got the zona occludens, and actually a very important point of this is that there is no space wherever there is zona occludens, there is no space, and it is the intercellular space between the cells are completely occluded. It is completely occluded and nothing can pass, and this is called as zona occludens. Okay, it serves as a barrier device. If zona occludens is behaving like this, it means it is a barrier device preventing the passage of materials through the intercellular space. And actually the other important point is zona occludens is present in the where zona occludens is present in the epithelium. Which structure? The answer is zona occludens is present in the intestine and that of urinary bladder. So again you can see here, as I told you, if you will see this diagram you can understand. So again, coming to this diagram, so in this diagram you can see this is the zona occludens or the tight junction. So this is zona occludens or the tight junction. So what I told you about the zona occludens, it is exactly located on the apical aspect, and here if you will see this area and this area, can you see there is a gap? So let me just enlarge this. So exactly what you can appreciate here in the apical aspect of the epithelium, that there is no space, for any of the structures, cells, ions to traverse. And you can see this is having a sealing effect, and it is completely adherent to each other, occluding. So the individual epithelial cells are completely connected to each other, and so only it is termed as zona occludens. So this is the first type of junction, which is also called as tight junction. So the another name which can be given to it is the tight junction. So it is also called as what? It is called as tight junction. So done. Now I will again show you another. So now the second, so now we will talk about the second one. Now the second type of, so now the second type of, now we are talking of the second type of cell junction, that is called as zona adherens. What is it called as? It is called as zona adherens. The junction, if I am talking about the location of zona adherens, the zona adherens is present immediately below the zona occludens. What is the location? We know that zona occludens are present in the apical aspect, and just going slightly or immediately below the apical aspect of the epithelium, we can see the adjoining cells are interconnected by the zona adherens. Okay. So opposing plasma membrane. So the next important point is, what is exactly the difference which is seen, what is the difference between zona occludens and zona adherens? When I am talking about zona adherens, there is presence of 20 nanometer gap. So there is a slight gap there. Okay, there is presence of slight gap there. Microfilaments, actins. If I talk about the microfilament, one of the microfilament is actin, and it is embedded in the dense plate, and it is also giving rigidity to the apical aspect of the cells. So that means when I was talking about the zona occludens, it was having no space. But if I am talking about zona adherens, this is a type of junction which is located below zona occludens, and here the opposing plasma membrane has got a separation of gap that is corresponding to 20 nanometers. And let me just show you the zona adherens. So in this image, if we see here, we have covered the zona occludens, the tight junction, and below it there is zona adherens, and we can clearly see that there is slight. In this case, there was no gap, but here you can see there is 20 nano. Actually, so many times this MCQ has been asked, the gap is 20 nanometers. What is the gap? The gap is 20 nanometers. Done with this. Now coming to the third variety. So now we are talking about the third variety, and this third variety is the macula adherens. What is its name? Its name is macula adherens. So it's very important for you to understand the two examples of macula adherens. One is desmosomes and other is hemidesmosome. Okay. Macula adherens, I can tell that one is the desmosomes and other is hemidesmosomes. Okay. Desmosomes is the third component of junctional complexes, and they are scattered over the lateral aspect of epithelial cells in the form of disc. So desmosomes are present in the form of disc. Okay, and they are present on the lateral aspect of epithelial cells. The opposing plasma membranes are separated here by a gap, and here the presence of gap is 30 nanometers, and it is also bridged by a transmembrane protein. What is the bridging material? The bridging material is transmembrane protein. Now, the junction is providing a firm junction, provide formings in the adjacent cells, and exactly these are present in the epidermis of the skin. Hemidesmosome. Now, what is the difference between desmosomes and hemidesmosome? So, both are type of macula adherens type only. So, here hemidesmosomes are just half of the desmosomes found in the basal aspect of epithelial cell, binding material just adjacent, subadjacent to the basal lamina. That means if I just want to give you brief about the macula adherens, it is of two types, desmosomes and hemidesmosome. Desmosomes are in the form of disc on the lateral aspect of epithelial cells, And in this case, the epithelial cells is having a gap of 30 nanometers, and the half of desmosomes is called hemidesmosome, which is more found on the basal surface of the epithelial cell. Now, I just want you to show this diagram. So, in this image, we have already talked about the zona occludens, the tight junction, the zona adherens, and the third one is macula adherens. You can see this is of two types as shown in the diagram. This is macula adherens desmosome. The gap is now 30 nanometers. It contains transmembrane protein, macula adherens on the lateral aspect of the cells, and half of the desmosomes is called as hemidesmosome, which is more closer to the basal aspect of the epithelial cells. So done. Now the fourth variety is the gap junction. Now we have got the fourth variety, which is called as the gap junction. The fourth variety is the gap junction, which is actually seen on the lateral aspect of epithelial cells, and it is also having this gap for the membrane, for the channels that is permitting the transmission of or the transfer of inorganic ions, other molecules from one cell to other. So actually they are acting as a exchange chemical messengers, you can say, in recognition and differentiation. They are also involved, not only this, not only the transfer of ions, they are also involved in the passage of nutrients which can be away from the cells. So that means they are acting as a transverse structures, which is called as gap junction. So what is it called as? It is called as gap junction. So you can see in this image the fourth variety, the gap junction, the nexus has been shown. So in important, you can see clearly that gaps are there for the transport of ions and nutrients. So done with this. So my dear, till now, so what we have done till now? So till now, if I am talking about the structures which we have seen, we have seen the definition of epithelium. We are knowing the what is the apical and what is the basal aspect. We have seen how the individual cells of epithelium is interconnected with each other. Now, before proceeding subsequently, actually, when I am talking about epithelium, we are talking about the entire body and its function at the different areas. Now, I just want that all of you please solve one MCQs related to this, which has been asked in the previous year of examination. And I think everybody will be able to answer. Can you tell me 20 nanometers of intercellular gap is found in following cell junction: zona occludens, zona adherens, macula adherens, or gap junction? Can anybody give me the answer? So we have just now gone into this details. Anyone knows the answer? Please give me the right answer here. 20 nanometers of intercellular gap is found in the following cell junction. So Ashok Raj, Osama, Vicky, Shri, Sachin. So anyone? Osama is telling the answer, and he told me the answer, zona adherens. What about others? What about others? Okay, Osama has given perfectly right answer just now. So yes, Roshan, Dr. Rajkumar Yadav, everybody is telling B, and all of you are absolutely right. Yes, the correct answer is zona adherens. Just now I have told you the yes, Shri, you are absolutely right, is zona adherens. Just now I have shown you in zona adherens, uh, 20 nanometers gaps are there. So 20 nanometers gaps are there in zona adherens. So I have shown you zona adherens is having 20 nanometers gap. Absolutely right there. Absolutely right. Now let's talk about the surface modification of epithelial cells. So the next is surface modification. The next is, I think the answer is B. Yes, Ashok, everybody is right. I will just give you a thumbs up. Yes, dear, everyone is right here. Now, surface modification. Now we will talk about the surface modification. So when we are talking about the surface modification, we have just now talked about the intercellular junction of epithelial cells. Next is to know what we see in the apical aspect. So that is according to the function. So one of its surface modification is called as glycocalyx. That is also called as cell coat or the fuzzy coat. So if I am talking about this glycocalyx, it is actually located over the absorptive epithelial cell, and it is rich in polysaccharides. So actually the most important function which everybody should know about glycocalyx layer is that it concentrates the ions before absorption, prior to absorption in case of intestine. What is the function? It is concentrating the ions. So before the process of absorption has to be done. So Rahul ma'am, please complete embryology also. Sure, I will complete it. Okay, I will complete it. Don't worry. So concentrate the ions. So what I am talking about, the function of glycocalyx layer is concentrating the ions prior to the absorption. Now the next is microvilli, that is brush border or striated border. Brush border or striated border. When we are talking about microvilli, it is in the form of brush border and striated border. Actually, the function of microvilli, so actually they are minute finger-like projection, and the function is, it is also found in, actually it is found in the intestine, and it is increasing the absorption. So transport of absorptions can be done, and this increase in absorption is the important function of microvilli which is seen. And when the microvilli is having a regular arrangements, okay, when this minute microvilli is having a regular arrangement, then they are called as the striated. And if it is having irregular arrangement, then it is called as the it is actually it is called as so we have got two types. We have got brush border and striated. So brush border microvilli has got irregular arrangements, and it is present in gallbladder. But if I am talking about the striated one, it is present in the case of intestine, and it is increasing the absorption. The function is it increase the absorption of the materials. So the next is stereocilia. So we have got two other modification on the apical aspect of epithelial cell. One is stereocilia. When I am talking about stereocilia, they are long microvilli. What are they? They are long microvilli. So they are long microvilli, they are thick microvilli, and the important function, the we are talking about stereocilia, it is present in epididymis. Where is stereocilia present? It is present in epididymis, also present in inner ear, and they are also increasing the surface of absorption. No motility is there in stereocilia. Now, if I talk about the cilia, they are longer hair-like projection which is having the if I talk about the cilia, they are longer hair-like projection which is having motility, and they are directing the structures. For example, if I talk about cilia, they are present in two important areas. One is fallopian tube and the other is respiratory tube. So in both this tube, the function is they are prevent. If I talk about the function in the respiratory tube, it is having motility, so they are not letting the important microorganism or any kind of infection traversing in the upper or the lower respiratory tract. So exactly if I talk about fallopian tube, there they have got a function of motility so that the fertilization can occur, and they, because of this, they can either the merging of the ova and the sperm can happen. So this is the major apical projections which is seen. The motility is only present in cilia. So done with this. Now we will talk about, now before proceeding to the next, I just want you to show this image. So actually this image is not histological image, but actually this is the electron microscopic image. I mean to tell that this is not exactly the H&E stain slide which you see in your histology lab, but this is the electron microscopic view where you can see the microvilli projections. You can see the stereocilias are longer and thicker than the microvilli. Cilias are actually, if we talk about, so these are microvilli, and these are another, these some are the long and some are short microvilli, and these are stereocilias, if it will be more thicker. And cilias is having the motility, and glycocalyx is just having the, it is also onto the intestine, it is concentrating the ions before absorption. Okay, please don't get confused with the thickness what is shown here. That is on other different uh, magnification. So that can vary, but stereocilia is thicker and longer than microvilli. Yes, Rahul, definitely I will cover up. I will let you know. So all of you, I will just let you know. Sure, I will let you know when I am going to take the embryology session. Okay. Now the thing is that let's complete the histological aspect. So again, I would like to show you this image where you can see the different apical projections. So I will like to show you an individual images. So see here, this is the microvilli. Okay, this is the microvilli and a very minute projections which has been shown here. So this is very minute projection which it is seen on the higher magnification only, and these are increasing the absorption. The major function is absorption. Okay, dear. Now here the glyco, so exactly here microvilli is also seen and glycocalyx layer is also seen. So you can see this is an higher magnification view where you can see the microvilli are there, and over the microvilli again for the concentration of the ions before absorption there is presence of glycocalyx layer. So this is electron microscopic view, and generally glycocalyx layer can be seen more clearly in the electron microscopic view. Okay. Now here we can see the stereocilia which are longer microvilli. So they are longer microvilli present in epididymis, and the other one is ciliated. The other one is ciliated epithelium where we have got cilia that is having motility and it is present in respiratory tract and also present in fallopian tube. Okay. Now we have done with this. Now we will talk about the differences between the cilia and the microvilli. The next important point is to know the differences between cilia and that of microvilli. So before proceeding to the further, I just want everybody to have a look on the basic differences which should be known between the cilia and that of microvilli. So as I told you, this is the diagram where you can see actually in microvilli we have got the microfilaments there. So you will just see this image. So here you can see in microvilli there is microfilaments, but in the case of cilia there is microtubules. Okay, resting on basement membrane as you can see in this diagram. The columnar epithelium with microvilli has been shown and the columnar epithelium with the cilia has been shown. The length is quite varying. The length of microvilli is just 0.5 to 1 micrometers, but if you will see the length, so if you will see the length of cilia, it is 5 to 10 micrometers. Thick diameter is also different. It is just 0.1 in case of microvilli, but it is zero point 0.2 in case of cilia. Non-motile. So motility is not in microvilli, but motility is present in cilia. Then if we talk about the central core, it contains microfilaments, but if we talk about the constituent of the cilia which is having motility is by the microtubules having 9 to 2 arrangements. Function absorption function is transport in one direction. Examples of microvilli, it is present in PCTs and intestinal epithelium. It is present in ependyma, respiratory tube and uterine tube. So now you must be wondering what is ependyma. So please don't get confused. If I talk about ependyma, it is actually the lining which is seen in the ventricle. So in the central canal of the spinal cord or in the inner of the ventricles of the brain, we have got the ependyma, and ependyma is also lined by ciliated columnar epithelium. So that means cilia is present in. So my dear students, if we have to revise, microvilli is present where? The answer is microvilli is present in the microvilli are present in intestine, it is present in PCTs, it is also present in gallbladder. But if I am talking about cilia, which is having motility, it is present in respiratory tube, it is present in respiratory tract, and it is present in fallopian tube, which is also called as uterine tube, and that of ependyma present in the ventricles and present in the central canal of the spinal cord. Now the next is classification of lining epithelium. So next is classification of line. So epithelium, if I talk about it, is classified by the number of cells and how many layers of it is present. So epithelial tissue, just I am enlarging, see this. Epithelial tissue is classified into following types. It can be either simple epithelium or it can be a compound epithelium. So we have two varieties of epithelium. One is simple epithelium and another is compound epithelium. Why the simple epithelium means it is single layered, it is not multiple, and that classification of the name depends on the cell shape and size, So it is of following varieties. It is of squamous epithelium, flattened epithelium, it can be of cube shape, so it is cuboidal epithelium. Columnar shape, the columnar epithelium. Ciliated means also having the presence of cilia on its apical aspect. Pseudostratified epithelium means it is also single layered, but it appears because of the different location of nucleus multiple layered. The compound epithelium is multiple layered. It can has the multiplication of layer in the form of stratified compound, or it can be having multiple layer in the form of transitional compound epithelium. The next variety is glandular epithelium, where the function of secretion is also there. So now we will talk about the based on the shape and size, we have got different varieties of the epithelium. So one by one I am going to talk about individual. So let's first talk about the squamous epithelium. Squamous, the word squamous means flat. The word squamous means flat. The cells are flat, as you can see the surface view. This is the basement membrane on which this epithelial cells are resting, and you can see it is more of flat resting. Underlying layers are consist of connective tissue layer, lamina propria. So, and the cuboidal epithelium, as you can see the epithelial cells, if we talk about just the epithelial cells and the individual epithelial cells, you can see it is cube like. What is it? The shape is cube like. The nucleus, here you can see the nucleus is more onto the basal aspect, but here it was not exactly circular, it is like flattened. But if you will see the nucleus of cuboidal, it is circular and it is in the center, resting over the basement membrane, and which is overall resting over the connective tissue layer, the lamina propria. So we have got these. So firstly I am going into the discussion of these two epithelium, the simple squamous epithelium and the simple cuboidal epithelium. I would like to tell you the examples where we find simple squamous and simple cuboidal epithelium. So let's start with the simple squamous epithelium. Now, simple squamous epithelium means it is consists of single layer of flat cells. What it is consists of? It is consists of single layer of flat cell which is lying in the contact of basal lamina, and it is resting over the basement membrane. The type of epithelium is often permeable and occur molecules need to pass quickly and can be quickly pass quickly through the process of filtration or the process of diffusion. So this is the function of simple squamous epithelium. Now, simple squamous epithelium, where it is present. So the example of simple squamous epithelium is following, and this is the most important point. So why I'm telling you about this is that the reason is that the example of each type of epithelium is very important for all type of competitive exam. So exactly it will be present in lining. It acts as a lining epithelium. So it will be present in the lining of it will be present in the alveolar lining of the lung. It will be present in the blood and lymphatics. It will be present in the lining of pericardium, pleura. So what you can say, we have got the lining of lung, covering of the lung is pleura, the covering of heart is pericardium, alveoli of the lung, all these blood vessels, lymphatics, pleura. So all these are the examples of simple squamous epithelium. I just want everybody to see the diagram where you can understand the presence of this epithelium. Also, it is present in the peritoneum. So, it is just repeated here. You can just write here. The same thing has been repeated. So, you can just, it is also lining, it is present in the lining of peritoneum. That is called as mesothelium. Mesothelium, it is present in mesothelium, that is the lining of the peritoneum. Now, here you can just see this image where you can see the flattened epithelium has been shown, and you can see it is present in the lining of the peritoneum, which is the single layer mesothelium. Also in the blood vessels lumen, you can see the flattened epithelium with flattened nuclei has been seen. Okay, so this is again the other example where we have found the epithelium. So what is the two varieties of epithelium found? What is the right answer or the example of simple squamous epithelium? It is found in the mesothelium, it is found in the pleura, it is found in pericardium, it is found in lung alveoli, it is found in the lumen of large blood vessels, lymphatics. Now, simple cuboidal. Next is simple cuboidal epithelium. Now again the word simple comes. Whenever I am using the word simple, what does it mean? Simple means single layer, means it is single layer. What is the shape of individual cells? It is the shape is cuboidal. So the cube-like shape with a large and spherical central nucleus. So there's a cube-like cell with a large and center nucleus. So it will be spherical and center nuclei is lying there. And other than that, these cells provide protection, and it's very important that they are giving protection, and also active or passive structures can pass in and out. That is another function of the simple cuboidal epithelium. Now examples are, again, what is very important for you or examination purposes, you should be knowing the examples for the MCQ. So we have finished with the examples of simple squamous epithelium. Now talking about the examples of simple cuboidal epithelium, where it is present in PCTs. What do you mean by PCTs? Proximal convoluted tubule. It is present in proximal convoluted tubule. It is present in distal convoluted tubule. It is present in some parts of loop of Henle. It is present in the pigment layer of the retina. It is also present in thyroid follicles. It is present in germinal epithelium of ovary, and also it's in the ducts of exocrine gland. So it is also present in small ducts of exocrine gland. So these are the various locations where we can found the simple cuboidal epithelium. PCTs, DCTs, loop of Henle, pigment layer of retina, thyroid follicles, germinal epithelium of ovary, and small ducts of exocrine gland. Is it okay? Okay. Now let's talk about the columnar epithelium. So in case of columnar epithelium, I just want everybody to understand we could have two varieties. One is simple squamous. So one is just the simple squamous which you are seeing. So you can see the individual cells shape is column like. The nucleus is slightly elongated. As you can see, the nucleus is slightly elongated and located towards the close to the basement membrane. Lamina propria, they are resting on the basement membrane, and the other is columnar epithelium, which is having cilias also. So we can see here, these are the projections, motile projections which you are seeing here is the cilias. These are cilias. These are the cilias, and here, so either the columnar epithelium can be simple or it can have cilias for the motility, and the nucleus is elongated close to the basement membrane. This is the basement membrane, and which is located adjacent to the lamina propria. So we have to know the example of each variety because both are important. So I just want to first show you this. Okay, before proceeding to so actually I didn't show you the simple cuboidal epithelium images. So I just want, before proceeding to the next one, I just want, these are showing you simple cuboidal epithelium. So just I have told you that simple cuboidal epithelium is present in the thyroid follicle, it is present in the PCTs, it is present in germinal epithelium. So I just want you to show the images for it. So you can just see in this category, I just want everybody that this cube-like structure which you are seeing, the cube-like epithelium, this is the example of simple cuboidal epithelium. In the germinal epithelium, the nucleus is rounded. Okay, okay, Ashok Raj. Okay, now in thyroid follicles, actually when you will see, this is the colloid. So in case of thyroid follicle, what you can appreciate that this is the colloid, this is colloid, this is colloid, So this is exactly the colloid, and colloid is surrounded by follicular cells. So here we can get the follicular cells, and here again in the larger picture or in the enlarged view or in the higher magnification, what you can see, this is cube like, the nucleus is spherical in the center. Yes, so the nucleus is spherical in the center. So this is the nucleus which is spherical in the center. Okay, now another example of kidney tubules. So here in the kidney tubules also you can see in the PCTs and DCTs we have got, and you can see this cube-like structure is the simple cuboidal epithelium, and the nucleus is exactly in the center. Okay, so done with this. Now coming to simple columnar epithelium. As I told you, simple columnar epithelium, one by one we will talk. We will talk about simple columnar epithelium firstly, then we will talk about simple columnar epithelium having ciliated epithelium. So simple columnar epithelium, the shape of individual cell is like a cube. Okay, it is having slightly elongated or oval or elongated shaped nuclei which is located in the basal region. Simple columnar epithelium can be further categorized. So we have to know where is simple columnar epithelium located and where is the ciliated columnar epithelium located. So both is important for you to understand. Both variety is important for you to understand where is simple columnar epithelium located and where we have got ciliated columnar epithelium located. So exactly when I am talking about the tuft of cilia which is motile, it is an apical extension of the epithelium, helps in this tiny hair like structures, helps to move the mucus or substance away from the getting entry into the respiratory tract inside. Now when I am just talking about simple columnar epithelium, again important for example without cilias, the important example of simple columnar epithelium where it is present, the answer is it is present in the lining epithelium of stomach, both the fundus pyloric, intestine means lining epithelium of duodenum, jejunum and ileum, large intestine, colon, gallbladder and the collecting tube. Yes, so the gallbladder is also having columnar epithelium with brush border microvilli. So gallbladder and also in the collecting tubules. Now here I just wanted to show the histological image taken from the GI tract showing you the how the simple columnar epithelium will be seen under the microscope. So I just want to enlarge it. So when I am enlarging it, you can see this is the column like simple columnar epithelium. The nucleus is towards the close to the basal aspect. Okay, so this is the apical surface, this is the simple columnar epithelium, and this is the nucleus which is close towards the base. Okay, now columnar epithelium with microvilli. I told you microvilli is present. If I am talking about the apical projection in the form of microvilli, I told you microvilli can be either striated or can be brush border. So when I am using the word brush border, that means the microvilli regular arrangement. So both is having microvilli projection, but if the microvilli arrangement is in the regular pattern, it's a very regular pattern, and then it is called as striated microvilli. And when the microvilli is a irregular projections from the apical part, then they are called brush border. So brush border microvilli with columnar epithelium is present in brush border microvilli will be present in PCTs of the kidney. Mainly PCTs is having cuboidal epithelium, but if I am talking of brush border microvilli, it will present in gallbladder and PCTs of the kidney. Is it okay? Examples you have to know. Now columnar epithelium with microvilli, so you can see a very tiny, very tiny projections which will be seen, a very tiny projections which will be seen here. So these are a very tiny projections which will be seen. These are all microvilli increasing the surface absorption. Okay. So simple columnar epithelium, cross section small intestine for absorption, microvilli on the surfaces. Done. Now ciliated columnar epithelium. Next is ciliated columnar epithelium. That means the apical projection is having the cilias, and the ciliated columnar epithelium is present in following locations, and this is having motility. The important the important examples, again important for MCQ, so many times it has been asked. Ciliated columnar epithelium is present in respiratory tract, it is present in fallopian tube, uterine tube, and it is present in central canal lining of the spinal cord. So when we have seen in the neuroanatomy the cut section of the spinal cord, so in this spinal cord cut section, in the center there is central canal which is lined by the ependyma, which is called as ciliated columnar epithelium. Also we have got the lining epithelium in the form of ciliated columnar epithelium in the case of, so we have got in the case of ventricles of brain. Okay dear. Now, so I just want everybody to see this image, so to understand the cilia. So one is the fallopian tube and the other is respiratory tract. So here you can see this is exactly the fallopian tube interior, and this projections which you are seeing is in the form of cilia. So this is the luminal aspect of the fallopian tube. Fallopian tube will have a star shaped luminal aspect which is also having ciliated columnar epithelium. Okay, ciliated columnar epithelium, and clearly this is actually high power view. So actually this is the low power view, but in the high power view of the respiratory tract you can clearly see the cilia. So these tuft like projections which you are seeing is the cilia. So got it. Now I just want everybody to know about Eustachian tube. So what is Eustachian tube? So why I have included this example of Eustachian tube, which is also called as, what is the other name of Eustachian tube? The other name of Eustachian tube is auditory tube or pharyngotympanic tube. That means the auditory tube or the pharyngotympanic tube will have two communications. The one to the middle cavity and the other to the pharynx. So Eustachian tube is lined by ciliated columnar epithelium. So this ciliated columnar epithelium will be present at which aspect? It will be present towards the tympanic cavity or middle ear cavity. The other end is the pseudostratified ciliated columnar epithelium. The pseudostratified ciliated columnar epithelium, which will also have the goblet cells, will be present near the pharynx. So just to make you understand, Eustachian tube, which is also called as auditory tube, is a tube forming communication between the middle ear cavity and that of the pharynx. Okay, so we have got two communications. One is the communication which is having which it communicates with the middle ear cavity, and the other is the pharynx. Two types of epithelium is there. Two types of epithelium. So towards or closer to middle ear cavity, ciliated columnar epithelium, the one we were studying now, and the other is pseudostratified ciliated columnar epithelium with goblet cells near the pharynx. Is it okay, everyone? This is very important, and a twisted kind of question can come for the MCQs for the histology. So that means you have to know, in this case you have to know the two types of epithelium present in auditory tube. Now I just want everybody to see this image. So when you are seeing this image, let me slightly enlarge it. Okay, so I just want everybody to see the auditory tube. So I am highlighting the auditory tube. So let me just enlarge. Yeah. Is it okay? Yeah. So just concentrate on the auditory tube. So what is it? This is the auditory tube. So what I have highlighted here, the auditory tube, pharyngotympanic tube, Eustachian tube, and here you can see this part is the pharynx. What is it? This is the part of pharynx. So that means auditory tube is communicating with the pharynx, and here we can see the middle ear cavity. So here we can see the tympanic cavity at the other end. So just we will have the tympanic or the middle ear cavity as the other end and the pharynx at the other end. and this auditory tube is the communication. So it is having two types of epithelium, the one type of epithelium which will be closer to the pharynx, and the other type of epithelium will be closer to tympanic cavity. Already discussed the tympanic cavity epithelium will be ciliated columnar epithelium, and pseudostratified ciliated columnar epithelium will be close to the pharynx. So I think it is clear to you. Now we will talk about the other one, which is pseudostratified epithelium. Now the word pseudo, what do you mean by the word pseudo? Means false. Okay, false. It is not true. It is having the multiple layers, which is it's appearing when you see under the microscope. You appear that these epithelium is multiple layer. Actually, that appearance, the reason of that appearance of multiple layer is due to the presence of the nucleus, which is at a different location. So we will have pseudostratified columnar epithelium, which is having cilias, which will have the cilias, and here you can see this is the goblet cells. Here you can see the nucleus is at the different level. So we have the cilias and these are the nuclei. So here the nuclei, the location of the nuclei is at different level, and that gives an appearance of multiple layers. But in reality or the truth is that the epithelium is single layered only. Okay. So here you can see pseudostratified columnar epithelium with stereocilias. Anyone is not understanding anything, Ashok Raj, Rahul Kumar, Shri or Shama, any students which who are not understanding anything, they can ask their doubts. Okay. Now, which we have already talked, that it is the definition of pseudostratified columnar epithelium has been shown here, and we have already talked it is single layer. Due to the appearance of nucleuses at the different location, it appears multiple layer, but the reality is not that it is not stratified. Now the example. So what I told you for your MCQs, it's very important that you should know the example of such kind. Where is the pseudostratified columnar epithelium present? The location where we will have the pseudostratified columnar epithelium, it is present in the part of male urethra. It is present in olfactory epithelium. Not only that, it is also present in the lining epithelium of auditory tube, Eustachian tube, and we have talked it is near the pharynx opening in the auditory tube. It is present in the trachea. It is present in epididymis and ductus deferens. What is the other name of ductus deferens? Rahul, Ashok Raj, Sri, anyone who is all are live, but exactly with pace in the live session. I just want what is the other name of ductus deferens? In the pelvis part, we have talked about that, the pelvic anatomy. So ductus deferens, yes, it is also called as vas deferens. What is? It is also called as vas deferens, yes. It is called as vas deferens. Ductus deferens is also called as vas deferens. Okay, ductus deferens is also called as vas deferens. So yes, Supriya Sharma, you are absolutely right. Yes, Supriya, you have given absolutely right answer. So that means each and every. So actually this list of epithelium examples and images has been taken from multiple books, so that your concept of lining epithelium, the example of each variety, because in other words, when the first topic of histology which I am taking is epithelium, in other words, what it means that the entire histology part will come in this session. Okay. All the example where pseudostratified columnar epithelium is present, you have to know: trachea, Eustachian tube, epididymis, ductus deferens, olfactory epithelium, male urethra. Now here you can see the slides. Here you can see the slide of epididymis, where we have seen the stereocilia, the longer microvilli, non-motile. Pseudostratified columnar epithelium with stereocilia. One more example is showing you the epididymis, where the stereocilias are the non-motile. The non-motile epithelium, the non-motile apical aspect is stereocili, and also you can see the nucleus are aggregated at a different location, as you can see. So it is appearing multiple layered. So both examples and the images has been highlighted for you. So just go through this. Okay. Now moving to further, actually pseudostratified ciliated. So exactly just to make you go through this, And just to quickly summarize this, we have got one is ciliated columnar, one is pseudostratified ciliated columnar, and another is non-ciliated pseudostratified. So the difference and the example is important for your MCQ. So both of it is important for you. Okay, so one is non-ciliated pseudostratified columnar epithelium. If the MCQs come that which of the following is non-ciliated pseudostratified columnar epithelium, the answer will be prostrate and in the part of membranous part of the vas deferens. Okay, membranous. So prostrate and the membranous part of male vas deferens. So non-ciliated pseudostratified columnar epithelium examples, and ciliated pseudostratified will be present in respiratory tube lining of trachea and upper respiratory tract, also in the part of principal bronchus. So pseudostratified ciliated in the part of respiratory tract, trachea and the principal bronchus, and non-ciliated will be present in part of prostate and vas deferens. If the question comes like pseudostratified but it is having stereocilia, then the example becomes epididymis. Epididymis. Stereocilia of epididymis is not cilia. Their cytoskeleton is composed of actin filament. The structure and molecularity is more similar to microvilli than the true cilia because both microvilli and stereocilia are non-motile. Pseudostratified epithelium are forming straight tubular glands also in the endometrium part of the females. They are found also in the internal part of ear. So I just want everybody to go through all these examples because not a single question will be missed out. If you are going into such detail, not a single question will be missed out. Okay. Okay. Now moving further, can we have one MCQs here, everyone? So let's go, let's solve one MCQs, image based MCQ. So I just want everybody to just solve one image based MCQ related to this topic. This has been asked in the previous year of INICT examination. So see here. Previous year NEET PG INICT examination, one of the question MCQ I want to discuss, the histopathological specimen from the autopsy of 24-year-old patient is shown in the image below. The given structure is not found in. The given structure is not found in which of the following location? Fallopian tube, epididymis, bronchi, or that of ependyma. Okay. So please mark the right answer, dear. Waiting for your answers. I will come to that. Okay. One of the student has asked me about Bartholin gland. So I will come to that. Don't worry. So yes, Supriya, don't worry. I will give your answer. And here actually you have to give me the right answer. So Roshan Yadav has given his answer. What about others? So actually if you want, I can enlarge this image. So you have to identify the arrow marked area. You have to identify the arrow marked structure. So Roshan Yadav, Dr. Supriya, please give your answer. What is this? Can you tell me what is this arrow marked structure? Firstly, identify that and then tell me the right answer for this INICT NEET PG question. The histopathological image of autopsy from 24-year-old patient is shown and the structure is not found, means not found. So Roshan is telling A. Now A, Roshan. So actually if you are not able to identify the image also, you can give me the right answer. because the three will have similar kind of epithelium and the one is odd man out. So that is also giving you the right answer. Yes, yes, absolutely right. This is cilia. This is cilia. Now tell me, cilia is present in which, or cilia is present where? Cilias are present, I have told you already, ciliated columnar epithelium, or the cilias are present in case of respiratory epithelium. It is present in respiratory tube. It is present in fallopian tube. It is present in ventricle lining of the brain and central canal. So it is also present in ependyma. What is ependyma? Ependyma is ciliated columnar. Yes, Supriya, you're right. Ependyma means ciliated columnar epithelium is present in the case of lining of central canal and ventricles of the brain. So which is the odd man out? Epididymis. Can anybody tell me what is the lining epithelium is of the epididymis? What is the lining epithelium is of epididymis? So all other options is having cilia. So the structure not found in epididymis. So this is also having cilia. Bronchia is also having cilia because it's a part of respiratory tube, and ependyma is also lined by cilia. So epididymis is the odd man out. And what if you, I just now told you the lining epithelium of epididymis is not cilia, it contains stereocilia. So just now, if you come to this, can you see epididymis lining is stereocilia. It is not cilia, it is stereocilia. What is the lining? It is stereocilia. So definitely the right answer will be, if you are confused with the image, then what is the hint which will give you all the other three? So epididymis is having the lining stereocilia. All the other three is having cilia. So the odd man out will be definitely stereocilia. Yes, doctor, you are right. Everybody, please let me know, have you understood? So there are two ways of identification. One, you are 100% sure that this is cilia, but at times what happens, there is not a comparison images, so you can get confused also whether it is stereocilia or cilia, because the entire part of the histological section is not given, where you will have the other characteristic feature to identify the slide. But the odd man out can also be the right answer. So here, fallopian tube, the bronchi, ependyma, all will have cilia. So definitely the right answer or the odd man out will be the epididymis. Is it okay? Can we proceed next? Everyone, can we proceed further? Okay. So stereocilia, pseudostratified ciliated columnar. When I am talking about pseudostratified ciliated columnar epitheliums, you can see the cilia, you can see the nucleuses, you can see it is resting over the basement membrane adjacent to the loose connective tissues. The nuclei is multiple layered and the cilia is a fine motile projection from the apical part of the epithelium. Now what remains? The next layer is stratified. What do you mean by the word stratified? Multiple layers. So firstly, I would like to explain what is stratified. Stratified means multiple layer. The epithelium is one layer more. The epithelium is more than one layer. And here stratification can be in the form of different. So we will call it as stratified squamous. We can call the epithelium as stratified cuboidal, stratified columnar, basis on the basis of the outermost layer. So stratified squamous epithelium means the squamous flattened cells are arranged upon the basement membrane. Upon the basement membrane. One layer is in contact with the basement membrane and other layer will adherent to each other to maintain the structural integrity. Now, stratified squamous epithelium, if I am talking about stratified squamous epithelium, it can be either non-keratinized, where there is no additional deposit of the keratin, or it can be keratinized. The other is it can be keratinized. So, there is no keratin deposit here, multiple layered. And the other example is keratinized stratified squamous epithelium. So this is keratinized stratified squamous epithelium where there is an additional deposit of keratin protein. Okay. Now in our body, so stratified squamous and keratinine both has keratinized stratified squamous epithelium has got an important function. It is multiple layer. It is giving protection. So you have to know the example. So when I am using the word stratified squamous epithelium, So we will have following examples of it. We will have stratified squamous epithelium is present in external ear. It is also present in cornea. It is present in conjunctiva. So basically, stratified squamous non-keratinized epithelium will be closer to the external aspect and the skin, and exactly towards the skin will be keratin deposit. So it will be closer to an opening or closer to the outer aspect. So external ear, cornea, conjunctiva, nasal vestibule, oral cavity, tongue. So tongue, here you can write except the filiform epithelium, except the filiform papilla. So why not filiform papilla? Because in the filiform papilla will have keratin deposit. So the odd man out is filiform papilla, part of the tongue which will have keratinized epithelium. The other part of the entire tongue is stratified squamous non-keratinized epithelium. The palate, the tonsil, the epiglottis. So the palate, the tonsil, the epiglottis, oral aspect, the terminal part of anal canal, and that of the vagina and terminal urethra. So all these structures, if you will see closely how to memorize this entire list, this all structure, is the esophagus included? So esophagus also, dear. So esophagus is also having stratified squamous non-keratinized epithelium. So this will be closer to an external opening, close. They will be not exactly at the level of external opening or the skin, because if it is at that location, then it will be having keratin deposit. So all these structures, the few structures of the iris and cornea, conjunctiva, nasal vestibule, esophagus, the external ear, the terminal part of anal canal, vagina, the tongue except the filiform papilla, the tonsil, the palate, the epiglottis oral part, and terminal urethra. Now we will just see an cut section. Stratified squamous epithelium, the upper 1/3 of the esophagus has been shown, and here you can see, if you go to, if we see the esophagus enlarged view of this low power view, we can see this is the epithelium. So is this epithelium single layer? Definitely no, not. This is multiple layered stratified squamous non-keratinized epithelium, and this is the lumen of the esophagus. Okay, now coming to the stratified squamous keratinized epithelium. So it's also important that we should have an idea of keratinized epithelium. So keratinized epithelium means exactly the skin. We know the skin is made of epidermis and dermis. So skin, the mucocutaneous junction of the lip and nostrils, the distal part of anal canal, the outer aspect of tympanic membrane, the gingiva, the hard palate, and the filiform papilla of the tongue. So all these are example of stratified squamous keratinized epithelium having an additional deposit of keratin. All these list. So my dear students, I have provided you the list of all these structures and the example which will be asked in the examination and all the competitive exams. So it is very important that you should go through the entire list. Now this is the histological section of the skin. So here we can have the stratified squamous keratinized epithelium, where a keratin deposit has been keratinized, dead cells, keratin deposit is there. Also the layers of the epidermis has been shown. So it's a multiple layered. Now, as I told you, stratification can be as stratified cuboidal and columnar. So when I am using the word stratified cuboidal, it is a type of epithelial tissues which is mainly found in the glands. So at certain areas where absorption and slightly larger ducts की बात करेंगे, so at that location we will have stratified cuboidal epithelium. So you can see the here we can see stratified cuboidal multiple layer, the cells are cube like. And if we talk about the stratified columnar, you can see the superficial aspect, the multiplication of the cells on the superficial aspect, it is column-like. So we have to know the example of stratified cuboidal epithelium, and we should also know the example of stratified columnar epithelium. So let's start with this. So actually I would like to give you the list of structures and then we will come to this. Stratified cuboidal epithelium, as I told you, it is present in exocrine ducts of following structures. So it is present in the exocrine duct of lacrimal duct, salivary duct, sweat gland. So please note down, not very close to the SNI or smaller one, slightly larger than that is the exocrine ducts of lacrimal, sweat gland and salivary gland. Also in this diagram, if you will see, the ducts has been shown. So these has been the ducts. So ducts of salivary gland, ducts of sweat glands, lacrimal gland. You can see the nucleus is rounded center and the stratification is in the form of cube-like. Stratification is in the form of cube-like. So on closer view, you can see this is cube shape. So this become an example of stratified cuboidal epithelium. Now coming to stratified columnar epithelium. If I am talking of stratified columnar epithelium, it is a type of epithelium tissue composed of column type of cells having multiple layers. So it is found. Where is the stratified columnar epithelium present? So it is found in following location, which is again important for you to note down for your examination. It is present in the parts of male urethra, it is present in the anal margin, it is present in the pharynx and conjunctiva. Okay, and very large duct. If we are talking about largest duct of salivary gland and all, stratified columnar epithelium can be present. So, okay, now stratified columnar epithelium, if you will see, this is the stratification is like this. Two nucleuses. So stratification, columnar epithelium. Here also the outermost epithelium, if you will see, outermost apical aspect, it is columnar, and then there is more of the epithelium. So stratified columnar epithelium is found in the largest exocrine duct. It will be formed, it is in the largest exocrine duct, which is more closer to the secretion. So the largest exocrine duct. Other will be the conjunctiva, pharynx, anus and male urethra. Now I just want everybody to know about the lining of male urethra, because different part of the male urethra is having different types of epithelium. Prostatic urethra, if I am talking about the prostate urethra, which is lying very close to the, if I am talking about the prostate urethra, which is lying very close to, that of prostate is the which is surrounded by the prostate, the part of the urethra which is surrounded by wedge-shaped structure. The prostate is transitional epithelium. Again important for MCQ, what is the lining of prostatic urethra? Membranous urethra can have pseudostratified or stratified columnar epithelium. Penile urethra will have pseudostratified columnar epithelium, and distal most part will have, as we have already talked in the list of stratified squamous non-keratinized epithelium, the distal most or the terminal part of urethra will have the lining epithelium of stratified squamous epithelium. Now lining epithelium of the female urethra. When we are talking about female urethra, the lining epithelium will be stratified squamous, pseudostratified columnar, and occasionally it will be transitional epithelium. A gradual change from squamous to columnar occurs with the advancing age. Most of the part it is having squamous. So exactly at the external aspect, exactly at the external terminal part, it will be of squamous variety. Now coming to the again and another layer of type of stratified epithelium. So if I am talking about stratified epithelium, which is having multiple layers. So when I am talking about multiple layered of epithelium, this is of transitional variety. Actually, it is having the stretchability. It can be stretched. Transitional epithelium can be stretched. It has got number of layers will vary according to the phase of for example, transitional epithelium, which is also called as urothelium, it is present in urinary bladder and ureter. So actually you can see the outermost cells will be umbrella cells, And here you can see it is resting, it is having basement membrane resting on the lamina propria, and this is the umbrella cells, which is the outermost layer, which is the ballooned out epithelium. Transitional epithelium is a type of stratified epithelium, which is again having multiple layers, same as the transitional epithelium. Only the difference is that transitional epithelium is having the adaptivity to get stretched, so it can be of multiple layer and it can be distended also. Transitional epithelium lines the inner aspect of urinary system and so called as urothelium. Now, actually, for example, if I take the example of urinary bladder, so at the different phases, whether it is in the resting phase or whether it is in distended stage, the lining epithelium layers varies. Also, it function as a barrier between the lumen and the hollow structure inside. Transitional epithelium is having connection with the tight junction, so that there is impermeability to the neighboring cells. The barrier will prevent the reabsorption of toxic waste, which has to be eliminated out. Okay, which has to be eliminated out. Okay, yes, I got Supriya Sharma, your Bartholin gland. I'm coming up with it. Supriya, I remember your Bartholin gland. Please just let me complete the transitional epithelium. Then Supriya, I will tell you about the Bartholin glands. Transitional epithelium is lines. So where it is present in the part of urethra, it is present in ureter and urinary bladder. So it lines the prostatic urethra. Just now I told you the part which is it is lining the prostatic, it is lining the prostatic epithelium, prostatic urethra epithelium, and you can see it is multiple layered with the outermost layer called as cells called as umbrella cells. So the outermost cells are called as umbrella cells. Here you can see the transitional epithelium. One is the distended stage and the other is collapsed stage. The distended stage is just having 2 to 3 layers, but the resting stage, as you can see, if we are talking the resting stage, the outermost cells are umbrella, umbrella cells, U for umbrella cells, and it is 5 to 6 layers. So if we talk about the layers, so here there will be 5 to 6 layers. Now we will come to the MCQ, but before moving to the MCQ, I just want to answer one of the questions asked by Supriya. What about Bartholin's gland? So she just want me to answer about Bartholin glands lining epithelium. So if I talk about Bartholin glands, it will have different lining epithelium in the duct and that of the gland. So please write down the lining epithelium. One of the question has been asked from Supriya. So write down Bartholin gland. Okay. So the gland, if I talk about the duct, the duct of Bartholin gland is lined by stratified squamous epithelium, stratified. And the gland is lined by columnar epithelium. The gland is lined by columnar epithelium, but the duct is lined by stratified squamous epithelium. Is it okay, Supriya? You just wanted to know the lining epithelium Bartholin glands. Please note down. The gland is by simple columnar epithelium, but the duct is by stratified squamous epithelium. So can we solve an MCQs? Okay, Supriya, now let's solve an MCQs here. Transitional epithelium, it is again a question of INI-CT NEET PG exam. Transitional epithelium is present in, I just want everybody, that doesn't mean that FMG student has not to listen this session. Actually, now the bar of FMG examination is also increased, is similar to NEET PG. That means you have to also know about epithelium. Okay, if you have got time, and I just want everybody, please go to the important aspects. So like epithelium, cartilages, lymphoid structures, GI tracts, respiratory tracts, all that histology part is very much important for the FMG aspirants also. Other than that, I have summarized overall epithelium in this session. Today my target is to complete entire epithelium. So we will just cover the entire epithelium, which is important for NEET PG and INICT exam. So I got an answer from Supriya Sharma, and Supriya Sharma is definitely giving a right answer here. Yes, absolutely right, Supriya. What about others? These all ureter, renal pelvis is also the initial part only where the ureter is starting. Minor callus, all these is having transitional epithelium. And the structure which is not having transitional epithelium is the membranous urethra. Just now I have told you about, so the correct answer is membranous urethra. Just now I have told you also the membranous urethra is not lined by transitional epithelium. Transitional epithelium lines the part of prostatic urethra. If you will see, I have just given you the list. Please have a look once again. So I just told you the transitional epithelium lining is present in prostatic urethra. Membranous urethra is lined either by pseudostratified or stratified columnar epithelium. Now I just want that everybody should have a quick revision of urothelium, that is called as transitional epithelium, at which location the lining epithelium varies. So urothelium is a specialized epithelium that lines the urinary tract, and it is preventing the toxic structures which is present in the urine, which will distort the epithelium. So that is prevented because of multiple layered, and the extent will be, please note down, the extent of urothelium is, it is extending from the ends of collecting tubules. So from the ends of collecting tubules of the kidney to ureter bladder till the level of proximal part of urethra. So till the level of proximal part of urethra, we have got which type of epithelium? We have got transitional epithelium. In males, it lines as far as ejaculatory duct. So ejaculatory duct, also it is replaced by the why membranous urethra is not having transitional epithelium? Because at the level of membranous urethra, only the prostatic urethra is lined by transitional epithelium. At the level of membranous urethra, it is lined by stratified columnar or pseudostratified columnar epithelium. So this is exactly showing you the multiple layers here of transitional epithelium. Now, one more question is there. This I will explain you. I'm just asking. Otherwise, what is the lining epithelium of epiglottis? Actually, epiglottis part I'm going to explain in the second part of histology, where I will explain about the double-edged sword, that is epiglottis having two types of epithelium. Actually, epiglottis is having two types of epithelium, and here the question which has been asked is epithelium lining on the lingual surface of epiglottis. Epithelium lining on the lingual surface of epiglottis, whether it is simple columnar, whether it is pseudostratified ciliated columnar, whether it is simple cuboidal, or whether it is stratified squamous epithelium. So what is the right answer? Wazir has given his answer as D. What about others? What about others? Just waiting for others, otherwise I will come up with the answer. So Wazir, Doctor again has given the answer, Wazir has given the answer, Doctor has given the answer, and they have given absolutely right answer. Absolutely right. The lingual aspect. So the lingual aspect, if we are talking about the lingual aspect, not the respiratory aspect, epiglottis. What is epiglottis? Can anybody tell me? What is epiglottis? It is a part of which structure? Epiglottis is the cartilage of which structure? So epiglottis is unpaired laryngeal cartilage. It's an unpaired laryngeal cartilage which is a leaf-like structure, a flap-like structure, leaf-like structure in the posterior aspect of the tongue. So it is having two aspects, one closer to the lingual surface, oral aspect, another closer to the respiratory aspect. So lingual aspect has to go through frictions of the food. It has to go through the abrasive force of food and frictions of the food. So it will have stratification. We will have stratified squamous epithelium. But at the part closer to the respiratory aspect, it will have pseudostratified ciliated columnar epithelium. So coming to that, so is it okay? So the right answer is definitely stratified squamous epithelium, and the right answer is given by Wazir and Doctor. Is it okay? So we have finished with one of the topic, that is the epithelium, the most important topic of histology. In many of times when I was taking this session, I just give you a detail of epithelium, and rest topic I didn't covered up in the earlier times. But as I want you to cover the entire histology part, so I will start with the next topic, that is connective tissue. Okay, connective tissues. So connective tissue is, if I talk about connective tissue, it is one of the basic tissue which has got a function of giving stability. So it is giving stability. If I talk about connective tissue, it is giving stability, structure, metabolic supports to the other tissues and the organs of our body. So that is one of the important function which is performed by the connective tissues. Okay, dear. Now, it is forming as a connecting material for the other tissue. It is connecting one other tissues and it is acting as a connecting material. General features. So now let's talk about the general features of connective tissue. So if I talk about the general features, connective tissue is consist of cells, it is consist of fibers, it is consist of ground substance. So three important structures reside in the connective tissue, that is, it is consist of cells, fibers and ground substance. So individually I will come into the details of cells. Which all cells are present in connective tissue? The fibers, three varieties of fibers are present: collagen fibers, elastic fibers and the reticular fibers. So we'll talk about the these three fibers and also the packing material, the ground substance. Unlike other tissue, the major constituents of the connective tissue will be extracellular matrix, and extracellular matrix of connective tissue is giving strength to it. Although the type of connective tissues is having basically a basic structure, but the properties of the connective tissue also depends on the composition of extracellular matrix. Okay, now classification of connective tissue is important. So which all variety of connective tissue we have got, so classification of it is important. So if I am going to classify connective tissue, it can either be an ordinary classification. Okay, so ordinary type of connective tissues are loose connective tissue present in lamina propria, dense collagenous connective tissues, and the connective tissue having special properties. Scleral connective tissue, which is of cartilage and the bones. We have got lymphoid connective tissue. We have got hemopoietic connective tissue, that is blood and blood forming structures. Basically, let's talk about the loose areolar connective tissue. Now, when I am talking about loose areolar connective tissue, few loosely arranged collagen and elastic fibers are there. So if we see the under the microscope, what we are seeing, so other than that, if you want, I can slightly elaborate about these connective tissues. Okay, so we have already, like for example, if I am talking about loose connective tissue, the loose connective tissue is more of, so just one by one I just want to tell just in brief, because just in brief, when we are talking about loose connective tissue, it's actually a flexible vascular connective tissues, and it is very important. Why? Because it serve as a packing material. So it serve as a packing material. Just in brief about individual aspects. Okay, so it is serving as a packing material and it is present in. So where is the loose areolar connective tissues will be present? If you want, you can write here itself, because that can be asked in examination. So it is present in, and it is present in the case of subperitoneal tissues. It is present in subperitoneal tissue. It is present in endomysium. And I also told you it is present in lamina propria, acting as a packing material, vascular, and it is the examples where we will find the loose connective tissues, So that is the area. So where we are finding the loose connective tissue, we will find in the endo, we will find in the following location, we will find in the peritoneal tissues, endomysium, lamina propria. When I am talking about dense collagenous connective tissue, the dense collagenous connective, so dense collagenous connective tissue A and B I will write. Why A and B? Either it can be regular or either it can be irregular. So here we know that these we actually this has been asked in the previous year of examination also. It is having a good tensile strength, but the arrangement can be either regular or irregular. So regular connective dense collagenous tissue. So regular dense collagenous tissues will be present in the cases of like ligaments, location of ligaments, tendons, aponeurosis. If I talk about irregular, it is present in the dermis part of skin. It is present in the dermis part of the skin. Okay, so that is if I talk about connective tissue with special properties. Okay, so we have done with this. So we have done with dense collagenous connective tissue, and what is remaining is the yeah. So what is remaining? We have done this. This is yeah. So what is remaining is the connective tissue with special properties. So connective tissue with special properties means like for which is having more of elastic tissue, so that is special properties. So we will have in the special properties we can have elastic tissues, we can have mucoid tissues, we can have the reticular adipose tissues. So like adipose tissue is present in hypodermis. Mucoid tissues, if I am talking about mucoid tissue, it is present in Wharton's jelly. So it is present in Wharton's jelly. And if we are talking about elastic tissues, it is present in ligamentum nuchae. So that means when I am using the word, so you can just write like this, and you can use another. Yeah. So we are talking about connective tissues with special properties. So few connective tissues with special properties, for example, if I am telling the tissue is having elastic tissues, that means the example is ligamentum nuchae. Then if we talk about the mucoid varieties, that is having the Wharton's jelly in the developmental mesenchyme. So the example will be in the Wharton's jelly. If I am talking about adipose tissues, it is more present in the which layer? Below the dermis, in the hypodermis part of the skin. Okay, so done with this. Now so we have done with the ordinary one connective tissue list. Now the next is cartilage and bone. Actually cartilage and bone is a separate structure to be studied, so we will do it separately in detail. That is, cartilage is of three varieties. We have got elastic, hyaline, and articular variety of fibrocartilage. We will discuss in detail. Lymphoid structure also in detail, that is lymphoid structures, spleen, the thymus gland, the lymph node and tonsil, hemopoietic, blood and blood forming structures. Actually it is more discussed more detail in the physiology part. So done with this. Now let's come with the first variety, or that is the loose canal. So I just wanted to show this image, that is of loose areolar connective tissue. So when I am talking about loose areolar connective tissue, you can see the histology here, histological aspect. We can see the reticular, we can see the collagen fibers, we can see few elastic fibers. Reticular fibers are generally not seen in the H&E stain because they are stained by silver stain. So okay, so we can see large number of connective tissue. We can see the cells, fibrocytes and fibroblasts and mast cells, and large amount of ground substance. So when you see the slide like this, when you see under the microscope, this is when you see the slide, you will have the collagen fibers running. So we will have this as a collagen fibers which run in bundles. So what are these? These are the collagen fibers which is running in the bundle. So we will have the collagen fibers running in the bundles. And we will have the elastic fibers also. So we will also see the elastic fibers. And you can see these are all elastic fibers. These are all elastic. So collagen fibers do not branch, but elastic fibers can branch. These are all elastic fibers. So collagen fibers, elastic fibers, and cells. Fibroblast, fibrocytes along with the ground substance. So this becomes a slide of loose areolar connective tissue. Already we have talked about the examples, and we are knowing that it is present in the subperitoneum, it is present in the lamina propria. Now talking about dense regular connective tissue, as I told you, dense regular connective tissue will have a definite pattern of arrangement of fibers in it, collagen fibers and all. And the example of dense regular connective tissue is it is present in the case of ligaments, it is present in the case of tendons and aponeurosis. So here you can see presence of bundles of collagen fibers are there, and we have got cells, fibrocytes between these bundle and large amount of ground substance. So this is the CS, this is the transverse section, cross section of the tendon showing the outer covering peritendinum. Endotendinum is the individual tendon fibers are covered, collagen fibers are surrounding it. This is the longitudinal section, this is the LS section, longitudinal section of the tendon, which is showing bundle of collagen fibers along with the cells of fibrocytes which has been seen. Now dense irregular connective tissue, as I told you, dense irregular connective tissue is present in the part of the skin. Which part? It is present in the dermis part of the skin. Bundles of collagen fibers are oriented in different direction. The blood vessels and the fibrocyte cells has been shown. So we have got different varieties of bundle of collagen fibers which are oriented in different direction. Not a regular arrangement is there. Presence of irregular bundles of collagen fibers and less cells and ground substance are there. So this is an example of dense irregular connective tissue, the dermis of the skin. So many times this question has been asked in the previous year of examination, the example of dense irregular connective tissue. Now coming to dense elastic connective tissue, when I am talking about dense elastic connective tissue, we will have elastic fibers present and less cells and ground substance between the fiber bundles. So we will have refractive bundles of elastic fibers in it. So the best example of dense elastic connective tissue, as you can see in between the fibrocytes, and they are elastic fibers, more of elastic fibers are there. And this is a slide of ligamentum nuchae. It is present in ligamentum nuchae. It is also present in ligamentum flavum. Okay. Now coming to adipose tissue. Now in case of adipose tissue, the adipose cells will be there. The fat cells will be there, which will have nucleus. So exactly if you will see in the high power, this is the nucleus. So this is the nucleus. So there it is giving a signet ring appearance with the nucleus at the periphery. This is adipose cells or fat cells, which is also called as signet ring appearance, and in between and the interlobular septums, it is present in the hypodermis layer. So this is the lipid droplet, nucleus towards the periphery, always the nucleus it is towards the periphery. This is called signet ring appearance. Fat cells, interlobular septas. Adipose tissue. So how we can identify the fat cells or adipose tissue? As I told you, fat cells or adipose tissue can be identified with the presence of adipose tissue will have large number of fat cells surround in it, and a honeycomb appearance is given. Empty space is due to the dissolution of the lipid droplets, rim of cytoplasm, and always I told you, in case of adipose cell, the location of the nucleus is towards the periphery, which is called as eccentric location of the nucleus, and so the appearance is in the form of signet ring appearance, and the lobes has been separated. The lobes has been separated by intercellular. The lobes are being separated by by septas. Yes, Dr. Punit. Hello, ma'am. Good morning. Yes, Dr. Punit. Hello. Good morning to you. I'm all right. Okay. Good morning, dear. And today's session is about histology. Yeah. So today we are covering the histological aspect. Okay, dear. Now, composition of connective tissue. As I told you, we have to know the ground substance. What is it made of? We have to know about the cells. We have to know about the fibers in the connective tissue. So one by one I will discuss all. So let's talk about the cells. When I am talking about the cells, various types of cells are present in connective tissue. So we have got different varieties of cells which is present in the connective tissue, and they are grouped as fixed cells or the free cells, wandering cells. Okay. Okay, so we have fixed and the wandering cells. So fixed cells are also called as intrinsic cells. So let's firstly talk about the cells of connective tissue. So if firstly I would like to talk about the fixed cells, which is important for understanding. Fixed cells, the different varieties of fixed cells which has to be known by us is following: fibroblast, fibrocyte. So immature form of fibrocyte is fibroblast, which when it is having the extracellular matrix, then it is fibrocytes. Undifferentiated mesenchyme, fat cells, macrophages, histiocytes. Fixed cells are responsible for protection for the production and maintenance of extracellular matrix. So what is the function? It is very important for maintenance of extracellular matrix and production of the extracellular matrix. Now let's talk about the free cells. When I am talking about the free cells, the other word which can be called as the wandering cells. What is it called as? It is called as the wandering cells. It is called as wandering cells. So it can be in the form of free macrophages, it can be in the form of plasma cell, mast cells, leukocytes, and it react to the injury or invasion of microorganisms. So free cells are discussed more in the physiology part. We will discuss more of the fixed cells. Now, and if I am talking of the fibers of connective tissues are the three varieties. As I told you, we have got the bundles, the collagen fibers, elastic, singly running, branching pattern is there in the elastic fibers, and reticular fibers, which is generally not stained by HNE. They are not stained by HNE stain, they are stained by silver stain. Ground substance is the gel-like material which is combining the cells and fibers together. They are embedded in the connective tissue. So let's briefly talk about individual cells. Okay, so let's briefly talk about the individual cells. So one of it is the fibroblast. So when I am talking about fibroblast cells are most common form of common cells found in. So you can see the shape. If you are seeing the shape here, which is shown in this diagram, it is fusiform in shape. It is fusiform in shape. It is fusiform in shape, which is having a slender, and you can see the cytoplasmic processes. So it is having slender processes. It is having slender processes, and if you will see, it is containing the nucleus. The nucleus is oval. The nucleus is oval, which is having a nucleolus. And the most important function. So if I talk about this fibroblast, what is the function? So it is important for the formation of the fibers and ground substance of connective tissue. So what is the function? The function is fibroblast is important for the formation of fibers and ground substance. Okay. Now the undifferentiated mesenchyme cells. So if I talk about undifferentiated mesenchyme cells, the undifferentiated mesenchyme cells, if you will see this image, you can see what is the shape. You can appreciate the shape. Anyone, what is the shape? It is stellate in shape. Stellate in shape with delicate cytoplasm, and actually the nucleus is in the center, and it's actually one of the important point about undifferentiated cell is that when stimulated it get formed, it will form other types of cells. So it is it is also called as pluripotent cells. It is called as pluripotent cells. It is pluripotent cells which will transform into a new forms of cells whenever stimulated. Now talking about fat cells. So as I have explained also, fat cells, the fat cell is very important for storing energy. It store energy. It is having the location of the nucleus towards the periphery. So it is called as giving a signet ring appearance. Signet ring appearance is there. Thin rim of cytoplasm is there, and is actually very important, and it is supported by reticular fibers. So it's having inside the lipid droplets vacuolated appearance. So exactly it is giving a vacuolated appearance, lipid droplets, large sizes, approximately the size is 50 micrometers, nucleus is towards the periphery. The other is fixed microphages of histiocytes. So let's see the image. Fixed microphages, which is also called as histiocytes. So irregular. So what shape you are seeing in this image? The shape of fixed microphages of histiocytes are, they are irregular in shape. They are irregular in shape. They are irregular in shape. They are irregular in shape with numerous processes, and exactly they have got an eccentric nucleus. So again the nucleus is eccentric in location. So exactly if I talk about the function of macrophages, the function is phagocytosis. The function is phagocytosis, play important role in defense mechanism. So very important for the defense mechanism. Free macrophages, so basically we will have fixed and we will also have free macrophages. So exactly one of the other macrophage is the free. So actually they get activated once stimulated. So free macrophages are stimulated during antigenic stimulation. So antigenic stimulation, for example, in case of inflammation. Okay. Now coming to the next, plasma cells. So the next variety is plasma cells. So you can see the plasma cells. So when I am talking about the plasma cells, again the nucleus is oval, and it is so our oval cells. So basically the overall, if you will see the shape of the, so when I am talking about the nucleus, it is again having a cartwheel appearance, but overall cell is oval and the nucleus is having a cartwheel appearance, as you can see in this diagram, and has got a eccentric location of the nucleus. So where is it located? It is eccentric in location, and it can come as an image based question also. You have to identify the cell. So in that case you will have to identify the cells. You will have to identify the cells. Again, if I talk about the plasma cells, they are actually derived from the B lymphocytes, and they are also important for immunity. Plasma cells are derived from B lymphocytes. They are derived from B lymphocytes and are involved in the body defense mechanisms. Now we have got the mast cells. So you can just see the mast cells. If we are talking about the mast cells are actually again the shape which you can see in this image. This is fusiform shape with the central nucleus. The nucleus is center. And the other important point about the mast cells is it contains metachromic granules. So it is actually mast cells are found. Where is the mast cells are found? It is found in the blood vessels. It is found in along the blood vessels. So it is found along the small blood vessels, and it is having its cytoplasm is having metachromic granules. What it contains? It contains metachromic granules. These granules are containing histamine. So these granules are containing histamine. We know that it is a vasodilator. Histamine is a vasodilator, and it also contains heparin, which is an anticoagulant. Okay. So basically, these are involved in inflammatory reaction. The mast cells are involved in an inflammatory reaction. So done with this. So we have finished with the cells. The next is the fibers. So we have finished with the cells, and the next important point which everybody should understand is the different varieties of fibers in our body. So as I told you, the fibers which is in our body, we have got three types of fibers. So I think we will come to this comparison of individual fibers after giving the explanation of the individual fiber. So let's start with the first fiber, that is the collagen fiber. The first fiber is the collagen. Let me just check with the students, are they understanding? Okay, students, are you understanding, everyone? Okay, many students, when I take sessions also, many of the students they, while preparing for the examination, they will leave the histology part. They will only study the gross part. I have seen the students, but if you want to secure a better rank in your competitive exam, so you have to complete both the embryology and histology part also, other than the gross anatomy. Okay, so till now we have finished the gross anatomy and the neuroanatomy part. What was remaining was the histology and embryology. So we will finish the histology today. So let's talk about the collagen fibers. So the composition of connective tissue is, it also contains, it is composed of protein. That protein is called as collagen, which is forming 30% of the dry weight, and it will be in the form of bundles. Collagen fibers, as I have shown in the transverse cross section of the tendons and also the longitudinal section where you have seen the collagen fibers are running in the bundles. Collagen fibers do not branch. Yes, that is a very important point which you have to keep here, that elastic fibers will branch, but the collagen fibers are not branching, runs in a wavy pattern, and when freshly seen, they are white in color, so it is called as white collagen fiber. Under the microscope, it is consist of collagen bundles, which is consist of microfibrils, which is also having tropocollagen in it. It is also having what? It is tropocollagen is present inside the collagen fibers, which is an important region of striation, which is evident in collagen fibers. Collagen fibers is not only stimulated by fibroblasts, but other than that, it can be stimulated by other cells. So it can also be stimulated by other cells, and the cells which can stimulate it is in the following location are following. So it can be stimulated by chondroblast in case of cartilage, it can be stimulated by osteoblast in case of bones, it can be stimulated by the smooth muscle in case of blood vessels, by the odontoblast in case of tooth, and by collagen on denaturation or boiling, it gives gelatins. So when it is boiled, it can form gelatin. Now, exactly if I talk about types of collagen fibers, actually type of collagen fibers has been asked with the examples as an important question. So it's very important that you should know the varieties of collagens. So exactly if I talk about the varieties of collagens, it's again we have got a vast number of collagen varieties, collagen fibers. We have got approximately more than 25 types of collagen fibers. So I just not want everybody to know the examples of each variety. I just want that at least you should know the example of type 1, type 2, type 3, type 4 and type 5 collagen fibers examples. So type 1 example. So if we are talking about type 1 examples, so if we are talking about type 1, so exactly there is type 1, there is type 2, there is type 3, there is type 4 and there is type 5. So these are 5 varieties of collagen fibers which you have to know. So when I'm talking about type 1, the type 1 collagen fibers are present on which location and example. So it's the most abundant one. It is plenty. We have got type 1 collagen fibers, and it is present in bones, it is present in skin, so it is present in bones, it is present in skin, it is present in dentine, cornea, blood vessels, fibrocartilage and tendons. So type 1 collagen fibers will be present in following location. It's very important that you should know the examples of these type 1 collagen fibers and their location. It is present in tendons, blood vessels, skin, cornea, bone, tendons. Type 2, it is present in cartilaginous tissues. Type 3 variety is present in ligaments, blood vessels and skin, and also in the internal organ. Type 4 collagen fibers are present at the basement membrane. Very, very important. So many times this MCQ has come. Type 4 collagen fibers are present in the basement membrane of various tissue, and type 5 is present in blood vessels, stroma of the cornea. It is also present in lung, cartilages and others. So there is overlap of collagen fibers also present in location. Type 4 is very, very important for you to understand the examples. So now this is again an image of the connective tissues which has been shown, and here you can see the collagen fiber. If you will see the collagen fibers, you can see the collagen fibers are always running in bundles. They are not branching and they are running in bundles. They are running in bundles. Okay, and the elastic fibers, as you can see, they are singly, They are singly running and they are branching. What they are doing? They are branching. They are singly running and they are branching. Okay. Fibroblast has also been shown. Now, the next variety is elastic fiber. So, basically, yeah, we will come to the comparison after completing the three types of connective tissues. The next variety is elastic fibers. So, when we are talking of elastic fibers, they have got a prime composition of elastin. So, they are having elastin there. So, they have got a prime composition. Yes, Dr. Punit. Yes, you are right. Yes, yes, Dr. Punit, you are absolutely right. The most of it is in the type 1 variety and it is also present in the placenta type 5. Yes, you are right, Punit. Elastin is secreted by the smooth muscle cells in blood vessels and fibroblasts. Fibers will occur singly and they will branch. The how to differentiate, when you see under the microscope the collagen fibers and you see the elastic fibers, how you are going to differentiate? The collagen fibers will be made of bundles, and if I'm talking about elastic fibers, they will singly and branch. And collagen fibers do not branch, the elastic fibers branch. They can be stretched approximately 1.5 times and they are yellow in color when freshly cut. The examples where we found large number of elastic fibers are in case of elastic artery. The large arteries, they are found in large numbers in the case of areas where we want more of elasticity. For example, in the area of ligamentum flavum and ligamentum nuchae. The third variety is reticular fibers. Actually, reticular fibers are very important for giving support. So, they are acting as a supporting material, supporting structures. If they are acting as a supporting structures for many important structures. So, many important lymphoid structures, the reticular fibers are there. It is present in the spleen, it is present in lymph node, it is present in the tonsil as a packing material and connective tissue framework. A very thin immature collagen fibers, they are first to present in the wound healing. They are similar to collagen fibers, supportive in nature. But the point is that when we see under the microscope the H&E stain slides, we are not able to appreciate reticular fibers because they are only stained by silver stain, and so they are called agrophilic fibers. They are composed of mainly type 3 collagen fibers. Okay, now I just want to show you this comparative table which of 3 collagen fibers. So one by one I will slightly enlarge so that it becomes easy for you to read. So the collagen fibers are strongest and the thickest of all varieties. Yes, that is absolutely correct. The elastic fibers are thinner, stretch and recoil, and the reticular fibers are found in organs like a meshwork and as a connective tissue framework. Now, the collagen fibers are most abundant, elastic fibers are less, and reticular fibers are also, means elastic fibers and reticular fibers are less abundant than the collagen fibers. The basic structure in the protein which is present in collagen fibers are collagen. Elastin is present as a protein material in elastic fibers, and collagen type 3 variety is present in reticular fibers. Various connective tissue where we find, so what is the examples of the reason where we find, so what is the area where we are going to find the collagen fibers? So we will find the collagen fibers mainly in the tendons, ligaments and aponeurosis. In the elastic tissue, ligamentum nuchae, ligamentum flavum, it is found in spleen and lymphoid organs. They are the thickest. Collagen fibers are thickest. Thickness is more in collagen fibers. They are thin, and the reticular fibers are also thin. The strongest is the collagen fibers in comparison of the strength, and the strength of collagen fibers are more than that of the elastic and reticular fibers. Done. So this was the comparison of the 3 types of collagen fibers. Now I just want to come to the ground substance. It is also important that we should know about the ground substance of the details. So ground substance, what is ground substance? Now, if I am talking about ground substance, it is a transparent, homogeneous, viscous solution which is filling the space in between the cells and the fibers. So basically, it is composed of mucopolysaccharides. So we have to know the composition of ground substance. So it is consist of mucopolysaccharides, that is glycoso glycosaminoglycans, hyaluronic acid, and heparin sulfate. Actually, the question in the previous year has also been asked about the composition of ground substance. So you should know it is consists of glycosaminoglycans, that is of hyaluronic acid and heparin sulfates. Mucopolysaccharides are important for maintaining the consistency and viscosity of ground substance, and is very important in acting as a barrier to the spread of infection, the ground substance. The ground substance is typically composed of, so we are talking about the ground substance is composed of structural glycoprotein. It is composed of structural glycoprotein. It is also having water and electrolytes. It is also having water and electrolytes. Ground substance is composed of structural glycoprotein. It is also having water and electrolytes. So the structural glycoprotein it is composed is fibronectin in the dermis, chondronectin in the cartilage, and lamellin in the basement membrane. Water electrolytes are important for maintaining the fluid balance. So the name of glycoprotein, you should know the name of glycoprotein, which is composed in the, which is forming the composition of ground substance. It is fibronectin in dermis, chondroitin in cartilages, and it is lamellin in case of basement membrane. Now comparison, so I would also like everybody to see this image where we want to have a comparison. So here we want to have a comparison between, yeah, here I just want everybody to have a comparison between the yellow fat cells, yellow adipocytes, and that of brown adipocytes. So please have a look on this image. So exactly in case the diagram has been shown for the brown. So in case of brown adipocyte, central nucleus is there, lipid droplets are more, as you can see, peripheral nucleus or signet ring appearance is there in the yellow adipocytes. Now if I am talking about the size and shape, it's a polygonal shape. The brown adipose cells will be polygonal, but the yellow adipocytes will be rounded. It is unilocular and it is multilocular, as you can see. Nucleus is peripheral and towards the eccentric location. It is towards the periphery. It is spherical and central nucleus is there in case of brown adipose cells, adipocytes. More of comparison, again we will talk about the brown and that of the yellow. So if I am talking about the, here we are talking about, this is the yellow and this is the brown adipocytes. So mitochondria will be less in yellow and it will be more in brown. Cytochrome content, so that is the reason if the mitochondria is come, cytochrome concentration will be also low in yellow and more in brown. Endoplasmic reticulum is well developed. Endoplasmic reticulum will be well developed in the yellow and not well developed in case of brown adipocytes. Vascularity will be less in yellow and the vascularity will be more in brown. Distribution is very important. It's very important that you should know the distribution. So the distribution of yellow adipocytes is in the adults, but the distribution of brown, it is present in the fetus and newborns. The function is the yellow adipocyte is storehouse of energy and the brown one is important for production of heat. It protects the newborn against cold. Okay, so yes, Mangal, try to finish this session, then we will see about the PDF. Don't worry. Okay, you will be provided with the PDF, but please firstly complete the session, and then all the important aspects has to be covered in the session. So let's go with the details. There are so many images which you have to correlate for the proper understanding of histology. So now I just want everybody to come to the MCQ. So can we have the MCQs related to this topic? One of the MCQs in the previous year. Which type of collagen? Which type of collagen will be present in the basement membrane? Which type of collagen will be present in the basement membrane? 1, 3, 4 and 5. Which type of collagen is present in the basement membrane? 1, 3, 4 and 5. So yes, Mangal, Punit, Dr. Wazir, Supriya, Prishila, Roshan. Please mark the right answer. Which type of collagen is present? Dr. Punit is telling type 1 in the basement membrane, dear. It is found in the basement membrane. Which type of collagen in the basement membrane? So others, please try to solve it. Which type of collagen present in the basement membrane? Option C, okay, Archana is telling D. Sorry, ma'am, type 4. Yes, yes, Punit, you are right. Yes, yes, absolutely right. Type 4, C is the right answer. So, those who have given C as the right answer, that is, I think, Varshita, SP, Archana, and Punit. Everyone has given the right answer. Yes, absolutely correct. Now, can anyone give me the answer here? This is a slightly twisted one because this is twisted one. This question is twisted, but I want everyone to give the right answer. Brown adipose tissue. Try your luck. Then I will explain it. Brown adipose tissue is present in all of the following site except. Brown adipose tissue is present in all of the following site except subcutaneous tissue, around the blood vessels, scapula, adrenal cortex. Yes, Dr. Kamlesh Sharma, type 4 is absolutely right. Yes, dear, type 4 is right. Now the next question, please come to the next question. Scapula. Okay, what about others? Brown adipose tissue is present in all of the following site except. Adrenal cortex. Jitin is telling adrenal cortex. Okay, multiple answers are coming up. Okay. Scapula. Dr. Kamlesh Sharma, 3. Okay. So everyone tried their luck. Everyone tried their luck. So actually, we have to mark the right answer. And to be, ma'am, blood vessels, scapula. Oh, no, dear, till now nobody has given the right answer. Actually, all the 4 options are the location where brown adipose tissue can be present. But if I have to choose one, I will go with the answer subcutaneous tissue. I will go with the subcutaneous tissue. So let me explain you. So brown adipose tissue is present in large amount in the newborns. We know that it is present in large amount in the newborns. So why? Because extensive heat loss is not there, which will help to not having the extensive. Yes, Dr. Punit, because yes, I am coming to that. It is present in the nape and the scapular region. So, to prevent excessive heat loss, it is present in the newborns. It disappears at the most of the site. When the baby is growing, and in adults, most of the site it disappears except for the reasons of kidney, adrenal gland. So it is present in kidney, it is present in vessels, it is present in the neck, deep cervical, suprascapular region, it is present in interscapular, paravertebral, thorax, mediastinum region. So what you can see in all the regions, that is the scapular region in the adrenal gland, so it is present in the kidneys, it is present in adrenal glands, it is present in the blood vessels, it is present in the neck, it is present in deep cervical, supraclavicular, back also in the scapular, interscapular, paravertebral region, and also in the part of thorax or mediastinum. So most of the reason which was given in the option, it is already present. It is not vanishing from that reason. So exactly if I have to choose one, I will go with subcutaneous tissue. Subcutaneous tissue, why? Because we know that subcutaneous tissue contains fat, but if I take the subcutaneous tissue of example, as I take an example of subcutaneous tissue in adults, then we will have less amount of brown fat, we will have more amount of yellow adipose tissue. Is it okay? Actually, all the answer was near about correct only, but we have to go with one. Then the most correct will be subcutaneous tissue, because these are the area where trace amount of yes, Archana, it was a tricky one. Yes, there also trace, yes, Dr. Kamlesh, trace amount of brown tissues, trace amount of brown adipose tissue is present. So full disappearance of brown adipose tissue is not there. In adrenal gland also it is there. So we will choose the right one, that is subcutaneous tissue, means the subcutaneous tissue in case of adults. So we'll choose subcutaneous tissue as the most appropriate answer here. Is it okay, everyone? Now, ligamentum flavum is consist of. Next question. Yes, 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 you are right. Yes, you are right. That is more studied in the biochemistry part. Yes, Dr. Punit, you are right. So ligamentum flavum is consist of. Can anybody give me the right answer? Ligamentum flavum is consist of majorly type A collagen fibers, type 2 collagen fibers, elastin or reticulate. According to you, which is the perfect answer? I got an answer from Dr. Kamlesh Sharma. So I have written this also and I have told you also. 80% elastic fiber, Jitin. Okay. So ligamentum flavum, if I am talking about, yes, light collagen fibers are there, but most important, it is consist of which fibers? The right answer will be elastin. Yes, elastin. So major amount of ligamentum nuchae and flavum is composed of which fibers? Elastin fibers. So if I have to choose one, I will go with elastin fibers. So ligamentum flavum is consist of connecting flavum is connecting the adjacent laminas, which is present in the vertebral canal. So ligament tendon capsule, usually if I talk about ligament tendons capsule, they are consist of type 1 collagen fibers. If we are talking about ligamentum nuchae, ligamentum flavum, it is primarily consist of yellow elastic tissues. Yes, absolutely right, everyone. Absolutely right. The composition is also collagen fibers. The major amount is elastic fibers. Ligamentum nuchae is having 80% of elastin. So see here, it is having 80% of the elastin and 20% of the collagen fibers and other structures. So it can be stretched so that it can be overstretched in flexion and extension. This is flexion, this is extension. So this can be overstretched in this category of movement. Next topic which I want to start is the glands. Is it okay? Next topic we can go with glands. Everyone? Everyone, is it okay? Let me complete the glands and then I will give you a break of 10 minutes, 10-15 minutes. Is it okay? Please let me know, Archana, Zitin, Punit, Kamlesh, Doctor, everyone is okay? I will just complete the glands and after that I will give you a break of 10 minutes. 10 minutes. And after then we will have 2 to 3 hours of session and then I will give you a lunch break. Okay. Now glands. Glands is an organ of secretion. Gland is an organ of secretion made of specialized secretory cells. And so specialized secretory cells are derived from. Okay, Kamlesh. Yes. Okay, dear. Everyone is okay with this. Great. So it's an organ of secretion made of specialized secretory cells which is derived from surface epithelium on which it is opening. We know that glands will have ducts for the opening. So that is very important to know. Okay. So it's very important that glands are actually epithelial in origin and it is involved in the secretion of enzymes and hormones. Okay. So basically, firstly, I want everybody to understand the general features of the glands. So if I am talking about glands, it is present as a discrete organ or in the layers. It can be present in the form of layers in the as in case of viscera. So the secretory cells of the glands is forming. System form, if I am talking about the secretory cells which is formed in the glands, it is forming functional units called secretory entities. and it can be either it can be either in the form of flask shape or it can be in the form of cylindrical. So when the gland shape is cylindrical, it is called as tubular. When the gland shape is flask shape, it is called as acini. Now, general features of the glands. So the glands are epithelial in origin, and the fluid secreted, as I told you, the fluid secreted by gland. So when I am talking about the fluid secreted, so these are again showing you the features of the gland. So please have a look. So the other features of the glands are, they are epithelial in origin, the fluid secreted by the glands. If I am talking about the fluids which is secreted by the glands, the fluid secreted by the gland contains enzyme, hormones, mucus and the fat. The secretory end piece of some exocrine glands are surrounded by actually contractile tissues, and that is all called as myoepithelial cells. What is that contractile tissues? Actually, that contractile tissue will squeeze the secretory unit of the glands and it will lead to the secretion. This contractile tissues is called myoepithelial cells. Now, development of glands. So, if I talk about the development of glands, as you can see in this diagram, the glands arises as an invagination from the epithelium. So, as you can see here, their glands are arising as an invagination from the epithelium. The glands arises as an invaginations of the epithelium, and the underlying connective tissues. The distal portion of invagination, if I talk about the distal portion of this invagination, this distal portion of the invagination is forming the glandular portion. This will lead to the formation of glandular portion of glands, and so this will exactly lead to, one of the portion is glandular and another is the secretory end piece, so it is the duct which is formed. So actually what happens, the proximal part of the excretory duct will open in the surface of epithelium, and further the cell, as you can see in this image, it is detached from the epithelium and the gland is formed. So exactly it is epithelial in origin. Now it's important to know the classification of the glands. So the glands can be classified as on the various categorization. It can be classified based on the site of secretion. It can be classified based on the number of cells. It can be classified based on the number of ducts and the shapes of secretory end piece. It can be classified as a mode of secretion. It can be classified as the nature of secretion. That means we have to know the classification of glands in this categorization. We have to know the classification of gland on the basis of the site of secretion, the classification on the number of cells, the type of secretion, the mode of secretion, the nature of secretion, and the nature of the duct or the secretory end piece. So one by one we will know about each of the varieties. So first is to know about, based on the site of secretion, the gland can be of following varieties. Based on the site of secretion. So based on the site of secretion, the gland can be either of exocrine variety or it can be of endocrine variety. So you can see it is either of exocrine gland or it is an endocrine gland. So exactly when I am talking about exocrine gland, it means it is having duct for the secretion. So the major difference is that it is having duct for secretion, the endocrine cells, and the endocrine gland is directly secreting their secretions as a product in the bloodstream. So endocrine gland, best example is thyroid gland. And many glands are exocrine. So basically we have got many glands, exocrine glands, like for example salivary glands. So many glands on our body, like salivary glands, are all exocrine. So we have got mucus and serous salivary gland. We have got parotid, submandibular, sublingual. These are all salivary glands which are categorized as exocrine gland. Thyroid glands is directly pouring their secretions in the bloodstream. So they are not having any duct for their secretion. So they are endocrine variety. Now other than that, we have also got a third variety, that is paracrine gland. So see here, we have got a third variety, that is paracrine gland. So exo and endo we have done. Paracrine gland secretes their secretions in the local extracellular space and in the surrounding cell area. And we have got a best example of paracrine gland which is secreting their secretion in the local extracellular spaces is the enteroendocrine cells of GI tract. It is which type of cells? It is enteroendocrine cells of GI tract. So it is enteroendocrine cells of GI tract is the best example of paracrine glands. Endo, thyroid gland, endocrine glands, thyroid, exocrine gland, the salivary glands. So we have done with the first classification, which was at the site of secretion. The next is based on the number of cells. The next variety is based on number of cells. So based on number of cells, the secretion number of cells. So unicellular means is composed of single cells, and the best example of unicellular gland is goblet cells, and we know that goblet cells is present not only in respiratory tract, it is also present in GI tract. So that means unicellular gland, we have got one best example, that is the goblet cells which is present in GI and that of respiratory. The next is multicellular, which is composed of many cells, and other than these goblet cells, we have got multicellular glands, and we have got many examples in this variety. So we have got many examples in these varieties. So let's see this image. So based on number of ducts, so now based on number of duct and the shape of secretory end piece, it can be of simple gland or it can be of compound gland. So we have to know the example of each variety. We will have either the gland is having a single duct or the gland is having a multiple duct. When it is having multiple duct, it can be minor or major duct. So we will have the classification and example of each. So for that, for the classification of glands, which is based on number of ducts and the shape, I would like to show you this flow chart, which will help you to understand each variety with an example. So let's talk about the simple one. So firstly, we have got two varieties. One is the compound varieties of the gland and their examples, and the other is simple. So I first want everybody to concentrate on this image where I am telling you about the simple glands. So simple glands means simple glands which is not multiple, which is not having multiple SNI. It can be either the simple one can be. So one is the simple tubular gland or the other is simple alveolar gland. So as I told you, if the SNS shape is tube-like, it is called as simple tubular gland. If the SNS shape is globular, it is called as SNS. So the simple tubular gland can be present at following location. So exactly again the simple tubular gland can be either straight, it can be branched or it can be coiled. So the further classification of simple tubular gland is on three types. It can be classified as three types. The straight one, the example is present in intestinal crypts. The branched one is present in the uterine glands, in the fundic gland and the pyloric gland of the stomach. So please note down the example. Each is very important for your examination MCQs. Each variety is very important for your examination. So straight is present in intestinal tract. The branched one is present in the uterine gland, fundic and pyloric gland of the stomach, and the coiled one is present in the sweat gland. So where is the coiled one present? The coiled one is present in the sweat gland. Now coming to the globular varieties. The globular gland can be unbranched or can be branched. So if I am talking about the branched one, unbranched one, it is the urethral gland in the urethra. Branched one is sebaceous gland and the tarsal gland. Branched one is sebaceous gland and the tarsal gland. Okay, any doubt you can ask me. So can anybody tell me what is tarsal gland? Can anybody tell me what is tarsal gland? What is the other name of tarsal gland? Can anybody tell me? Sebaceous gland, all of you are knowing, that is important for the oily secretions in the skin. Can anybody tell me what is tarsal gland? I am talking about tarsal gland. Can anybody tell me what is tarsal gland or what is the other name of tarsal gland? Don't worry, otherwise I will come with the answer. Oil producing gland in the Okay, I am coming to this. Yes, yes, what is the other name? Yes, Punit, you are right. Yes, Punit, you are absolutely right. Yes, I am coming to your doubts. Don't worry. Yes, Punit, you are right. So if I talk about tarsal gland, yes, it is also called as tarsal. Why I am writing this? Because if the other name comes, you will be able to know its other name. So tarsal gland is also called as meibomian gland. It is oil producing glands in eyelid, and it prevents the tears from evaporations. So what is the function of this tarsal gland? It is preventing the tears from getting evaporated because it is having oil. Okay, yeah. So now we'll come to the compound type. So we have finished with the simple type. Now we'll come to the compound types of the gland. Okay. So yes, dear, dear, who is asking this question? Okay, one of the student is asking, Aryan, ma'am, should I watch TV if I have got just 5 minutes, 5 months for my preparation? So dear Aryan, that totally depends on you. What you can do, you can go with intense study schedule for 5 days. Then you can take 1 day of break. In that day, so you can have a self study. If you are not going to your college or any hospitals, or you are not working, you are at your place, you are not taking any coaching. You are not going to any coaching institutes. You have got all your time as a self study time. Then you can study for 12 hours, 12 to 14 hours, and 14 hours continuously for 5 days, and then 12 to 14 hours, that totally depends on you. And you should have a good sleep of 8 hours, 7 to 8 hours, and then you can take a break, 1 day off, in which you will just study for 3-4 hours, and you can watch your TVs. Okay, is it okay? That totally depends on the way you are going to proceed. Now, compound type. So the compound type, the first variety which I want everybody to understand is the compound tubular variety. So here you can see compound tubular variety. The tube-like SNS is there and it is multiple. So tube-like SNS are there and they are multiple. Yes, Dr. Puneet, you are absolutely right. Yes, you are absolutely right. So the compound tubular kind of glands are present in the Brunner's gland of the duodenum. Actually, Brunner's gland is a characteristic feature for the identification of the duodenum. Brunner's gland is present in the submucosa layer of duodenum. So duodenum being the part of GI tract, and it's, if I am talking about the submucous layer, there is presence of Brunner's gland. It is also present in the cardiac gland of the stomach. It is also present in the cardiac gland of the stomach. It's also present in cardiac gland of stomach. Absolutely correct. Now coming to the compound gland acinar variety. So compound acinar. So if I am talking about compound acinar, again the best example of compound acinar is parotid gland, which is having multiple acini and they are important for the watery secretion. The major example is parotid gland. Now the next is compound tubuloacinar. The third variety is, it will have compound tubuloacinar. That is, both tubules and acinars are the are multiple. So this is tube, which is shown here, and this is the acini. So acinus and tube both are multiple. The best example is submandibular and sublingual gland. Actually, submandibular gland is mixed variety of salivary gland having both the serous and the watery serous, that is watery secretion, and the viscous secretion, and the sublingual gland is predominantly having viscous secretion. So this is mucous variety. Okay, so we have got multiple classifications here. Okay, is it okay? Are you understanding? So are you understanding? Exhausted? Please don't get exhausted. Let me finish glands, because gland is a very important topic for INICT and NEET PG exam, and it has also been asked superficial question from the FMGE exam. So I want to complete this topic before giving you 10 minutes of break. Okay, now I have explained all the types of okay, Punit, I have explained all types of glands with the examples and schematic diagram. Now this is the images which is taken from D. Furey's histology book, and you can see exactly the shape of each variety. So basically, it's very important that you should be able to appreciate this. So this is the simple tubular gland will be like this. So this is the simple tubular gland. This is the epithelium. Actually, the epithelium height will be enlarged as you go more distally towards the duct. The epithelium of the glands get enlarged if you go more distal closer to the duct. So this is simple tubular variety. This is the nucleus. Branch tubular, the same variety, but the tubules are multiple. Here what happens, the tubules are multiple, so it is branch tubular. Now sweat gland, as I told you, the coiled, simple coiled tubular, the sweat glands. If you remember, I told you the coiled tubular. So you can see it is not straight, the tubule is not straight. In this category, you can see the tubules are not straight and it is coiled tubular. What variety is it? It is the coiled tubular. So this is the columnar epithelium. This is the epithelium. This will be cuboidal only, simple coiled tubular, the sweat gland. The simple acinar. So the next variety is simple globular, then this is simple acinar. Multiple globular or acinar shape is compound, is the simple branched acinar. Just to make you understand the shape, compound tubular, many branching pattern and tube-like structures. Compound acinar, many branching of the duct, and then acinars are multiple. And compound tubuloacinar, which we have talked about, submandibular and sublingual gland, you can see multiple tube-like structures are there and there is multiple acinus also. Okay, so done with this. Now the next classification of gland is depending on the product of the method of excretion. Okay, so the next variety is the next variety of variety, if I talk about the glands, the next variety of the glands which I want everybody to understand is the classification is on the process of that classification is on the glands excretory products being discharged by which process. Okay, so let me just check with the students. Okay, now here we have got A, B, C. Everybody, the classification of the glands can be marrow, apo and holocrine glands. So we will have three varieties of the gland, A, B and C. We have got three varieties of gland, A, B and C, and we have to classify the glands on the method which is opted by the gland to release its excretory product. So in the B type, you can see the secretion of the glands is occurring by the process of cytosis, pinocytosis, and the whole of the cell is intact. Not a part of the cell is disintegrated in this process. Not a single part of the cell is disintegrated in this process. So such kind or such method of secretion is called as the merocrine type of gland. So this is B is which type of gland? It is merocrine glands. So if I talk about the C variety, you can see a part of the cells is pinched off. A part of the cell is distorted and pinched off during the method of secretion. Such kind of gland is called as apocrine glands. Now, if I talk about the other one, the first A image, if you will see, the disintegration of the when the process of excretion is happening, the whole of the cell is disintegrated in this process. As you can see, the whole of the cells are disintegrated in this process, and such kind of gland is called as holocrine. So new cell, the cell has been dead in this process and the new cell has to be disintegrated. Such kind of secretion method is called as holocrine glands. Okay, now, so we have done with this. Now I just I just want everybody to understand the based on the mode of secretion, the types of glands you have to know, which is based. So we have to know the four varieties of the glands. We know that marrow, holo, apo, know, and one more variety is that is called cytocrine gland, where the cells will secrete their secretion by the process of directly releasing secretion. So I will talk about all the varieties. The method we have already seen in the image. So let me talk first about the merocrine glands. The first variety which I want everybody to understand is the merocrine glands. So when I'm talking about the merocrine glands, the excretory products which is released by the cell, and the process which it adopts is the process of exocytosis. No loss of cytoplasm is happening in this place, and most of the glands in our body, like the sweat gland, the salivary gland, all these glands have the method of merocrine glands mode of secretion. So most of the sweat gland in our body. So if we are talking about the sweat glands, so example will be the sweat glands. Now, the apocrine. So if I am talking about the apocrine glands, when we are talking about the apocrine gland in this, the method which is opted for the secretion done by this gland, a apical part of the cytoplasm of the secretory cell is lost in the process of secretion. So a partial loss of cytoplasm is seen. And this kind of secretion is found in lactating mammary gland. It is found in lactating mammary gland, sweat glands, which is present in the axilla, and that of external genitalia. Okay, that is found in external genitalia. That means sweat glands. Other than that, the body sweat glands, which is present all over the body, is an example of merocrine glands. But other than that, we will have the sweat glands present in mammary gland, we will have the mammary gland, that is apocrine type of gland. Sweat glands present in the external genitalia regions in the axilla is also an example of apocrine gland. Now, the third variety is holocrine. The third variety is holocrine type of gland. And when I'm talking about the holocrine type of gland, the secretory cell will burst with the outpouring of its contents, and while the process which is adopted, that is the outpouring of the contents, in this process the cell dies. The complete death of the cell happens, and there is formation or regeneration of the new cells for the new secretion. So such kind of gland is sebaceous gland and tarsal gland. Such type of glands are sebaceous gland and tarsal gland. Got it? Now, the last variety, which was not shown in the image, actually this is the fourth variety, which has newly been told that the cells are released as a process of secretion, as in case of testes, the spermatozoas or the sperm is released. So that type of gland is called as cytocrine gland. Is it okay? Have you understood how Punit, so Dr. Punit and Dr. Jitin, Dr. Kamalesh, Dr. Archana, so everyone, those who are live, please let me know. Dr. Muhammad Asar, yes, cytocrine. Yes, Muhammad Umar, it is called as cytocrine type of gland. That is the fourth variety. So now we have done with this. Now I would like to further go in the explanation of classification of the glands. Actually, glands is very important topic, considering all FMGE examination, considering all your university examination, considering all the examination conducted in the INICT and that of NEET PG. So we'll have the discussion of how to understand the classification. Okay, so based on the nature of secretion, the third is the nature of secretion. So in this category, we have got three varieties, nature of secretion. The first is serous type of gland. So when I am using the word serous type of gland, what does that mean? That the secretion is in the form of thin watery material being released out. So thin watery material being released out, like in the case of enzymes. For example, we have got the secretion in the parotid salivary gland, which has having the watery secretions. Yes, get it, Muhammad? Absolutely correct, Muhammad. Now the other is mucus type of gland. So when I am using the word mucus type of gland or secretion, mucus variety means the secretion is in the form of thick viscous material being secreted in the form of which will lead to the protection and lubrication. So we will have sublingual salivary gland secretion in this variety. Sublingual salivary gland is predominantly having the mucus secretion, which is viscous. Now we will have the third type. Actually, the third type of secretion is mixed variety, that is seromucous type of secretion. What is it? It is seromucous type of secretion. And when I am using the word seromucous type of secretion, what does that mean? The secretion is watery. Other than that, not only watery, it will have viscous material also being secreted, which will be of both serous and mucus type. And if we will have both variety of secretions seen in the gland, we will categorize that gland as a submandibular salivary gland. Is it okay? So we have got three glands. We have got the parotid gland having watery secretion. We have got the mucous gland having the sublingual mucus secretion. We have got the mixed variety, the mucous gland, which is having submandibular salivary gland. So done. This is the based on the nature of secretion. Okay. Now we'll talk about the differences between the serous and mucous acini. Now the next variety is differences between the serous and mucous type of secretion. So I just want everybody to concentrate on this image, so that this is a, so this table is showing you the differences between the two varieties of major type of the two varieties or major type of secretions which you have to know. On that variety, on that classification, we can describe the differences which is seen in the serous and mucous acini. So when you see the high power view, then you will be able to differentiate a mucous acini from the serous acini. Again, this is very, very important, and histological facts should be known to you. So the first image is of serous acini. So this is serous acini and this is the mucous acini. So this is the mucous one and this is the serous one. Now, if I talk about, so let's see the differences. So in the image, there is a schematic diagram to make you understand the difference between the serous and the mucous. So when you see the image of serous acini, it will have exactly this kind of a shape. So the serous acini. So I am just enlarging so that you can have a clear picture of this schematic diagram, which will help you to understand the shape of serous acini. So when you see the high power view of serous acini, you will see that the zymogen granules are there. So the zymogen granules will be there, the myoepithelial cells will be surrounding it, so that the contraction of acini can happen and the release of secretion is done. We will have a basal lamina also there, and there will be the presence of zymogen granules. Okay. So nucleus is, as you can see, nucleus is spherical, rounded, and the lumen, as you can see, if you will see the lumen in this case, the lumen is small. You can see the lumen is small in case of serous acini, and let's compare this image with the mucous acini. So when you see the mucous acini, what you can see in case of mucous acini, the mucous, just a minute. So when you see a mucous acini, what you can appreciate, the myoepithelial is also surrounding, but the lumen, I just want you to show the lumen. The lumen is large in case of mucous acini than in case of serous. Serous has got a smaller lumen. The nucleus is pushed towards the periphery. Why? Because in case of mucous acini, the secretion is viscous, so it will push the nucleus towards the periphery. Basal laminas are there, and in place of zymogen granules, there will be mucin droplets. Now, other than that, let's have a comparison of more of other features. So if I talk about the consistency of the secretion, the consistency of the secretion of parotid gland, that is serous acini, is mainly thin, watery, but mucus is thick and sticky. The nature of granules will be zymogen, and mucogenic granules will be in the mucus acini. The shape of nucleus, as we have seen in the image, is round and central in case of serous acini, but the shape of nucleus will be flat and peripheral in case of mucous acini. The lumen size is smaller in case of serous, and it will be larger in case of mucous acini. The appearance of cell boundary indistinct, but it is quite distinct in case of mucus. If we talk about the staining properties, if we are talking about the staining properties, so what we can appreciate, the staining properties, the serous is darkly stained as compared to lighter stained mucous acini. The example is the function is enzyme action in case of serous, and the example is parotid gland. Protection and lubrication is the example of mucous acini, and the best example of predominantly mucus secretion is seen in sublingual salivary gland. But parotid gland is having watery secretion, so it's an example of serous acini. Now we have done with the glands, but I just want, after this you should have a comparison between the three types of the gland. So we are knowing that major salivary gland which is lying in our body is of three varieties. We have got the submandibular salivary gland, we are having a parotid salivary gland, and we are having the sublingual salivary gland. So it is important to know the three distinguishing features between these three salivary glands. So let's start with this. So I just want firstly to make you understand that parotid gland is predominantly serous gland. Sublingual is, why I am using the word predominant? It is important for you to understand this word. Actually, predominantly means whenever the question comes, it is like the parotid gland is serous gland. But when I am using the word predominantly means most of the SNS is of serous variety. It doesn't mean that one or two mucus is not there. Sublingual is predominantly, it's predominantly mucus. So predominantly what means the major SNS will be of mucus type, and submandibular is mixed salivary gland. And why I am using mixed salivary gland? Because it will have both mucus and serous SNI. So it is called as mixed salivary gland. So it is called as mixed salivary gland. Now I just want you to give an idea of ducts and the SNS. So exactly, salivary gland is composed of secretory units and numerous ducts. Okay, secretory units can be either in the form of serous or mucus, and it can be either in the shape of tubular or it can be shape of globular. So that is how it is classified. So you can see again, this is a schematic diagram where you can see the mucous SNI with a flattened epithelium, with a flattened nucleus. Sorry, this is the lumen, and this rounded nucleus is the serous SNI. Now you can see these are SNS, and these are surrounded by contractile cells, that is myoepithelial cells, and from here the duct starts. So initial portion of the duct, when I am talking of the most initial portion of the duct, the most initial part of the duct is called intercalated duct. Intercalated duct. And then we will have the striated duct, which is having striations and also mitochondria in it. So actually what happens as we proceed to the duct, so when we are more proximally close to the SNI, the height of the duct lining epithelium will be lower. As you proceed more distally, so as you proceed more distally in the duct and you go near to the release of secretion of the duct or the distal most part of the duct, the lining epithelium will increase in height and it will become columnar or stratified type of epithelium. Now here the cells of salivary gland. So here this is one of the slide where you can see the one which has not taken the much of the, you can just see I am enlarging it. The one which is not taken much of the staining is the mucous SNI. Also, if you will see enlarged view, you can see this is the nucleus, N for the nucleus, and the nucleus is in the periphery. So these are all mucous SNI. Now we have a serous SNI which has rounded nucleus. As you can see, this is having the rounded nucleus, darkly stained, and these are the ducts. So these are the cut part of the duct which has been seen, punched out lumen. The duct will have punched out lumen, and this is A for adipose. This is A for adipocyte, which is having the nucleus towards the periphery. The nucleus will be lying towards the periphery. So we in this, so this is showing you the salivary gland SNI, both mucous and serous SNI, and we can appreciate with the shape and the staining property. We can see the nucleus rounded in the serous SNI. The nucleus is flattened, pushed towards the periphery in the mucous SNI. Now again, this is another schematic diagram. Actually, this is handmade diagram to show you the features of serous and mucous. Size is smaller. If you compare comparative size of mucous and serous SNI in case of any type of gland, the size of serous will be slightly lesser than the mucous SNI. The nucleus is towards the periphery. The lumen is wider in case of serous. The lumen is lumen is wider in case of mucous, and the lumen is very small in serous. Rounded nucleus is rounded, nucleus is flattened, flat nucleus pushed towards the periphery. Cell shape is tall, pyramidal, truncated, larger lumen, and staining is more in case of serous SNI as compared to that of mucous SNI. So this is a comparative feature of mucous and serous SNI. Most striking features has been written here. Now, serous cells contain, if I am talking about serous cells, it contains large amount of rough endoplasmic reticulum. What does it contains? The serous SNI contains large amount of rough endoplasmic reticulum, free ribosomes, and also Golgi apparatus. Actually, this is a very important for you to understand, has been asked in the previous year of INI-CT and NEET PG exam. It has got numerous spherical secretory granules. The protein secreting cells that store the secretion is in the form of zymogen granules, which we have talked. And if I talk about the zymogen granules, the granules are located in the apical part of the cytoplasm. The Golgi complex is seen. If I talk about the Golgi complex is seen in the supranuclear position in the serous acini. So we can see this is the GC means Golgi complex, and the Golgi complex are in which location? It is located in the supranuclear location. It is located in supranuclear location. So that means we have got zymogen granules in the serous acini, we have got rough endoplasmic reticulum, we have got the ribosomes, we have got secretory units. The secretory units and the zymogen granules are closer to the apical part of cytoplasm, and the Golgi apparatus will be close to the nucleus, so it is called as supranuclear in position. So done with this. Now can we solve an MCQs related to exactly this topic? Why I have told you this topic in much detail? Why? Because this was topic asked in the previous year of INI-CET NEET PG exam. So let's just see. Golgi apparatus in the serous acini is located. Golgi apparatus in the serous acinar cell is located at which of the following location? Supranuclear location, basal location, apical location, or adjacent to the nucleus. So this is the question being asked. Those who are live, please mark the right answer, dear. Dr. Punit, Mohammed, Jatin, Dr. Jatin, Dr. Kamalesh. Okay. Dr. Archana, Dr. Mangal, Dr. Wazir, Dr. Surpriya Sarma. Anyone who can give me the answer? Just now I explained the location of Golgi apparatus in the serous acinar cells. Just now I have explained, I have shown you the location of the Golgi apparatus in the serous acinar cell, and we are knowing that it is located in the supranuclear location. So definitely supranuclear location is the right answer. Now I would also like to tell you about serous demulins. So exactly earlier what happened, the serous, when we are talking of the serous demulins in the earlier aspect, the serous demulins was regarded as the artifact of HNE slides preparation, but now it is known that it is not an artifact. It is not an artifact. Actually, serous demulins is also in the shape of half moon. So when you will see the it is in the shape of half moon, and it is very important in the secretion of lysozymes, and it is having antibacterial properties, and it is also called as demulin of. So two important names are given to this serous. If I talk about serous demulins, two important name as given to it. One is called as the demulins or semilunar demulins. So and one is also called as the hidden hand. Okay. So that is exactly which has to be known to you. So it is also called as, because of this, please write down the name. Two names are given to it. It is called as crescent. Why? Because it is in the shape of half moon. So it is called as crescents of Giannuzzi. And it is also called as demulin of hidden hand. Okay, so this is the details of serous demulin which has to be known to you. Okay. Please write down the name. Okay. Now I just want you to show this is an electron microscopic view. Actually, it has got an antibacterial property. So exactly, it is a. So basically, it is an artifact of preparation of HNE slides, and because of that compression occurs, an expanded mucus will be having a cap of serous acini. So exactly, but it is now believed that it is also having a function of antibacterial, anti-lysozyme. It is having a function which is associated to it. It is actually secreting the protein. It secretes a protein which is containing. It secretes protein which contains, which is having lysozyme. So it is having antibacterial antimicrobial properties. Now here you can see this is. So in this diagram, this is mucous acini. So what is this? This is mucous acini, and the darker, so this is M for mucus and S for serous. So you can say mucus is wearing a cap of serous. Here also this is M for mucus and this is S for serous. So it appears like a half moon but having a cap of serous acini. So that is seen, and the maximum amount of seromucous serous dimulin is seen in submandibular salivary gland. Now here I just want you to show a schematic diagram showing you myoepithelial cells. We have seen the myoepithelial cells are surrounding the SNS, and it is important for the contraction of SNI so that the secretion is released in the duct and it will go more distally for the release. Myoepithelial cells are contractile cells, epithelial cells. Now here you can see the SNS has been shown. The myoepithelial cells are surrounding the SNI. This is the intercalated duct, which is the most initial part of the duct. Then we will have striated duct having striations. Then we will have interlobular, interlobar, then interlobar, and ultimately we will have the main excretory ducts. So the more distally we go, the height of the duct will increase in height, and it will become, firstly it will be simple cuboidal, then simple columnar, then stratified cuboidal, and stratified columnar epithelium. Now this is a histological slide which is showing you the slide of, this is taken from the De Furer's histology book. This is the adipose cells has been shown, and so many serous acini. So you can see, if I am just enlarging, you can see so many serous acini are there, and these are the punched out lumen. What is this? This is the duct. This is the duct, and this is simple cuboidal. So this is interlobular connective tissues, and these are the ducts which has been shown. D for ducts. This is A for adipose tissue. You can see signet ring appearance. The signet ring appearance of adipose tissue has been shown. And here you can see the striated duct has been shown. These are all striated duct, interlobular duct, intercalated duct, arterioles. And actually this is the slide of parotid gland. Why it is slide of parotid gland? If you see, you can see most of the SNS are serous acini. Mucous acini is not in this field, and most of the SNS which is seen is the serous acini. So this is a slide of parotid gland which contains so many ducts. So the number of ducts are there, striated ducts are there, and so many ducts are there along with the serous acini. Now I would like to show you another slide which is a parotid gland slide only, where you can see more of the important structures. So I just want to enlarge. Adipose cells with a signet ring appearance, and we have got the punched out lumens of the excretory duct. We have got so many serous acini, darker stain. Very nicely you can see the serous acini are darker stain. The connective tissue which is dividing it into different lobes, and striated ducts are there. So many ducts, all the forms of ducts, intercalated ducts, striated ducts, interlobar ducts, all forms of duct. So the smaller size will be of intercalated duct, then striated duct will increase in height of the epithelium, then we will have interlobar and the distal ducts. So this is how it sees. So this is the enlarged view of myoepithelial cells. Intercalated duct, as you can see, simple cuboidal epithelium is there. Striated duct, slightly the height of epithelium has been increased, and interlobar, more the height of epithelium has been increased. Now the next slide which I want, actually why I am showing you the slide of pancreas, actually this is the slide of pancreas which I am going to show you. So here you must be thinking, why ma'am is showing the slide of pancreas? The reason is that pancreas is having both exocrine and endocrine part. So if I talk about the pancreas, pancreas is having both exo and endocrine part. So there is difference between the exocrine part. So if I talk about the slide of pancreas, so this is a slide of pancreas which I already told you. So you have to know the difference between the exocrine part of pancreas and that of the parotid gland or the serous gland. So exactly what happens whenever you see the slide of pancreas, there will be presence of endocrine part of pancreas also, and we know that endocrine part of pancreas is consist of islets of Langerhans. So you will have islets of Langerhans here. So you can see this is the islet of Langerhans. This is the lighter stain islets of Langerhans, which will have different kinds of cell, alpha cells and beta cells, and these are all serous acini with zymogen granules and intercalated duct. Actually the duct which is not present in the pancreas, if I am talking about the duct which is not present in the pancreas slide, the duct is striated duct. Okay dear, very good, you have understood. So if we are talking about striated duct, If we are talking about striated duct is absent in case of pancreas, but it is present in serous acini. So pancreas will have less number of ducts. So if you will see the slide of exocrine part of pancreas also, which is also containing serous acini, but the pancreas will have no striated duct, and in place in the initial part of the duct is called centroacinar. So actually the duct of pancreas will start inside the acini. So it is called, pancreas will have centroacinar cell, less number of duct, and along with the exocrine plant, pancreas will have also got islets of Langerhans. It will also have islets of Langerhans, which is the endocrine part of the pancreas. Okay. So here if you will see, this is a centroacinar cell. So this is actually starting from the inside of acini. So centroacinar cells will be the most initial part of the duct, and this is a specific feature which is seen in the case of pancreas, where the duct will start from the interior of acini. So we will also have a discussion of pancreas when we will take this session of GI tract, where I will give you the details of the features of pancreas, histological features. So now I would like to solve an MCQs with you. So difference between exocrine and endocrine, difference between exocrine pancreas and parotid is. So this is again a question of INICT NEET PG exam. So please give me the right answer. What is the most characteristic difference which is seen between the exocrine pancreas and the parotid? Absence of striated duct, presence of acidophilic serous acini at the tip, serous acini supported by the basal lamina, apical acinar villi. So please mark the right answer. Difference between exocrine pancreas and that of endocrine, and that of exocrine pancreas and that of parotid. All of you, this was a question of the previous year INICT NEET PG exam. RO, BO, yes, Dr. RO and BO, I have just explained also. And I think he has catched the right answer, and he is absolutely right. So a thumbs up goes for him. Yes, just now I told you paucity of the duct, less number of duct along with absence of striated duct is the feature which is seen in the pancreas exocrine part as compared with the parotid serous acini. Presence of acidophilic serous is there. Serous acini is supported by basal lamina, and apical acinar villi is also there. The basic difference is the point A, that is absence of striated duct in case of exocrine pancreas, but striated duct is present in parotid. Centroacinar cells are present in exocrine pancreas, which is absent in parotid serous acini. So done. So the same thing, exocrine pancreas has a major type serous acini. It is having exocrine part which is serous, and one of an important feature is that there is no striated duct. The pancreas exocrine part is having no striated duct, no extrated duct. Now I just want you to show the slide of submandibular gland. So basically all of you are knowing submandibular gland is which variety, dear? All of you are knowing submandibular gland is mixed salivary gland. It is a mixed salivary gland. It is a mixed salivary gland. So here if you will see this slide, you can understand if I am just slightly enlarging it. You can see there is mucous acini. This is a mucous acini. Yes, no doubt about that. This is a mucous acini. This is a mucous acini. This is a mucous acini. So you can see so many mucous acini are there. Serous demulins is also the number, along with serous acini is there. So both serous and mucous acini is there, and so many serous demulins. So here you have got the serous demulin, you have got the mucous acini, mucous acini, mucous acini. M for mucous acini, so much of serous acini, adipose, A for adipose cells. So basically both types of serous and mucous acini is there, and maximum number of serous demulin is also present in submandibular salivary gland. One of the important point here which you can note down. Maximum number of serous demulin is there. Serous demulin is there. So maximum number of serous demulin is present in submandibular salivary gland. So actually sublingual salivary gland is also having serous demulin, but if the MCQ come, and it has been asked in the previous year of examination, maximum number of serous gemellin is present in submandibular salivary gland. Now I would like to show you the slide of sublingual, which is predominantly mucus type of gland. Okay, so here if you will see the slide, you can see maximum, if you will see the maximum of the SNI is of mucus variety. Mucus, 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 mucus. Few serous SNIs are there. Also serous gemellin is there. Also the presence of serous gemellin is there. But the presence of serous gemellin will be less. Presence of serous gemellins will be less than the submandibular salivary gland. Mucus is more and few serous SNIs are also there. So basically that is a very important point to keep in mind when you are going to identify whether it is a slide of submucus, whether it is a slide of sublingual gland, submandibular salivary gland or parotid salivary gland or the slide of pancreas. So we have done with this. I would like to just solve actually in relation to the gland. We have got two important MCQs to be discussed. Then I will give you a break of 10 minutes. Is it okay? Dear students, just two MCQs of the previous year and one is very twisted, but I will actually one of the MCQ is a mixed variety of gland and also the skin, but I would like to explain here itself. So which of the following? So this is a previous year INICET NEET PG exam. Please solve this MCQ along with me. Which of the following exocrine ducts are not obstructed in cystic fibrosis? Which of the following exocrine, so please note down, exocrine glandular duct is not obstructed in cystic fibrosis? So take your time, take your time. I will give you few seconds to solve it. Anyone wants to give the answer? Anyone who wants to give the answer? So any answers? Anyone? Sweat gland. Okay, so the answer is coming C with many of the students, sweat gland. So basically, so a very good answer given by Dr. Vijay, ROBO, absolutely correct. Yes, sweat gland is absolutely right answer. Actually, the reason is that sweat gland is mainly secreting sweat. So it is mainly having water, ions in it. And other than that, pancreas will have watery secretion, but it will have few of the mucus. So that can be blocked in case of cystic fibrosis, lungs. So best answer, which is most of watery and it is just having sweat, water and some ions. So we'll go with sweat gland is the right answer in this case. Absolutely good, dear. Now, which of the following marked structure represents a merocrine gland? Which of the following structure is a merocrine gland? A, B, C, D. Which of the following structure is a merocrine gland? A, B, C, D. If you want, I will just A, B, C, D. Which of the following is a merocrine gland? I just enlarge this. I have just enlarged this so that you can understand which is merocrine. This is also previous year INICET and NEET PG exam question. So ROBO is telling C. Merocrine gland. So now try once again. No, once again it's not correct. Merocrine gland. So firstly, if you want to solve it right, you can tell me what is A, what is B, what is C and D. So Dr. Vijay, Dr. ROBO, you try. Otherwise, I will also give you the hint what is A, B, C and D. Then you are able to know what is merocrine gland. You know most of the glands are of which variety? Merocrine, in which the secretion is by the process of exocytosis. Okay. So firstly, you have to know in this, actually this is a slide of skin. So only I told you skin I have not done. So it is, this question is also from the skin, but gland I have solved here itself. Gland I have explained you. So I am asking this MCQ. try to solve, otherwise when I will come with the topic of skin, you will sure able to solve. So Priya, Dr. ROB and all are telling B. Okay, so can you tell me what is B? So yes, B is the right answer. Now tell me what is B? What is B, dear? What is B? C is no, C is not sebaceous gland. What is B? What is B? No, dear, C is hair follicle. C is hair follicle. C is hair follicle. D is, what is D? What is A? Anybody? B. What is B? B is sweat gland. B is sweat gland. A is sebaceous gland. D is adipocytes. D is adipocytes. D is adipocytes. Now I will tell you how you are going to identify this slide. So first thing is that you can very nicely, I am using yellow color for highlighting the hair follicle. So what is this? This is the hair follicle. What is it? This is the hair follicle. Now this is showing you, this is a slide of skin. Why? Because this is stratified squamous keratinized epithelium. So this is showing the skin slide. This is a slide of skin, no doubt about this. This is skin slide showing stratified squamous keratinized epithelium. So this is a skin slide. Now in the skin we have got sweat glands, and close to the hair follicles we have got smooth muscle. So this is erector pylorus muscle, and this is the sebaceous gland. So close to this hair follicle we will have erector pylorus muscle, and this is the sweat sebaceous gland. Why this is sebaceous gland? This is important for oily secretion of the hair follicles, sweat gland and adipocytes. Now we will have a merocrine gland. So no doubt hair follicle and adipocyte is not any type of gland. We have to choose sebaceous gland and sweat gland. So can you tell me which type of gland is sweat gland and which type of gland is sebaceous gland? This I have explained. Can you tell me that sweat gland is of which variety? Sweat gland is of which variety and sebaceous gland is of which variety? That will give you the right answer. That will give you absolutely the right answer. So we know that sweat gland is of which variety? Any answers coming up? Sweat gland is of merocrine type of gland. And sebaceous gland is holocrine. Sebaceous gland is holocrine type of gland. So that means in the following mark structure, we have to know which of the following is merocrine variety. So what will be the answer? B. B is the right answer. It is of merocrine variety. B is the right answer. It is of merocrine variety, which is the sweat gland, which is having the secretion by the process of exocytosis, and is the most abundant type of gland in our body. Is it okay? Have you understood? So till now, we have completed the topic of whole of epithelium. We have seen the entire epithelium, important examples of epithelium in our body, and a extensive list I have given you along with the examples. Other than that, we have talked about connective tissues, and we have seen the details of all the cells of connective tissue, the fibrocytes, the fibroblasts, plasma cells, B cells, histamin cells. Many of the cells we have discussed. We have also discussed the other important structures like reticular fibers, the identification of reticular fibers, the role of reticular fibers, the types of collagen fibers, the identifications of the elastic fibers, collagen fibers, the examples of dense regular connective tissue, dense irregular connective tissue, loose connective tissue, elastin, and all we have done in detail. We have also talked about the ground substance. And after that, I have discussed with the slide of, we have discussed the topic of glands. So glands is a very important topic, and we have gone through the list of classification of glands in terms of its process of secretion, apo, mero and holocrine glands. We have also talked about number of ducts, simple and compound, and their classification. We have talked about exo, endo, cytocrine glands. We have talked about number of glands and how they are classified, and how we are going to identify each of the gland along with the examples. So I hope this is useful for you. So I will give you a break of just 10 minutes. Is it okay? A break of 10 minutes and then we will again start with the topic of blood vessels. So I will start with the blood vessels. Is it okay? Can we have a break of 10 minutes? So I just want you to give a break of 10 minutes. Then I will start with the topic of, blood vessels. Is it okay? So again, we will meet after a break of 10 minutes. Thank you. All the best and keep studying. Okay. Small break, just a small break. Okay, ROBO. It's okay. Thank you. Hello everyone, am I audible? Let me just check. Let me just check with the students. So yes, hello everyone, am I audible so that we can start the session? So till here we have finished, and the next topic which I want to start is the general structure of the blood vessels. So the next topic which I want to start is the blood vessels topic. So let me just check, am I audible? The screen is clear. Let me just have a look. Okay. Okay. Yeah, so I am audible. So everything is fine and I am audible. Yeah. So yes, now the next topic is the structures of the blood vessels which has to be done, and this is an important topic. You have to understand this, and you have to know about all the important aspects. So general structure of the blood vessels, the first thing which I want everybody to know is about the structures of the blood vessel, which should be known to you. Okay. So if I talk about the blood vessels, you can see this diagram and you can understand the important aspects of the blood vessels. So we have done with the glands, and here you can see all the layers of the blood vessels from outside to inside it is having. So if I am talking about the general aspect of the blood vessels from outside to inside, or the other way you can go from inside to outside, we have got three layers. We have got tunica intima, we have got tunica media, and we have got the tunica externa. These are the three layers of the blood vessels. Okay. So how to identify these layers and what are the features to identify, and what are the features of large arteries, large vein, and muscular artery? Also, the differentiating point about these are that in between the intima and the media we have got the internal elastic lamina, and in between the media and adventitia we have got the external elastic lamina. So we have to know all these structures to understand the histology of blood vessels. So as I have already told you, if we are going to talk about the important layers, the which is as we are going to talk about the important all the blood vessels and the basic structures and the three coats, we have to know that the most innermost coat is the tunica intima. So the innermost coat is the tunica intima, and it is composed of endothelium. Lining epithelium is endothelium, and as in the epithelium class I already told you, it is made of simple squamous epithelium. So what is the lining epithelium here for the endothelium of the blood vessel? That is simple squamous epithelium, and will be having subendothelial connective tissue. Now if I am talking about the tunica media, it is mainly made of the connective tissue and smooth muscle fibers, and adventitia is fibroelastic connective tissue. It is made of fibroelastic connective tissues. It is made of fibroelastic connective tissues. Done. Now you can see this image where you can see the elastic artery. You can see this image where you can appreciate the elastic artery image. So when you are talking about the elastic arteries, here you can see from inside to outside the layers are. So if I are talking about the layers of elastic artery, as you visualize from inside to artery, outside we have got the endothelium layer as the innermost layer. Then we have got the subendothelial connective tissues. Internal elastic lamina, the wavy line which you are seeing, this is the internal elastic lamina. The elastic fibers, so many elastic fibers are there, and we have got a thick tunica media. So here this tunica intima and this thick tunica media layer, and then we have got the tunica adventitia layer. So in the outside part, in the tunica adventitia, we have got vasa vasorum. What is vasa vasorum? So actually the outermost layer of tunica, the outermost layer of elastic artery or the big artery, the large artery, is tunica adventitia, which is also called as tunica externa. It is having vasa vasorum for giving nutrition to the outer layer. So generally blood vessels is also having the nutrition by the flowing blood, by the process of diffusion. So outermost layer, if it is a thick walled structure, the outermost layer will have to take its nutrition from the small blood vessels is there to provide nutrition to the outer layer, that is called as the vasa vasorum. Now large, so let's talk about the large arteries. So if I am talking about the large elastic artery, the other name of large artery is, it is also called as the conducting artery. And the important example of these kind of conducting arteries, if I am talking about the important arteries which is regarded as the conducting arteries, which is conducting the blood. So exactly what is the function? It conducts the blood from the heart, and we have got the big arteries like aorta, arch of aorta, and branches. So thickness of the wall is, if I am talking about thickness of its wall, it is 1/10 of the luminal diameter, and that also slightly varies. So it is 1/10 of the luminal diameter. The principal structure which lies in the wall exactly is the elastic fibers. And what is the function of this elastic fiber? The principal function of these elastic fibers residing here, that will allow expansion during the contraction, that is systole, that is the and diastole of the heart. The necessary blood pressure is maintained so that the blood flow more evenly through the other arterial channels. So these are the major characteristic feature of elastic arteries or the large artery. Now let's talk about the three layers. So as I told you already, if we are talking of any vessels, the layers will be arranged as I told you. Innermost layer will be tunica intima, then we will have tunica media, and then we will have tunica externa. So tunica intima is 100 micrometer thick. It includes, again, it will have subendothelial layer and it will have the endothelium. So it will have subendothelial and endothelium connective tissues. Subendothelial connective tissue is consist of Harshita. Yes, Harshita, the madam, the last slide, second point, please explain. Harshita, thickness is 1/10 of the luminal diameter. So if something is like this, see here. So if the lumen is like this and this is the thickness, so that means this is the thickness of the wall and this will be the lumen. So that means lumen. So that means if this is the lumen, so the diameter of lumen, that this thickness of the wall will be 1/10 of the dimension of the lumen. Got it? Harshita, that means the diameter of the of this wall will be 1/10 the diameter of the lumen. So this we mean by the luminal diameter. So the thickness of the wall is approximately 1/10 of the luminal diameter. Is it okay, Harshita? Got it? Okay. Now here the subendothelial connective tissue contains fibrocyte, macrophages, and smooth muscles, and it contains myointimal cells, and these cells of the muscle fibers, elastic fibers, are oriented in different direction. Tunica intima is poorly, so exactly the demarcation, as I told you, the demarcation of the intima, media, and externa is by internal and external elastic lamina. So if I am talking about the demarcation of tunica intima and the demarcation of tunica media. So the demarcation of tunica intima and media is by internal elastic lamina. What is this IEL means? Internal elastic lamina. That demarcation is there, but their appreciation is not so clear as you see the slide of muscular artery. So there will be the demarcation or will be present, but that fenestrated internal elastic laminar demarcation will be more prominent in muscular arteries. Now talking about the tunica media layer, tunica media is consist of 40 to 70 layers of fenestrated elastic lamina, and the outermost elastic lamina will be thickened to form external elastic lamina, but the demarcation will be not evident as the case of muscular artery. That image I will show you. Tunica adventitia is the outermost layer, which is the fibroconnective tissue carrying blood vessels, vasa, vasorum, and some unmyelinated sympathetic fibers. So nerves will be there and small blood vessels will be there, that is called as vasa vasorum in the outermost layer of tunica externa or adventitia. Okay dear, now we have done with this. The next group of arteries, so here we can see this is the slide, and you can see the thickest layer is tunica media. The thickest layer is in the case of elastic artery is tunica media. Actually tunica media is, in case of elastic artery, tunica media is 3 times more thicker than tunica adventitia. So the thickness will be 3 times more than the tunica adventitia in case of elastic artery. Now moving to the muscular artery. So muscular artery is also called as medium sized artery. It is also called as distributing artery. It is also called as distributing artery. So what are the branches? What are the arteries which is called as muscular artery? The branches of external carotid artery, radial ulnar artery. So in our body we have got many muscular arteries. We have got peroneal arteries, we have got profunda brachii artery, we have got lingual artery, facial artery, ascending pharyngeal artery, occipital arteries, radial artery, ulnar artery, popliteal artery. So many arteries are there which is regarded as the muscular artery. It distributes blood to the body and the wall of thickness is 1/4 of the luminal diameter. Is it okay, Harshita? Now the diameter of the wall of muscular artery will be 1/4 of the luminal diameter. And there is presence of smooth muscles in its wall which is regulating the blood by the process of vasoconstriction and vasodilatation. Okay. Now this is the slide of muscular artery and you can see actually in case of muscular artery, in large muscular artery, in case of large muscular artery, there is the presence of vasa vasorum. So in case of large muscular artery, there will be the presence of vasa vasorum in the outermost layer. There will be presence of vasa vasorum in the outermost layer. Okay. Now here in this diagram, you can see this is the lumen. This is the tunica intima layer, the first layer. This is the tunica media layer, the second layer, and this is the tunica in externa adventitia layer, the third layer. Now here in this diagram you can clearly see that there is a prominent internal elastic lamina. So there is a prominent internal elastic lamina which is seen in between. So this is an internal elastic lamina which is seen in between the tunica intima and media, and also there is a prominent external elastic lamina which is seen in case of tunica adventitia and tunica media. So in case of medium sized or muscular artery, there is also presence of elastic fibers, but the presence of elastic fibers are less than of elastic artery or large artery. So the differentiation of the three layers, that is tunica intima, tunica media and tunica adventitia is quite easily appreciated. So we will have the thickness of tunica media and adventitia equal in this case. So if we talk about tunica media and tunica adventitia, they are 1:1. Why? Because the thickness is approximately equal of tunica media and adventitia. In case of elastic artery, the tunica media was 3 times more thicker than tunica adventitia. Okay. Now I would like to talk about the 3 layers of the muscular artery. Let's talk about the first layer, that is tunica intima. So now the layers will be similar as you proceed from inside to outside. The innermost layer will be tunica intima, which is made of endothelium and internal elastic lamina. So there will be endothelium, there will be internal elastic lamina, but there will be no subendothelium. So please note down, in muscular artery, there is no presence of subendothelium. Internal elastic lamina is a refractile membrane, and you can see there will be internal elastic lamina will be wavy, and this will be wavy due to the contraction of smooth muscle in the media, and it is quite evident. We can clearly see the tunica. Internal elastic lamina in between tunica intima and tunica media. The next layer is tunica media. It is actually, if I talk about tunica media, it is made of mainly smooth muscles. Okay. So if we talk about tunica media, it is consists mainly of smooth muscle. It is mainly consists of smooth muscle cells arranged circularly, which is arranged circularly about 40 layers. Arranged circularly about 40 layers. And hence it is termed as muscular layer. It contains elastic fibers and it contains collagen fibers which is mixed with the smooth muscle cells. If I talk about tunica adventitia, it is the inner part of the, so if I talk about an adventitia, it contains more of elastic fibers the middle part, if I talk about inner part of tunica adventitia, more of elastic fibers than collagen. Middle fibers is having more collagen, and the outer part is merging with the surrounding areolar tissue and the connective tissue. So basically, if you will see the muscular artery, again the muscular artery is made of three layers: tunica intima, tunica media, and adventitia. So internal elastic lamina and external elastic lamina is quite evident because the separation of the layer can be seen, because elastic fibers are there, but the amount of elastic fibers is less as compared to large elastic artery. Also, the internal elastic lamina is wavy and refractile. So this is a slide of muscular artery where you can clearly see important features here. You can see the lumen. You can see the lumen. This is the tunica TI, tunica intima layer. This is tunica media, and this is the tunica adventitia layer. This is tunica adventitia, and you can see the wavy line here. This is the internal elastic lamina, and this will be the external elastic lamina, which is also evident in this case. You can just label it. This is IEL, internal elastic lamina, and this is external elastic lamina. And you can approximately see the thickness of tunica media. So you can clearly see, if I just want to make you clear, this will be the thickness of tunica media, and both thickness of tunica media and adventitia is approximately equal, 1:1. Now let's talk about the veins. The next important structure is the vein. So we have to know about the general features of the vein. We know that the veins are thin walled as compared to arteries, and they carry blood from capillaries to the heart. So what is the function? They are carrying the they are thin walled blood vessels that carry blood from the capillaries to the heart. So they are having valves also. Another important point is that veins are formed by the, if we talk about large vein, they are formed by the union of smaller veins. So veins has got tributaries and arteries will have branches. They are often provided with valves to serve the flow of blood in one direction, that is from superficial vein to that of deep vein. So basically, they serve the blood flow in unidirection, that is from superficial to deep. Now here we can see the slide of vein, as you can see in this diagram, where again we can see tunica intima, tunica media, and tunica adventitia. The innermost layer is tunica media, which is also having endothelium. And here in case of large vein, what you can see, the thickness of tunica adventitia compared to the thickness of tunica media. Tunica adventitia is 3 times thicker than that of tunica media. Okay. And here you can absolutely see the smooth muscle fibers are seen in the case of the tunica media, and a thick tunica adventitia or externa is seen. Also, vasa vasorum, actually large blood vessels or large vein contains maximum number of vasa vasorum. So if the question comes, maximum number of vasa vasorum is present in which structure, the answer is maximum number of vasa vasorum is present in tunica adventitia of the large veins. Now large vein example is superior vena cava and inferior vena cava, and they have got following layers. So tunica intima is well developed. It is having both endothelium and subendothelial connective tissue. Subendothelial connective tissue which was absent in muscular artery. It is media is very thin or absent, and other important point of veins, lumen will be the lumen is collapsed. So it is well developed adventitia and is the thickest coat. It is having many longitudinal smooth muscle fibers which is embedded in the connective tissue layer. So the largest or the thickest wall is tunica adventitia, and it is having the presence of valves. Here I remember one point. Maximum number of valves are present. Maximum number of valves are present in large great veins, or you can say large veins in the tunica adventitia layer. Maximum number of maximum number of valves, no, maximum number of vasa vasorum. So if I am talking about vasa vasorum, the maximum number of vasa vasorum, we know that large vessel will have vasa vasorum for providing nutrition to the outermost wall. So in that case, large number, we already know, if we have to know the maximum number of this vasa vasorum is present in which layer, so we'll mark the right answer as the great veins or large veins. Now medium sized vein is having certain difference from the medium sized artery. It is having a collapse, so it is a very important point that the vein will have a collapsed lumen. It will have a collapsed lumen, irregular collapsed lumen. Thin wall with tunica media having few smooth muscle fibers and will have less elastic fibers. No internal elastic lamina will be present, and presence of valves prevent the backflow of the blood. So this is basic difference which you can appreciate between the medium sized artery and medium sized vein, that the veins will have valves. No internal elastic lamina will be present in the veins. The veins will have the collapsed lumen, and that is a very important point. Now let's talk about the medium vein. So when we are talking about medium vein, it is also having tunica intima, tunica media, and tunica adventitia. So if I am talking about intima, it is made of endothelium supported by subendothelial layer, and does not have internal elastic lamina. Okay, it is not having internal elastic lamina. If I am talking about tunica media, it is composed of smooth muscle fibers which is embedded in collagen fibers, and elastic fibers are few. Elastic fibers are also less in case of the medium veins, and adventitia will have the connective tissue and will also have the nerve fibers and vasa vasorum. Now, this is a slide. This is actually schematic diagram showing you the difference between vein and artery. So, you can see that externa and media is approximately of same thickness. If we are talking about tunica externa versus tunica media, it will be 3 times approximately in case of large vein. And vasa vasorum will be there. Internal elastic lamina will be present in here. External elastic lamina, both this will be absent. Internal elastic lamina and external elastic lamina will be absent in case of veins, and valves will be present in veins. Now this is again showing a histological image where you can appreciate in case of veins, it is having a collapsed lumen. So what you can say, it is having a collapsed lumen. Irregular collapsed lumen, and this is having a round lumen. Round well defined lumen in muscular artery. Other than that, this is tunica adventitia and this is tunica. This is tunica media. This will be tunica intima. So tunica adventitia, if you will see, it is 3 times thicker than tunica media. Here this is the wavy line. This is tunica intima. This is the wavy line which is the internal elastic lamina. This is IEL which is present, and this is the tunica media, and this is the tunica advent. Approximately this is 1:1. Okay, this is the two difference between the veins, medium sized vein and medium sized artery. Now we will talk about arterioles. So firstly, I would like to tell you about the important general features of arteriole. So, it's small artery which is having a diameter of less than 0.5 millimeter is an arteriole. It has a thick wall related to the size of a small circular lumen. It is having the terminal part of the arterioles is called meta-arterioles, and their smaller lumen has got few smooth muscle in it. So smooth muscle act as a pre-capillary sphincters. What is the function? They are acting as a sphincter, pre-capillary sphincter, to make the blood regulate and flow through the capillary network according to metabolic needs. Okay. So basically, just to summarize important functions, or just to summarize the important function of arteriole, it will also have three layers: tunica intima, media, and adventitia. Here, the tunica intima layer is just composed of endothelial. They have got no, they have got neither subendothelial layer, no internal elastics. That means both subendothelial layer and internal elastic lamina is not present in arteriole. Tunica media is having 1 to 5 layers circular smooth muscle. Adventitia is thin and poorly supported, and it will have few of smooth muscles surrounding it. Now, arterioles, as you can see in this diagram, we are talking about the arterioles here, which will have no subendothelial connective tissue in tunica intima and will have no internal elastic lamina. Okay. Now coming to venules, we will talk about the venules. If I am talking about the venules, it is having a thin, large collapsed lumen. No, it is composed only of endothelium, composed of 1 or 2 smooth muscle layer and rich connective tissue. So it have connective tissue rich in collagen fibers on the outermost. So venule, it is having the collapsed lumen, and it is having a large collapsed lumen and smooth muscle fibers on the outer aspect. Now, capillaries. Now, let's talk about the capillaries. So, we know that capillaries are actually, arterioles will break up. If I talk about the arterioles, they will further break up into the capillaries. Capillaries are called as exchange vessels. So, the other name of capillaries are, they are termed as exchange vessels. And exactly, if I talk about the capillaries, they are involved in the exchange of gases, nutrients, and metabolites between the blood and the tissue. So, major function of capillaries is the exchange of nutrients and metabolites between the blood and tissue. It is having high metabolic rate, and capillaries are present in a higher number as a network in kidneys. Wherever we have got kidneys, livers, and cardiac muscles, the capillaries will be present in the form of networks. Now, structure. So, if I just want everybody to understand the structure of capillary, and it's very important to know the diameter of the capillaries is approximately 7 to 9 micrometers. So, this is the diameter, 7 to 9 micrometers. It is lined by endothelial cells. It is lined by endothelial cells which are 2 or 3 in number in the cross section, and forms tunica intima, and it is forming the tunica intima layer. Structures. The margins of endothelial cells are held together by tight and gap junction. Numerous so exactly what numerous pinocytic vesicles are seen in the cytoplasm. They are involved in the transport of materials across, so that exchange of gases and nutrients can happen. There is adventitious cells, which is also called as pericyte cells. This is very important, that the name of the cells, that is, it is having pericytes and adventitious cells, which is present in the basement membrane of endothelium, constituting the tunica media. It is also having contractile filaments, and which is all important for the exchange of gaseous material and nutrients across the tissues and the blood. So these are important function of the capillaries. Now, why we have to know about this detail? Actually, the capillaries are again divided into three types. We have got somatic capillaries, we have got fenestrated capillaries, and we have got sinusites. It is important that you should be knowing the important features of differentiation of these capillaries. So let's talk about one by one. Continuous or somatic capillary. What do you mean by continuous and somatic capillary? Actually, this is the most common type of capillaries which is present in the connective tissues. This type of capillaries are present in connective tissue, muscles, brain, and lung. The endothelial cells are forming a continuous lining of the capillaries, and there is no break in the endothelial cells of the capillaries. So actually, you can see this diagram where you can see the continuous capillaries, you can see the fenestrated, and you can see the sinusoidal capillaries. Now, the discontinuity, there is no discontinuity in the endothelium and the basement membrane of the capillary. There is fenestration or gap in the endothelial layer of the capillaries, then it is fenestrated type of capillary. It's more permeable than the somatic or continuous capillaries. The sinusoidal is the third variety where the discontinuity or gap is not only, as you can see in this diagram, the discontinuity or gap is not only in the endothelium but also in the basement membrane, and they are highly permeable type, which is present in spleen, which is present in the liver and bone marrow. Fenestrated one will be present in the kidneys, and continuous is present in brain, connective tissues, and the muscles. So which we have done. Now, fenestrated is called as the visceral capillaries. Fenestrated are called as the visceral capillaries. There is a presence of tiny pores in the endothelial cells. The pores are often get closed. If I talk about the pores, they are often get closed by thin diaphragm that is thinner than the cell membrane, and this will allow diffuse substance and macromolecules to pass through it slowly. Okay. Now coming to the visceral fenestrated, the permeability of such kind of fenestrated visceral capillaries are much more than the somatic and continuous capillary. The major importance of these capillaries is exchange occurring between the tissues and the blood, and the major example where they are present of fenestrated or visceral capillaries are, they are present in intestinal villi, kidneys and endocrine gland. So these are the examples where it is present. The fenestrated or the visceral capillaries, the fenestrated or the visceral capillaries are present in kidney, endocrine gland and the intestinal villi. Sinusoid capillaries. Now talking about the sinusoidal capillaries. If we are talking about sinusoidal capillaries, they are highly permeable capillaries. They are present in red bone marrow. They are present in homopoietic structure, red bone marrow. Thin, they are lumen, they have got a large lumen of 30 to 40 micrometers. They are lined by discontinuous endothelium. They are lined by discontinuous endothelium in the basal lamina, and the gaps of these gaps which is present here in the endothelium is permitting the transfer of blood cells and macromolecules. The phagocytic cells are present in their wall. The best example of sinusoids, we have got splenic sinusoids present in the spleen, and we have got also the Kupffer cells are the sinusoids present in the liver. Now we have done with this. Now I want everybody to solve an MCQ related to this topic. So let's solve it. Is it okay? RDX and Dr. Harshita, So can you identify this histological slide given below? This is an image based question and you have to identify the slide. So can you identify the slide? Identify the histological slide given below. Whether it is muscular, vein, elastic artery or the arteriole. Identify the histological slide given below. Identify the histological slide given below. Anyone? Dr. ROBO, Dr. Harshita, Dr. RDX, Dr. Puneet, Dr. Jitin, Dr. Kamlesh, Dr. Archana. Identify the slide. This is the histological slide. You can see the lumen is well defined. Doctor is telling elastic artery. No, a lumen is there. A well defined lumen is there. Let me give you the hint. A well defined lumen is there. This is tunica intima. This is tunica media. This is tunica externa or adventitia, and also internal elastic lamina is very clearly seen. This is a refractile. This is IEL, internal elastic lamina, and also a wavy external elastic lamina is there. Now you tell me which is the slide. Now you tell me which is the slide. Which is this slide? No, Dr. Elastic artery is not the right answer. Tunica and the thickness of tunica media is equal to tunica adventitia. That is 1:1. Now you tell me which is the right answer. Whether it is muscular artery, vein, elastic artery, arteriole. Anyone with the correct answer? Anyone with the correct answer? My dear, the right answer will be muscular artery. So we have got muscular artery as the right answer because tunica media and adventitia is of equal thickness. The lumen is there. Internal and external laminas are evident. Now you can exactly see this is how this can be differentiated. So here somewhat like this image was there, lumen was there. It's okay dear. It's okay, don't be sad, it's okay. internal elastic lamina, external elastic lamina, media and adventitias were there, and also this vein will have a collapsed lumen, and adventitia is thicker than tunica media. Okay, done. Now the next topic is muscles. Okay, so muscles, actually you will study much detail in the physiology part. So I am just giving you the differentiation of the histological aspect of the muscles, not much detail because it will be taken in the physiology part. Types of the muscle, how many types of the muscles we have got? We have got three types of the muscles. We have got skeleton, striated, smooth muscle, and we have got the skeleton, striated, smooth muscle, and we have got the cardiac muscle. So we have got three varieties of the muscle which must be known to you. Okay. Okay, dear. If you have got any doubt, please ask me. So here in the first image, we can see this is the skeleton muscle. This is the cardiac muscle. This is the smooth muscle. The smooth muscle shape, as you can see, is the spindle shape. This is the spindle shape. This is having actually striation and intercalated disc. So this is what this line which you are seeing, this is the intercalated disc. So this is cardiac muscle because of the IC intercalated disc, and this is the nucleus in the cardiac muscle will be in the center. In the skeletal muscle we will have a more of striation prominent, and this is having a striations very prominent due to the regular arrangement of actin and myosin, and nucleus is towards the periphery, multiple nucleated and towards the periphery. Now, general features, if I talk about the general features of the muscle, individual muscle fiber is covered by, is wrapped by, if I talk about individual muscle fibers, it is wrapped by endomysium. It is wrapped by endomysium, and all of these muscle fibers, if I talk about all of these muscle fibers, they again form muscle bundle or muscle fasciculi, and they have got a covering which is called as the perimysium. What is it called as? It is called as the perimysium. And the entire muscle is covered, all these will entire covered by an outermost covering of deep fascia that is called as epimysium. Now, it's also important for you to know actually two types of muscles, skeletal muscle fibers we have got. One is called as the red and the other is called as white muscle fibers. So, red muscle fibers is called as aerobic or type 1 variety. So, red muscle fibers are called as aerobic or type 1 variety because high content of myoglobin and cytochrome is there, but in case of white muscle fibers, they have got less amount of cytochrome and myoglobin. So that means if it is having more of myoglobin and more of cytochrome, that means the red muscle is having more of mitochondria in comparison to white muscle. Now, rich blood supply, definitely if it is having more mitochondria, the red muscle aerobic type will have more of blood supply as compared to white. And exactly the also the succinate dehydrogenase myosin ATPase is positive as compared to succinate dehydrogenase myosin ATPase will be negative. Okay, we will understand in the biochemistry class where you will know about the Krebs cycle and all. Slow continuous contraction, not easily fatigue the red muscle because it is having more of myoglobin, more of cytochrome, more of mitochondria. Rapid contraction is there but easily fatigue. Smaller in diameter, the example of red muscle fibers are postural. Larger in diameter, and the example of white muscle fibers are extraocular muscles and the flight muscles in the birds. Okay, these are the basic difference between red and white muscle fiber. Now let's see this image where you can see the skeleton muscle. H&E staining you can see. You can see the longitudinally running muscle fibers as shown in this diagram. You can see the muscle fibers and the nuclei is there. So you can see the nucleuses is there, multinucleated towards the periphery, and transversely cut muscle fibers are also shown. So we have got transversely cut muscle fibers and nucleuses are running towards the periphery. Okay. And striations, as you can see, if I just enlarge this image, can you see there is striations? If you will see this, thick actin, myosin. So there are an evident striations present in the case of skeletal muscle fiber. Now this is a transverse section of skeletal muscle fiber. The nucleus is towards the back. These are all nucleuses, and peripheral multiple nucleuses. Endomysium is seen. We will have the perimysium and also the epimysium overall, and capillaries in between. Now skeletal muscle, I have just shown you two images where one is the longitudinal and another is the TS section. This is TS, transverse section, and this is the longitudinal section. Very nicely you can appreciate the cross striations which is made of the actin and myosin in case of longitudinal section. Also the multiple nucleus fibroblast of endomysium has been seen towards the periphery. In the transverse section, the muscle fibers has been seen with the nucleus. Endomysium is very nicely seen. Also in this case, the outside covering of the perimysium of the entire muscle bundle. So this is one muscle bundle, this is another muscle bundle, this is another muscle bundle, and all of this muscle bundle and fasciculus are entirely wrapped by the perimysium, that is the deep fascia. Now structure of one myofibril is that it will have inside a muscle, it is muscle fibers which is made of myofibril, which will again have dark band and I band. So I is the light band and A is the dark band, and we can see that in the we can see that Z disc is there. There is a Z disc. In the I band there is a Z disc, and the distance between two Z discs is sarcomere, and actually sarcomere is the structural functional unit of the muscle fibers. So the basic difference of red and white we have already done. We are knowing more of blood, more of ATP, more of cytochrome, more of blood supply. All of these are the features of red muscle fiber. Postural muscle is example, less myoglobin, less cytochrome, poor blood supply, rapid contraction, and extraocular is an example of white muscle fibers. Now we will move with the next muscle slide, that is the cardiac muscle. Now when I am talking about the cardiac muscle, the basic difference between skeletal and so actually what happens many times, if you are not paying attention, you can confuse the skeletal muscle as the cardiac muscle. So how you are getting how you will be able to differentiate these two is by the presence of intercalated disc. In case of cardiac muscle, there is presence of intercalated disc. So here you can see these structures which I am showing you. This is the intercalated disc. And this intercalated disc is an important or characteristic feature which is very important for you to see in the case of conformation of the slide of cardiac muscle. Also striations are there. So please note down, striations are also there in cardiac muscle, but the fibers, if you see the striations and cross striations is there, and also they are the muscle bundles are, as you can see, is crossing. It is crossed. And the nucleus will be in here in the center. So here also you can see the nucleus binucleate. So nucleus will be in the center, not towards the periphery. This is a cut section showing central nuclei, which is showing, which is also showing the coverings, and the intercalated disc is present and seen more clearly in the longitudinal section of the cardiac muscle. Now, I just want everybody to pay attention to cardiac muscle and intercalated disc. Cardiac muscle fibers are shorter than skeletal muscle fibers. They have branched pattern, and they have one or two nuclei in the center, which the nuclei in the skeletal muscle is in the periphery. Most striking feature of cardiac muscle is that it will have a darkly stained transverse line which is called as intercalated disc. Actually, this intercalated disc are specialized cell junction which is connecting the ends of adjacent muscle fibers. So they are forming the connection between adjacent muscle fibers, and they are important for the transmission of so they provide a contractile stimulus to pass from one cell to another cell, and such type of contraction is there present due to the presence of these cells, that is the gap junction and desmosome present in this case of intercalated disc. This is regarded, the cardiac muscle is regarded as a functional syncytium. Now, I would also like, and if I talk about the smooth muscle, they are spindle shaped, and the nucleus, as you can see, they have got a nucleus in the center. So actually this is an image where this is a table of difference between the three types of muscles which you have to know. You have to know the basic difference between the skeleton, smooth and cardiac muscle. So one of the important point is the thickness or the diameter is 15 to 100 micrometer in skeletal muscle, and just 15 micrometer in cardiac, and 5 to 10 micrometer in the case of smooth muscles. Now also the shape you can see, The new long cylindrical, branched and fusiform spindle shape is the shape of smooth muscle. Many fat peripheral nuclei, multinucleated, one or two centrally placed nuclei in case of cardiac muscle, and one central nucleus in the elongated muscle fibers or smooth muscle fibers. Striations are very well evident, and it is quite evident in case of skeletal muscle. Striations are poorly defined. Striations are also present in cardiac muscle histology, but the striations are poorly defined, but striation is very well defined. There is no striations in the smooth muscle cells. If I talk about skeletal muscle cells, again various important features, so let's talk about that. No intercalated disc in skeletal muscle. Presence of intercalated disc is identifying feature for cardiac muscle, and it is absent. Visceral smooth muscle is not having intercalated disc. T tubules are present. T tubules are present at AI junction at the Z line. So actually, I have not gone in much detail about the muscles. I am giving you the superficial difference only because I think this part will be done by the physiology faculty. Sarcoplasmic reticulum forms a triad, and here the sarcoplasmic reticulum of cardiac muscle will form dyad. Mitochondria is moderate, will be more in case of cardiac muscle, will be less in case of smooth muscle. Regeneration is restricted. Extensive regeneration is there in smooth muscle. Contraction is under voluntary control. So only skeletal muscle is also called as the voluntary muscle. They are also called as the voluntary muscle. And involuntary contraction by the autonomic innervation. Involuntary contraction, involuntary muscle is also the smooth muscle. Quick force contraction is seen in skeletal muscle, and rhythmic contraction is seen in cardiac muscle. Slow sustained contraction is seen in the smooth muscle. Okay. Now let's we have finished with this session of muscle. Also, I would like to move in the next topic, that is integumentary system, skin. Mainly I will discuss skin in this slide. So I am going to discuss the skin for this session. That is important. Now let's start. The learning objective of this session will be knowing the structures of the skin, the types of the skin, the layers of epidermis, the layers of dermis, the cells of. Now we will see the structures of the skin. We have to know about the details of the types of skin. We have to know about the layers of epidermis. We have to know about the layers of dermis, cells of epidermis, skin of appendages, identification point for the thick and thin skin. So these are the most important things should be covered up under this topic of So we'll discuss all these. Now let's start with the skin topic. So it's important to know the important aspects. So okay, so exactly if I talk about papillary ridge, so papillary ridge is there on the palm. You can see the sulci on the palm and the sole, assume say configuration for each individual. So the studies of these palms or the fingerprint is called as dermatographics. The dry skin becomes continuous with the wet mucous membrane of various orifices of the continuity on the body, smooth nostrils and vulvas. Now, a integumentary system, if I talk about it, is consists of not only the skin but its skin appendages also, that is hair and nails. Skin is a large and the heaviest organ. So it is an important point, again important for the MCQ for the FMGE exam, that is its skin is the largest and the heaviest, it's the heaviest organ and largest. It is covering 1/6 of the total body weight. On close observation, what you can see, the skin will have a tensile anchoring fibers of the dermis, and flexor creases will be there, ridges will be there, papillary ridges will be there on the palm and sole. Now the function, if I just want to tell you about, so I am just going very briefly about the important points. If I just talk about the function of the skin, it is having the function, it is having a multiple function to perform. It is giving protection, it is important for sensory perception, it is important for thermoregulation, synthesis of vitamin D, excretion, it also helps in regulation of blood pressure, and it is important for storage and absorption. These are the functions of, and a healthy skin is a good sign of a healthy person. Now, types of the skin. We have got two types of the skin which is important for your examination. We have got thick skin and we have got a thin skin. So, we have to study both of it. So, if we are talking about thick and thin skin is called as a hairy skin. So, if we talk about thin skin, it is called as a hairy skin. And thick skin is called as glabrous skin. Thin skin is hairy, epidermis is thin, has got hairs and found in all other parts of the body except palm and sole. Thick skin is glabrous. It is, epidermis is very thick with large amount of corpus, a large amount of stratum corneum is found. There is no hairs in the case of thick skin that is found in the palm and sole. So, palm and sole are thick skin. Now, types of the skin, as you can see here, this is the thin skin and this is the thick skin, which is having a very large contribution from the stratum corneum. So, stratum corneum, this layer which you are seeing is the stratum corneum. So, actually we have to know about the epidermis and we have to know about the dermis layer. When I am talking of epidermis, the epidermis is made of 5 layers as you proceed from outside to inside. So, we will have the stratum corneum, we will have the stratum lucidum, granulosum, spinosum and stratum basale, and dermis is made of 2 layers, that is reticular and the basal layer. In case of thin skin, we have got just the 4 layers. We will talk about details. So, structures of the skin, let's talk about, let's simplify it more with seeing the simple images. So, skin is composed of 2 layers. The outer one is the epidermis and the inner is dermis. What is about the outermost layer? If I talk about the outermost layer, it is the dermis and the inner is epidermis. Now, what about the lining epithelium of the skin? It is stratified, squamous, keratinized epithelium. Keratinized epithelium. Okay. Whereas dermis is made of connective tissue. If I talk about dermis, it is just made of connective tissue. In this diagram, if you will see this image, you can clearly see this is showing the image of the skin. This is showing the image of the skin in which you can see the outer layer is the epidermis and this is the dermis. Now, the upper part of dermis is in the form of papilla. As you can see in this diagram, the upper part of the dermis is in the form of papilla and it is interlocking with the epidermal. It is interlocking with the epidermal ridges. So, in this diagram, you can see the interlocking of epidermal ridge and that of the dermal papilla. So, you can clearly appreciate the epidermal ridge and the dermal papilla interlocking in this image. Structure of the skin, the dermoepidermal junction is not smooth. It is not smooth, but it is uneven due to the presence of 2 sets of ridges, the interlocking with one another, and the interlocking is taking place between the epidermal ridge and the dermal papilla. Now, these ridges are numerous and this is actually tall, often branching in case of the palm, soles, nipple and penis. So, this is the epidermal ridge interlocking with the dermal papillae. Now, epidermis, if I talk about the outer layer, that is epidermis, this outer layer which is the epidermis is made of stratified squamous keratinized epithelium and the function is it is projecting into the dermis as the epidermal ridges. The other important point is important for your examination and MCQs is that epidermis are ectodermal in origin. Its thickness is varying from 0.1 to 0.4 mm and it's a avascular structure and the nutrition is provided to epidermis by the process of diffusion. Now, epidermis is having free nerve endings and it is also having the cells. So, the important cells of epidermis and their action should be known to you. It contains Langerhans cells, it contains Merkel cells, it contains melanocytes and keratinocytes. So, the most important cells which is present in epidermis is following keratinocyte, Langerhans, melanocytes and Merkel cells. The epidermis layer of the skin is renewed every 15 to 30 days depending on the region of the body and age and other factors. Layers of epidermis as you proceed. So, as I told you layers of epidermis. So, one by one I will talk about the layers of epidermis. So, as you are seeing the layers from outside to inside, the most superficial layer of epidermis is stratum corneum. Then we have got stratum lucidum which is only present in the thick skin. Stratum granulosum is there. We have got stratum spinosum and the innermost layer which is resting on the basement membrane is the basement membrane. And underlying epidermis we have got the dermis layer. So, exactly you have to know the significance of each of the layer of epidermis which is consist of 5 layers. And actually thin skin is not having the stratum lucidum layer. It is just having 4 layers in epidermis of the thin skin, but thick skin is having 5 layers: stratum corneum, lucidum, granulosum, spinosum and basale. Now, let's talk about stratum basale. If I am talking about the stratum basale layer, The stratum basale is the deepest layer of the epidermis. It consists of single layer of cuboidal or the low columnar cells which is resting on the basement membrane. The cells of this layer, if we are talking about the cells of stratum basale layer, actually we are starting from the deepest layer, no? We are starting from in the reverse way. We are not going superficial to deep, but we are going deep to superficial. So this is the deepest layer. So it will have large number of mitotic figures or the newly formed cells which will move further toward the superficial layer. Now coming to the next layer, that is stratum spinosum. So you can see the next layer we have done with the stratum basale. The next is the spinosum layer. Now talking about the spinosum layer, which is actually we talk stratum spinosum as a very important point. Why? Because it is consist of polyhedral. The spinosum is consist of polyhedral cells, and these polyhedral cells are why important? Because they are important for taking the hold of desmosomes, and they are spine-like projection which is interlocking. Sophia have seen the previous video lectures of the rapid revision series. Can't find the PDF of the topics in the Telegram group. When we can access to the PDF notes? Okay, Sophia, I will just check. I think which PDF notes you haven't found? I think the neuroanatomy, the head and neck, the abdomen, and the thorax PDF notes has been shared, and the PDF notes which is remaining is of upper limb and lower limb. I think that is only remaining. I will just check with the group, with the academic team, and let you know. Is it okay, Sophia? Is it okay, Sophia? You will soon receive it. Continuing seeing the session, I will soon provide you with the PDF notes. Okay? Okay. The cells of this layer is consist of bundles of tonofilaments and which is seen as a tonofibrils under the microscope. Is it okay, so Sophia? Okay. Now, now the layer is well developed in the area which is projected to the continuous friction and pressure. Now the next is stratum granulosum layer. If I talk about the stratum granulosum layer, it is consist of 3 to 5 flat and fusiform layer. It is consist of 3 to 5 flat and fusiform layer, and they are actually filled with basophilic keratohyaline granules. They are filled with basophilic keratohyaline granules. And why it is important for us to understand about this keratohyaline granules? Actually, these keratohyaline granules are precursors of keratin. They are precursors of keratin, membrane containing granules. The membrane containing granules are discharging their contents in the intercellular spaces, and they will have a sealing effect. So they are having a sealing effect so that the other foreign structures are not invading the interior of the skin layer. So that is the importance of keratohyaline granules of the stratum granulosum. Then we have got stratum lucidum. So now we have done with these three layers, and the next is stratum lucidum. So as I told you, when we are talking about stratum lucidum in the first slide only, I told you this is actually this is not evident many times, because this is a flattened, it contains flattened eosinophilic dead cells which is giving a homogeneous glassy appearance. The organelles and nucleus are not evident in the cell. The cytoplasm is filled with scleroprotein and will also have derived from the keratohyaline granules and tonofibrils. So they will have rough scleroproteins called keratin present in this layer, and this is thin, and sometimes this layer is missed out. And if I talk about stratum lucidum, it is mainly present in thick skin. Lucidum is absent in the mainly present in thick skin. It is absent in the thin skin. Now, the most superficial layer, as I told you, is the corneum layer, and corneum layer is actually consists of keratinized cells, and it is thick in case of thick skin, and the cells of this layer is continuously set off from the superficial aspect of the skin. Now we have done with the layers. The next is to know about, about the cells of epidermis. So next we will talk about the cells of epidermis. The first cells is keratinocytes. The first cells is keratinocyte, which is the most abundant cell types. Keratinocytes are present in 90%. If I talk about the overall composition of the epidermis cell, we will have the most common present is keratinocytes. These cells undergo the process of keratinization to form the epidermis. What happens? They are undergoing the process of keratinization and leads to the formation of keratin. The function of this keratinocytes is to produce keratin, that is keratin, hyaline granules and tonofibrils. This is the function of keratinocytes. So we can see the cells. So we can see the keratinocytes in the outermost layer and also some inside. We can see the dendritic cells. We can see melanocytes. We can see the other types of the cells. So just a minute. Now the process of keratinocytes, keratinization is loss of mitotic potential. Keratin synthesis is done. And ultimately thickening of plasma membrane happens, disintegration of nuclei and granules occurs, and therefore cornification of desquamation of the cells takes place. So basically in one line, if you want to know the function of keratinocyte, is the formation of keratin and tonofibrils. The second is most common cell is melanocytes. And another important point which has been asked in the MCQ is melanocytes are commonly derived from which cells? The answer is they are derived from neural crest cells. An important point about melanocyte cells are they are derived from neural crest cells. They are located in the basal layer of epidermis. A round shape has got many cytoplasmic process. The major function of these cells is the production of melanin pigment which provide color to our skin, and they color to our skin. This is the most important function of melanocyte. The next is it also contains tyrosine filled melanosomes. And what is the function of these melanosomes? These are involved in the case of melanin synthesis. These are all steps of synthesis will be discussed in the biochemistry class. In the process of melanin synthesis, tyrosine is first transformed to DOPA by the action of tyrosinase present in melanosome, and this will ultimately get transformed into the melanin. Absence of tyrosine will lead to a condition where the skin is not having much of melanin and coloration. That condition is called as albinism. Okay, now talking about the third type of cell, which is called as Langerhans cells. So we can see the Langerhans cells, which is very important for the immunity, Langerhans cells of the skin. So actually the third most common type of cell which is seen, basically this type of cell. So if I talk about Langerhans cells, it is seen more common at the epidermal cell production, and it is found in the stratum spinosum. Where it is found? It is found in stratum spinosum. Also, it is found in other areas of the vagina, thymus, oral mucosa. It can be stained by gold chloride. Like melanocytes, they also appear as a clear cells, and actually they contains a granules. This is more of in the patho class. You must have been knowing that Langerhans cells have got Burbic granules. In patho class, you must have studied the Langerhans cells is containing the granules, that is Burbic granules, and they are mesodermal in origin, and they are important for the mononuclear phagocytic system. The next is the Merkel cells. They are present at the close to the stratum basale. We have got Merkel cells. Okay, and they are present close to the stratum basale, and they have got expanded terminal disc. They are actually associated with the expanded terminal disc of nerve ending, and their very important function is they are the receptor for touch sensation. They are the receptor for touch sensation, again asked in the MCQs. Now let's talk about the histology part. So what you can see in this image is the thick skin histological slide. So when you see the thick skin histological slide, what important point you can see? The stratum corneum is very thick. Then we have got the first layer. Then we have got the stratum lucidum. As we are again proceeding from outside to inside, stratum granulosum, which contains keratohyaline granules, stratum spinosum, prickly cell layer, stratum basale with the melanin pigment. Then we have got the basement membrane and the dermal papilla. So in thick skin, there is no hair follicles, as you can see in this image. Now thin skin, if we see the thin skin, so whenever you see the histology of thin skin will definitely have a hair follicle. So it will have a hair bulb and hair follicle, which will help you to understand that this is a slide of thin skin. Other than that, thin skin will have a muscle attached to it. A smooth muscle is muscle attached to hair follicle is called as erector pili muscle. Erector pili muscle. Also close to it, we will have the sebaceous gland. So which gland is this? We will have a sebaceous gland, and we know that sebaceous gland is which type of gland? Just now we have studied previously. It is a holocrine type of gland. We will also have the cut section of few sweat glands. So excretory duct of sweat glands is there. Erector pylorus muscle is there. So if you will, and there will be the subcutaneous layer which contains the adipose tissue. So we will have the stratum corneum, stratum spinosum, stratum basale, and all layer, but stratum lucidium will be missing. So a slide in which we can see stratified squamous keratinized epithelium, the stratum corneum layer is not as thick as compared to thick skin. It will have an hair follicle. Associated to the hair follicle, we will get the erector pili muscle. We will get that will contract and will lead to standing out of loose skin. We will have the sebaceous gland associated with, which is a example of holocrine gland. We will also have the cut section of sweat gland and its duct. Okay. So now thick skin and thin skin comparison. So we will just have a look of the comparison of thick and thin skin. So the thick skin is found in the palm. So relatively it will have a thick epidermis. It is found in other area except the palm and the sole. Occurs in the sole and palm and rest of the body. Thick. So if I talk about thick epidermis layer, so it will have also the thick skin have lucidium layer. So please note down the thin skin, the lucidium layer is not present. So in thin skin, no lucidium layer, but thick skin has got lucidium. Lacks hair follicles. Hair follicles will be present only in thin skin. Erector pili muscle, obviously the hair follicle is not present. If there is no hair follicle in thick skin, so definitely the erector pili muscle will be always absent. Thin skin will have hair follicles and erector pili muscle. Thin dermis, thick dermis in the thin skin, lacks sebaceous gland. It contains sebaceous gland. The thin skin will contain sebaceous gland for oily secretion. Has numerous spirally coiled sweat gland. So actually sweat gland is present in both thick and thin skin, but one of an important point which should be kept in mind is number of sweat gland will be more in case of thick skin. Denser sensory receptors, less number of sensory receptors. So will contain, if a thick skin will have more of ridges and furrows, less ridges and furrow. Contains regular dermal papilla, contains irregular dermal papilla in case of thin skin. And will have, if we talk about thick skin, it has to be susceptible to more of mechanical aberrations and all. But the thin skin performs other function other than this protection from mechanical aberrations, because the thick skin is having a thick layer of stratum corneum. So done. This was the comparison between thick and thin skin. Now let's talk about the dermis. When I am talking about dermis, it's a vascular connective tissue which is derived from the mesoderm. Epidermis was derived from the ectoderm, but dermis is derived from the mesoderm. It contains papilla, lamina propria. Its thickness is varying from 0.3 to 0.4 mm, and it is having two layers, the papillary and the reticular layer. So here you can see this is the dermal papilla and this layer is the dermis. Above we have epidermis and these are the epidermal ridge which is interlocking with the dermal papilla. Now papillary ridges. So let's talk about the papillary ridges. The superficial layer of the dermis is composed of, so we will have the papilla, we will have the dermal papilla on the upper aspect. We will have two layers. If we talk about dermis, it is made of papillary and reticular layer. The deeper layer is the reticular layer. So we will have the deeper layer as the reticular and the upper layer is the papillary layer. And below dermis, we will have the subcutaneous hypodermis layer. Now see here. The papillary layer is superficial. It is composed of loose connective tissue. It also contains macrophages, mast cells, and other kinds of connective tissue, highly pigmented areolas and the circumanal regions. It will have the dermal papilla and anchoring papillae. Now reticular layer, if I talk about reticular layer, which is the deeper layer, which is lying deep to the dermal layer or papillary layer, it is made of collagen fibers. Because of the presence of reticular layer in the case of dermis, we will have the pattern of cleavage like sweat gland, sebaceous gland, hair follicles and erector pili muscle is present here. And also the cutaneous receptors, glomerulus and papillary plexus will be present. Okay. Now glands. Important glands, we have already talked about the sebaceous gland. We know that it is a holocrine type of gland. It is secreting oily secretion which forms sebum, and it will lead to the formation of acne also if it is a highly oily skin is there. Sebaceous gland, you can see this is a schematic diagram, and this is the hair follicle, and close to the hair follicle we will have the oily secretion structure, that is the holocrine sebaceous gland. Sebaceous gland is actually located close to that of the hair follicles, oil gland, and other gland which is seen here is the sweat gland, that is the coiled tubular type of gland. So when we are talking about sweat gland, it is coiled, simple coiled tubular type of gland. And let's see a important. So in this we will have the excretory duct of this. We will also have the secretory unit of eccrine, and this is the apocrine modified eccrine glands. We will have the sebaceous gland close to that of the hair follicle. Now let's see the comparison between apocrine and eccrine sweat gland. If we are talking about apocrine sweat gland, it is secreting viscous fluid into the hair follicle. It is almost present watery secretions, and all over the body will have the eccrine type of sweat gland. The sweat gland which is present in the pubic area, in the armpits, perianal region, they are the example of apocrine sweat gland. Yes, Shatish Kumar Konam. Yes, I will send. Okay, I will talk to the academic team. I will send to the academic team, and then you will be provided with the PDF notes. So, previous notes, I think neuroanatomy, head and neck, abdomen, pelvis, and thorax is given to you. What is remaining is the upper limb and lower limb, and also the histology part. Let me finish the histology complete session, then I will give the histology part. Okay. So after today's session, in the evening, I will be able to cover the histology part. Then only I will be able to share the PDF notes. Okay. Diameter of secretory coils is approximately 800 micrometer. Diameters of secretory coil in case of eccrine sweat gland is 500 to 700 micrometers. So that whole micrometers and the whole details of dimension can't be known. Basic differences you have to know. So the duct of if I talk about the duct of the apocrine sweat glands, apocrine glands opens to the hair follicle, it opens to the skin surface. Secretion of apocrine is viscid slightly, but it is entirely watery in eccrine sweat gland. Consists of protein, fatty acids, consists of water and sodium chloride in case of eccrine sweat gland. Secretes mainly the secretion which is viscous is important for giving body odor, but if we are talking about sweat glands, normal sweat gland, it is function is to cooling the body surface. Okay. Now I would like to talk about basic difference between sebaceous and the sweat gland. Sebaceous gland, if we talk about, it's a holocrine type of gland, and sweat gland is merocrine type of gland. Sebaceous gland is found throughout the body except palm and soles, and sweat gland is found in many areas, in the genital areas, in the armpits, in the ears, in the eyelids and all. They have got one type of cells and they secrete sebum. They have got two types, apocrine and eccrine, and both of this secrete sweats. Secretion of the sebaceous gland is oily secretion. The secretion of sweat gland is watery. Secretion is composed. If we talk about the secretion, more details about the secretion of sebaceous gland, it contains urea, sodium, chlorides, water, lactic acids. But the watery secretion of the sweat gland is also containing fatty acids and hydrocarbons. Major function of this sebaceous gland is lubrication, and the major function of sweat gland secretion is excretion and temperature regulation. So done with this. Now I would like to discuss one MCQs which is from the previous year of examination. Let's see who is able to solve. This is a MCQ from previous year NEET PG exam. So please mark the right answer. Panniculus adiposus is seen in which of the following location? Panniculus adiposus is seen in scrotum, orbit, eyelid, penis. So that means superficial fat. Superficial fat is seen in which of the following location? Please give it a guess. This is also a topic of general anatomy. I would like to solve it. Panniculus adiposus is seen in scrotum, orbit, eyelid and penis. Panucleus adiposus is seen in which of the following locations? So please mark the right answer. Anyone? What do you mean by panucleus? Subcutaneous fat, dear. This is means subcutaneous fat. So that means where is the subcutaneous fat absent? So that means you have to know the list of structure where there is no fat. You have to know the list of structure where there is no fat. Panucleus adiposus is seen in which of the following location? So any guesses? Any guesses? I would like to give you the list. Let me give you the list. So see here, panucleus adiposus is the subcutaneous fat, a layer of adipose tissue which is located underlying the dermis, and panucleus adiposus or subcutaneous fat is absent in following locations. Subcutaneous fat is absent in eyelid, it is absent in external ear, it is absent in nipple, areola, penis and scrotum. So please note down the list of areas where there is absence of subcutaneous fat. So there is no fat in the eyelids, there is no fat in external ear, there is no fat in the scrotum, there is no fat in the penis, there is no fat in the nipple and there is no fat in the areola. That means the correct answer in this case will be orbit. Orbit is containing fat, but scrotum, eyelids and the penis is not having fat. Is it okay, everyone? You should know the list of structure where there is absence of subcutaneous fat. We have got no fat in nipple, no fat in areola, no fat in penis, no fat in the scrotum, no fat in the eyelids. Okay. Also in the ear, external ear. Is it okay? Let's move on to the next. The next topic is cartilage. The next topic is cartilage. Cartilage is a very important topic. Always so many questions comes from this topic. So we have got many questions from this topic, cartilage. So let's come up with the topic of cartilage. So general features of the cartilage, it's important to know the general features of the cartilage. So if I am talking about cartilage, it's a firm and a flexible type of scleral connective tissue. It's a firm and it's a flexible type of scleral connective tissue in which the extracellular matrix is having a firm consistency. So it's having a firm consistency. Now, there are certain features of cartilage which you have to know. There are general features of cartilage. When I am talking about cartilage, it's a avascular structure. So when I am telling it's avascular structure, you must be wondering from where the nutrition is given to it. So if I am talking about the nutritional part, it is receiving its nutrition from the process of diffusion. Okay, no nerves and vessels of its own, and because it is not having the nerve supply of its own, it is a avascular structure. So definitely the regeneration of cartilage is poor. Its damage will result in connective tissue scar formation. The damage of cartilage will result in connective tissue scar formation. Now, if I talk about cartilage, it is covered externally by dense connective tissue covering. So it is having a covering of dense connective tissue layer that is called as perichondrium. So it is whole covered by a perichondrium except over the articular ends of the cartilage where it is not having any perichondrium covering, and also there is absence of perichondrium in the fibrocartilage. So this is again important for your examination and MCQ. Which are the two locations where there is no presence of perichondrium? So wherever we will have fibrocartilage, so wherever like pubic symphysis, glenoid labrum, menisci, wherever we will have fibrocartilage, there will be no outer covering in the cartilage, that is perichondrium. Also the articular ends of the bones will have articular variety of cartilage, and that will also now not have any perichondrium covering. The perichondrium is made of two layers. So if I am talking about the perichondrium layer, it is made of two layers. The outer layer is called as a the outer part of perichondrium is vascular, and it is made of outer fibrous layer. If I talk about the inner aspect of the perichondrium, it is the chondrogenic layer, which is cellular in nature. The inner chondrogenic layer is cellular, and the outer is the fibrous or the vascular layer. Now, let's talk about the components. So let's talk about the components of the connective tissue cartilage layer. What are the structures which is residing, and what are the structures lying? So the cells of, if I talk about the cells of cartilage, the cells of cartilage is made of chondrocytes, fibers. So if I am talking about cells, So if we are talking about ordinary connective tissue cartilage, it is basically made of chondrocytes. It is basically made of chondrocytes, and it is having fibers, that is collagen fibers and elastic fibers, and ground substance. If I talk about the ground substance, it is made of acid mucopolysaccharide and chondroitin sulfate. So ground substance, it is made of acid mucopolysaccharide and chondroitin sulfate. Got it? It contains acid mucopolysaccharides and ground chondroitin sulfate. Okay. Now, hyaline cartilage. So we will have basically how many types of cartilages we have got? We have got following types of cartilages. We have got hyaline cartilage, we have got articular, we have got fibrocartilage and elastic cartilage. Actually, hyaline cartilage, if I talk about hyaline cartilage, the hyaline cartilage is further two types. It is of further two types. It is of costal variety, that is costal variety of hyaline cartilage, and it is of articular variety of hyaline cartilage. So that means hyaline cartilage is further divided into two varieties, articular variety and costal varieties. Okay. So presence of hyaline cartilage is having the presence of highly basophilic homogeneous matrix. So it is having a highly basophilic homogeneous matrix. Highly basophilic homogeneous matrix. The matrix appears homogeneous because the collagen fibrils which is present in the matrix is having the same, it is having the same refractive index as that of the ground substance. It is having the same refractive index. So why we see that it will appears? So the appearance of the hyaline cartilage, if you will see, appears homogeneous because of the reason that they will have refractive index as same as the ground substance. The matrix is having homogeneous and collagen fibers are present in it having the same refractive index as that of ground substance, and that is the reason it will appear homogeneous basophilic. Now, what is examples of hyaline cartilage is to known to you. So we have got following examples of hyaline cartilage where we can see. So we will have hyaline cartilage of articular variety, and when I am talking about articular variety of hyaline cartilage, it is present in articular ends of the bone except that of the TM joint. Is not present in sternoclavicular joint, acromioclavicular joint. Why the articular ends of these joint is not containing hyaline cartilage? Most of the joint in our body, if I talk about most of the joint in our body, the most of the joint is having hyaline cartilage in it, but certain joints like TM joint, temporomandibular joint, acromioclavicular, sternoclavicular joint, these kind of joint is having at their articular ends the presence of fibrocartilage. Costal cartilage, respiratory tubes, growth plate and fetal cartilage. So actually, if we are talking about costal cartilage, if we are talking about respiratory tube, growth plate and fetal cartilage, these are the location where we have got the variety of hyaline cartilage located. Other than that, if I am talking about the respiratory tube, nasal cartilage, that is thyroid, cricoid, arytenoid, except so we are talking about respiratory tube where we have got hyaline cartilage. So in that category, nasal cartilages, thyroid, cricoid, arytenoid, except the tip. Why not the tip? Because the tip of arytenoid cartilage is made of elastic cartilage or hyaline variety of cartilages. So these are the examples, very, very important for your examination to know the list of these cartilages. Now I want everybody to see this histological image. In this histological image, you can see the histological features of the costal variety of hyaline cartilage. So it is having one is the perichondrium. So we know that perichondrium 1 and 2 is the perichondrium, and we know that perichondrium consists of two layers. The outer part of perichondrium is the fibrous layer and the inner part is cellular. We also know that in between we have got the ground substance, basophilic, homogeneous. Fourth is the chondrocytes, and also you can see, if you will see these chondrocytes are arranged in group, and this group is called as cell nest. So we have got isogenic group of chondrocytes which are in the form of group that is called as cell nest. So also the composition of matrix will be more of darker stain in the space around the space of the cell nest as compared to the intercellular space. So exactly that means identifying features. That means identifying features of the costal variety of hyaline cartilages: perichondrium presence, ground substance of intercellular substance, presence of cell nest, and size of cells increases from periphery to that of the center. So the older cells, as you can see, is more of larger chondrocytes, as you can see in this diagram. These are the smaller chondrocytes, and more deeper we have got larger chondrocytes. Now let's see the other variety. As I told you, the hyaline cartilage, one variety is articular cartilage. You can see the outer covering, there is no perichondrium, so there is no P. What is no P means no perichondrium. Perichondrium is absent. Also a part of calcified bone will be seen, and if you will see the chondrocytes, they are very small and they are arranged in the form of oblique, vertical, and calcified part of the bone will be there. So no perichondrium, calcified part of the bone, and the no cell nest and arrangement of the cells in oblique, vertical, horizontal direction. So perichondrium is absent, ground glass appearance is there, small cells are arranged in horizontal, vertical, and oblique directions. Now let's talk about the next type of cartilage, that is elastic cartilage. So if I am talking about elastic cartilage, there is presence of elastic fibers in the matrix, and the elastic fibers are, so basically you will see a brightly stained, cartilage, that is elastic fibers will be there. Also there will be, when you see the slide of elastic cartilage, there is large number of chondrocytes. So there will be large number of chondrocytes, and will have the number of chondrocytes will be much more as compared to other cells, and elastic fibers will be there, perichondrium will be present. So exactly, if I talk about the example of elastic cartilage, we know that perichondrium is present and the type 2 collagen fibers are there. Exactly, this is also important, that predominantly if I talk about hyaline cartilage and if I talk about elastic cartilage, the elastic and the hyaline cartilage is having predominantly type 2 type of collagen fibers. But if I am talking about fibrocartilage, the fibrocartilage is made of type 1 collagen fibers. It is made of type 1 collagen fibers. The example of elastic cartilage as following. The important examples are external ear, eustachian tube, which is also called as auditory tube, epiglottis, which is a laryngeal cartilage. Okay. Tip of nose, the tip of arytenoid, and the rest part of arytenoid is hyaline cartilage, and also corniculate and cuneiform cartilage. Actually, this corniculate and cuneiform cartilages are small cartilages of the larynx, and these are the paired cartilages. Corniculate is also called as Brisberg, and cuneiform is also called as cartilage of Santroni. Now, here you can see the slide. So, here if you will see the elastic cartilage, what you can appreciate in this diagram. So, see here, the whole of chondrocyte. So if you will see, there is PC means perichondrium is present. What do you mean by PC? PC means perichondrium is present. These are all chondrocytes. So huge number of chondrocytes are there, and they are densely packed each other. And here you can see elastic fibers will be in large number. So the histological slide, elastic fibers, large chondrocytes, and perichondrium will be present. So one is the perichondrium. We can see the perichondrium is present. The other important features is perichondrium is present. Other than that, the internal elastic fibers are there. Eccentric location of nuclei in chondrocytes. Actually, eccentric location of nuclei in chondrocytes will be only seen if you see the high power view. In low power view, you can't make out. Now, we have done with this. Now, I just want everybody to solve an MCQ related to this. That is an image based MCQ of the previous year INICT NEET PG exam. Illustration of showing the histology of cartilage is shown to you. So please identify the type of cartilage, whether it is hyaline, whether it is elastic, whether it is articular or fibrocartilage. Identify the type of cartilage: hyaline, elastic, articular, and fibro. Yes, dear students who are live, Satish Kumar, Sophia Ali, please mark the right answer. Okay, please mark the right answer, dear. So exactly, that means you have to see this slide nicely. So what you can appreciate, the perichondrium is there, no doubt about. It is having the chondrocytes. So these are all chondrocyte, and it is highly densely populated by the chondrocytes. Elastic fibers are also in between. So if you will see, in between we can have the elastic fibers. So many elastic fibers are running, highly brightly stained is there. Perichondrium is there, P for the perichondrium, outer covering of perichondrium, and so many chondrocytes are there. Elastic fibers are there, and brightly stained slide is there. So definitely this slide is of elastic cartilage. So what will be the right answer? The right answer is, it is the slide of elastic cartilage. Okay. Now let's talk about the third type of cartilage, that is the fibrocartilage. So if we are talking about fibrocartilage, it is identified by the presence of dense bundle of collagen fibers. So dense bundle of fibrocartilage, collagen bundles are seen, which is running in various direction, and also in between we have got chondrocytes. So exactly, if I talk about fibrocartilage, the chondrocytes are actually less in number. If I talk about chondrocyte, the density of chondrocytes are less in number. Fibrocartilage will have less number of chondrocytes, feathery appearance. When you see the fibrocartilage with your histology of the fibrocartilage slide, it will show a feathery appearance with no perichondrium. The perichondrium is absent, number of chondrocytes is less, wavy appearance, collagen fibers are much more. The type of collagen fibers present in fibrocartilage is type 1. So we will have type 1 collagen fibers. If we talk about elastic and hyaline cartilage, it contains type 2 collagen fibers. So the example of fibrocartilage will be present in the midline joints, that is secondary cartilaginous joint. So it will present in secondary cartilaginous joint. So it is present in between the vertebrae, that is intervertebral disc. It is present in articular disc of the joints. It is present in knee meniscus, which is also called as semilunar cartilage. It is present in glenoid labrum and acetabular labrum, glenoid labrum of shoulder joint, acetabular labrum of hip joint, and it is present in pubic symphysis, the midline joint between the two side pubis bone. So these are certain location where we will have the where we will have the fibrocartilage. The identifying features of fibrocartilage is absence of perichondrium and presence of type 1 collagen fibers and less number of chondrocytes. So again, you can see this is the histological slide of fibrocartilage. As you can see in this diagram, this is the chondrocytes. So this is all chondrocytes. So these are all chondrocytes. So these are all chondrocytes. These are all chondrocytes, and you can see there will be wavy appearance of collagen fibers. So many collagen fibers are running, and the collagen fibers which is running is of collagen fibers will be there, and the collagen fibers are type 1 variety. Also in this diagram, you can see that nucleus of chondrocytes are seen, lacunae, collagen fibers, and rows of chondrocytes are seen. Identifying features, if I talk about fibrocartilage, it will have absence of perichondrium, intercellular spaces, and the whole slide will give you a feathery appearance. Few scattered chondrocytes are there. Few scattered chondrocytes will be present. Now I just want everybody to just go through this table. Why? Because this is the table which is showing you the difference about the three types of hyaline cartilage. Three types of hyaline cartilage. So I just want to know about these three cartilages. So firstly, if I talk about hyaline cartilage, it is present in the articular ends of the bone and in the costal cartilagens and laryngeal cartilage. Fibrocartilage is present in pubic symphysis, intervertebral disc, acetabular labrum, sternoclavicular joint, temporomandibular joint. Elastic cartilage will be present in pinna, in the apex of arytenoid cartilage, in the cuneiform and the corniculate cartilage, eustachian tube, and epiglottis. The appearance is bluish white in case of hyaline cartilage, glistening white in fibro, and yellowish in case of elastic cartilage. The refractive index will be same as the matrix, numerous white fibers in fibrocartilage and numerous yellow fibers in elastic cartilage. Most flexible because of the higher presence of elastic fibers is the elastic cartilage. Firm and stronger is the fibrocartilage, and flexible is also the hyaline cartilage. Also, if you will see this diagram, you can see the appearance. So you can see in hyaline cartilage, we will have the cell nest. Fibrocartilage, few chondrocytes, less in number. Elastic fibers are so many numbers. Elastic fibers are large number in case of elastic cartilages. And here perichondrium, P is present, P is present, P is present, but P is absent. P will be negative in case of fibrocartilage, but perichondrium will be present in elastic and hyaline cartilage. Also, hyaline cartilage will have type 1 variety of collagen fibers. Elastic will have both the hyaline and elastic will have type 2 variety of collagen fibers, but fibrocartilage will have type 1 variety of collagen fibers. So basically these are the three differences which has been shown in the histological features of three types of cartilages in our body: hyaline, fibro and elastic cartilage. Done. Let's before moving to the next, a very important topic of histology, the lymphatic system, I would like to solve an MCQ along with you. Type 2 collagen fibers are present in which of the following location? Bone, cartilage, aponeurosis and ligament. Please mark the right answer. Type 2 collagen fibers are present in which of the following location? Bone, cartilage, aponeurosis and ligaments. Arun Prajapati, absolutely right, Arun. Yes, it is present in Arun. It is present in cartilages. Absolutely correct. Yes, Arun, it is present in cartilages. Now, lymphatic system. If I talk about an important topic in the histology part, we have got the lymphatic system. It's a very important topic. So, we can't skip this topic. It is highly important. So, let's talk about lymphatic system. So, if I am talking about lymphatic system, I would like to firstly give you the details of the important aspect of the lymphatic structure. So, we will talk about the lymphatic structures and then we will come into the discussion of further structures. So, if I am talking about the lymph node, you have to know firstly exactly, you have to know what is exactly lymphoid tissue, what are the general features of lymphoid tissue, which is highly important for you to understand. So, basically you have to know about classification of lymphoid tissue. So, you have to know about the classification of lymphoid tissue. So, if I am talking about the classification, we have got two types of lymphoid tissue. One is diffuse lymphoid tissue and the other is diffuse and the other is dense lymphoid tissue. Okay. So, if I am talking about diffuse lymphoid tissue, actually this kind of diffuse lymphoid tissue is present in the lamina propria. So, basically diffuse is actually a diffusely arranged, they are diffusely arranged lymphocytes. So, they are actually diffusely arranged lymphocytes, and this diffusely arranged lymphocytes will be present in the lining of digestive tract. They will present in the digestive tract. They will be present in urogenital tract and respiratory tracts. The next is dense. The next is dense lymphoid tissue, which is present by large number of lymphocytes. They contains large number of lymphocytes. So, there will be large number of lymphocytes and they will be encapsulated. So, they will be in the form of nodules and they will be encapsulated in the form of organ. So, they will be encapsulated in the form of organ. So, again the diffuse, if I talk about diffuse lymphocyte, they are again categorized as the two varieties. One is like malt and the other is discrete variety. So, when I am talking about that, this means mucosa associated lymphoid tissue. So, dense lymphoid tissue can either be mucosa associated lymphoid tissues, which will be in the form of solitary nodules, which will be present. So, this will be in the form of solitary nodules, and this will be present as a lymphoid organ like Waldeur's ring. They will present in the form of pierced patches. So, such kind of malt is associated with the other associated in the lamina propria and mucosa of the GI tract and all. Solitary nodules will be also present in the form of pierced patches in the form of Waldeur's ring. If I talk about discrete means they are in the form of organs. So, we will have lymph node, we will have thymus gland, We will have the spleen and tonsil in this group. So basically, if I am talking of lymphoid structure, which is a very favorite question to be asked in the histology part, we have to know about the lymphoid organ. So we have to know about 4 lymphoid organ: tonsil, thymus, spleen, and lymph nodes. So basically, firstly, I would like everybody to understand about the general architecture of the lymphoid organ. So we will talk about the general architecture. So if I am talking about the general architecture, all lymphoid structure is consist of connective tissue framework, and it will have a parenchyma. When I am using the word connective tissue framework, that is acting as a supporting framework for that parenchyma, and the parenchyma of lymphoid structure will contain the lymphocyte. The supporting framework, if I am talking about the supporting framework, it is including the fibrous capsule that will cover the organ, and from that fibrous capsule interior we will have the trabeculase going into the interior of structure in the form of interlobar septums, and through this trabeculase there will be what structure will traverse. The structures traversing will be blood vessels, nerves, reticulum, and this will all support the cellular parenchyma. What is the function of this trabeculase, fibrous capsule and all? They will support the cellular parenchyma, which is exactly containing the lymphocytes. Now, approximate percentage of lymphocytes type. We know that there are cell-mediated lymphocytes and the B lymphocytes, plasma. So we will have a composition of B and T lymphocytes. So it is important to know the types of lymphoid organ and the type of lymphocyte it contains. So bone marrow is basically more of B lymphocyte and only 10% of T lymphocyte. Thymus is a primary lymphoid organ and it is containing 100% T lymphocyte. It is containing no B lymphocytes. Now, if we talk about lymph nodes, it contains 60% T and 40% B lymphocytes. Spleen contains 55% of the B and 45% of T lymphocyte, and blood contains 20% of B lymphocyte and 80% of T lymphocytes. So, T lymphocyte is for cell mediated immunity, humoral immunity is by the B lymphocytes. Now, the first slide which I want everybody to understand is the thymus gland. Okay, so the thymus gland, firstly I will tell you about the general features, then we will move on with the entire histological features or the exact or the most important characteristic histological features of the thymus gland. If I am talking about general thymus gland features, I just want everybody, are you understanding? Actually, this point is very important here. Lymphoid organs are very important topic. So, please pay concentration to this. Many questions in the previous year of NEET PG and INICT examination has come directly from the lymphoid organs. So, very important. So, thymus gland is a central lymphoid organ. It's a central lymphoid organ. And it is, why it is important? It is important for the development of immune system of the body, and it is important for the growth and development of other lymphoid structures. So it is important for as it is important for other lymphoid organ, it is considered to be a primary lymphoid organ. Now it's a bilobed structure, and we know that thymus gland is located in the it is having two parts, upper and lower part. So the upper part of thymus gland is located in superior mediastinum and the lower part is located in anterior mediastinum. It has dual origin. It is very important, has been asked in examination so many times, the embryology part of thymus gland. So it is having dual origin. Its lymphocytes are derived from, if I am talking about the lymphocytes are derived from the mesoderm, and its epithelial reticular cells. If I am talking about the epithelial reticular cells, it is derived from the endoderm of third pharyngeal pouch. So its epithelium is derived from third pharyngeal pouch, and its lymphocytes are arising from the mesoderm. It is also called as lymphoepithelial organs. This is the reason it is termed as lymphoepithelial organ, because it is having dual origin. Epithelial reticular cells from the endoderm of third pharyngeal pouch and lymphocytes from the mesoderm. The thymus gland, as I told you, it is quite well developed in early stages, and it will grow slightly till the puberty, and after that it involvulate, degenerate, and it is replaced by the fatty tissues. It weighs approximately 12 to 15 grams at birth, and in the puberty it is having the maximum of its weight 30 to 40 gram, and thereafter again at the age of 60 it is 12 to 15 grams or 10 to 15 grams. It has got only efferents, it is not having any afferent lymphatic vessels. So if I'm talking about thymus gland, it is just having efferents, it is not having any afferent lymphatic vessels. Now, if so let's talk about the composition of thymus gland, the components and the structures, the important components. So the first thing is that we should know that the thymus gland will have a supporting network and the parenchyma. Again, the thymus gland parenchyma will be divided into cortex and medulla. So if I am talking about the cellular component, so let's see the two important points about the histology, about the histological aspect of thymus gland is it will have a supporting network. The thymus gland will have a supporting network and it will have a parenchyma. So it will have a supporting network. It will have a supporting network and it will have a parenchyma. Got it? Got it? Now, if I am talking about the supporting network of the thymus gland, it is formed by fibrous capsule, trabeculars, interlobular septas, and it is basically having epithelio-reticular cells. Actually, this is very, very important for you to note down that entire lymphoid structures, lymphoid organ which we are going to discuss will have the supporting network provided by the reticular fibers. Only the odd man out is the thymus gland, because thymus gland, the supporting network is given by epithelio-reticular cell. It is provided by epithelio-reticular cells. Lobes and parenchyma. So if I am talking about lobes and parenchyma, it is again further divided into cortex and the medulla. The cortex is the outer part of the parenchyma and the medulla is the inner part. And in the medulla, we will have the Hazel corpuscles. Now, the thin connective tissue framework is overall. If we talk about the fibrous capsule of the thymus gland, it is overall encapsulating the thymus gland. And from the fibrous capsule, there is septase, in trabecular septase, which is going inside, through which the blood vessel traverses. The lobules are darkly stained on the outer aspect. If we talk about the parenchyma, outer part is the cortex and inner lighter part is the medulla. And the medulla of one lobe is communicating with the other. So I just want everybody to see a thymus gland histological image to understand this. So basically I am just enlarging it. So if you will see the thymus gland, what you can appreciate, this is the outermost fibrous capsule. The outermost part which you are seeing is the fibrous capsule. So this part which you are seeing is the fibrous capsule. Okay. Now what I told you, from the fibrous capsule, interlobular septae are given which will divide the thymus into incomplete lobes. Why? Because here if you will see nicely, what you can appreciate so this part, darker stained part, what you are seeing is the cortex. So this is the part of the parenchyma. So this is the cortex part. This is also the cortex part. And this is also the cortex part. Now inside we will have a lighter stain. So inside the lighter stain structure which you are seeing is the medulla, which will contain the Hazel corpuscles. So what you can see, we will have the medulla in the deeper aspect. We will have the medulla in the deeper aspect, which will contain the Hazel corpuscles along with it arterioles and all. So basically what we can see in the thymus gland, that one thymic lobe is communicating with the other thymic lobule. So other than that, and if I talk about the supporting network, what if we are talking about the supporting network of the thymus gland, what I have told you, that supporting network is supported by epithelio-reticular cells, which is endodermal in origin, derived from the third pharyngeal pouch. Reticulum, the only reticular fibers, epithelio-reticular cells of thymus gland is giving support to the thymus gland. Other lymphoid structure, if I talk about the other lymphoid structure, like if I talk about the lymph node, if I talk about the spleen, if I talk about the tonsil, the supporting network of the framework is formed by reticular fibers. Only the thymus gland, the supporting network is formed by epithelio-reticular cells. They can be easily identified by a large pale staining oval nuclei, cytoplasmic eosinophilic structure. So in the interior, so if I talk about the thymus gland will have the outer zone of the cortex, which is actually darker in stain, which is of course incorporated with the lymphocytes, majority of it. And then we will have the inner part, which is lighter stain, is the medulla, which inside will contain the hazel corpuscles. So degeneration of the center of thymic corpuscles, hyalinized mass is there, which is called as the hazel corpuscles. The darker stain is the cortex, which is having the aggregation of lymphocytes, and again we will have inner hazel corpuscles. So exactly, if I talk about the hazel corpuscles, the hazel corpuscles are laminated. The hazel corpuscles are if I talk about it, is a round laminated, it is a round laminated acidophilic bodies, and it is actually surrounded by flattened epithelial. It will be surrounded by flattened epithelial cells. It will be surrounded by flattened epithelial cells in the center. So this is actually degenerated centers of thymic corpuscles is there, and this will be more in elderly people. So this is an enlarged view where you can see the hazel corpuscles, and this, as you can see in the hazel corpuscles, this is having the laminated acidophilic body surrounded by the epithelial cells, and exactly epithelio-reticular cells. Other than that, if I talk about epithelio-reticular cells of the thymus gland, it forms blood thymic barrier. So we'll talk about that also. So the next important point is blood thymic barrier. If you will see blood thymic barrier, it is formed by epithelio-reticular cells. Now, as I told you that thymus gland is a primary lymphoid structures, and in the inner part we have got the immature T lymphocytes growing. It is only having T lymphocytes. So what happens if you will see the enlarged view of this epithelio-reticular cells along with the capillary wall. So actually blood thymic layer, BTB, when we are talking about the formation of BTB, blood thymic barrier, it is formed by epithelio-reticular cells, the connective tissue and the blood vessels, that is capillary wall. So we will have the basement membrane of the capillary wall. We will have the connective tissue surrounding, perivascular connective tissue along with epithelio-reticular cells. So this entire thickness of the structure is blood thymic barrier, which is preventing the immature T lymphocytes, which is in the interior, to not get invaded by the attack of antigens present in the blood. So in other words, what you can say, the thymus gland is protected by the antigens of blood, so that no antigen antibody reaction happens, and this is protecting the immature T lymphocyte which is growing inside by the presence of blood thymic barrier, which is formed by the reticuloepithelial cells. So in other words, if I just want to summarize the thymus gland, so before that I just once more want to see the thymus gland histology part, where you can see the hazel corpuscles. These are the hazel corpuscles which is seen, acidophilic bodies. We can see the darker stain part. So we can see here the fibrous capsule. One is the FC, that is fibrous capsule. C is the outer cortex of the parenchyma, and 3 is the medulla. In the medulla, we have got the hazel corpuscles, and blood vessels are running in the interlobular septum. So actually, the medullas of the thymus gland are continuing with each other, and identifying features will be many lymphoid tissues are there, darkly stained centers of the cortex, lightly stained medulla with acidophilic bodies in the like hazel corpuscles or laminated hyalinized mass of hazel corpuscles are in the centers in the medulla. So if I want to summarize before proceeding to the next slide, that is palatine tonsil, if I want to summarize the features of thymus gland is a central lymphoid structure. So what are the important features here? The first is it is a centralized lymphoid organ, which is important for the growth of other lymphoid structure. The other important point is dual origin. Dual origin means lymphocytes from the mesoderm and epithelio-reticular cells from the endoderm of third pharyngeal pouch. Supporting network is formed by epithelio-reticular cells, not the reticular fibers. Only T lymphocyte it contains, fully developed at birth. So at birth it is fully developed and involved involulates after puberty, and also presence of BTB. What is BTB? Blood thymic barrier. So done with the thymus gland. The next important gland which I want everybody to understand is the tonsil. So tonsil, so here in this diagram you can see the palate. So which tonsil I am talking? Here I am talking about the palatine tonsil. So if I talk about the palatine tonsil, it is located in the tonsillar fossa. It is located in the tonsillar fossa, which is having an anterior pillar and the posterior pillar. Here the anterior, if I talk about the anterior pillar of the tonsillar fossa is formed by palatoglossal arch, which contains palatoglossus muscle. And if I talk about the posterior pillar is formed by palatopharyngeus muscle, which contains palatopharyngeus arch, which contains palatopharyngeus muscle. And in between the anterior and the posterior pillar, that is palatoglossal arch and palatopharyngeus arch, we have got the location of palatine tonsil. So what is it? You can see this is the palatine tonsil. So this is the palatine tonsil in the tonsillar fossa. Almond shape. So exactly in this diagram also you want to see. So here we can see the tongue. This is what is this? Lingual tonsil. Lingual tonsil is the tonsil on the posterior 1/3 of the tongue. Lymphoid aggregation line on the posterior 1/3 of tongue is the lingual tonsil. And in between the palatoglossal arch and palatopharyngeus arch, posterior, palatoglossal arch containing palatoglossus muscle anteriorly and palatopharyngeus arch containing palatopharyngeus muscle posteriorly, we have got tonsillar fossa, which contains the tonsil. Now, basically we can see two images. One is the low power view and another is the high power view to know the features of the tonsil gland. So I just want to enlarge this. So when you will see the tonsil in the low power view, the lining epithelium is very important. So which type of lining epithelium is this? The lining epithelium is stratified squamous non-keratinized epithelium. So the lining epithelium is stratified squamous non-keratinized epithelium. This is the tonsillar cleft lymphatic nodule. So we will have the lymphatic nodule and also we will have the mucous gland. So a slide when you see which will have a indentation or depth which is called as tonsillar cleft along with the lymphatic nodule. So a huge number of lymphatic nodule aggregations will be there adjacent or deeper to the stratified squamous non-keratinized epithelium along with the mucous gland. So this is the high power view of the tonsil, and in the high power view of the tonsil you can see the tonsillar lymphatic nodules. This lymphatic nodule will have GC in the center. What do you mean by GC? Germinal center. If you see the lymphatic nodule, the outer part will have dense aggregation of lymphocyte, which is the mature lymphocyte, and the immature lymphocyte and less dense lymphocyte will be in the center. So the center is germinal center. It will have the lining epithelium will be stratified squamous non-keratinized epithelium, will have connective tissues, will have mucous gland also. This is showing the high power view of the tonsil. Now, other than that, let's see the tonsil. So, when I am talking about the tonsil is having stratified squamous non-keratinized epithelium. We will have the tonsillar clefts, so many lymphatic nodules. As you can see in the diagram, the lymphatic nodules are many. Few skeleton muscle is overlap, fibrous capsule in the outer aspect, and these are all tonsillar clefts. These are all indentation of tonsillar cleft. So, this is the slide of tonsil. Very easy to identify. Now, before proceeding to the spleen, let's see this slide where you can appreciate. So, firstly, I would like to show you the histological slide of tonsil. Here you can see this is the tonsillar cleft. So, if I talk about outer aspect, there will be the fibrous capsule. So, one is the fibrous capsule, then we will have the tonsillar cleft, the lymphatic nodules, so many lymphatic nodules will be there, and the lining epithelium is stratified squamous non-keratinized epithelium, and mucosal glands are also there in the palatine tonsil. So, the identifying features will be clefts lined by stratified squamous non-keratinized epithelium and will have subendothelial lymphatic nodule and mucous gland. These are the 3 points for the identification of palatine tonsil which has to be known by you. Now, let's talk about the histology of spleen. So, when we are talking about the spleen, first thing which is very important for you to understand is the spleen is the largest lymphoid organ. It's the largest lymphoid organ which is present in the in the abdominal cavity in the left region, in the left hypochondriac and epigastric region, and it is having a fibrous capsule which is covering it, and it is covered by, it is an intraperitoneal structure, it is covered by peritoneum. So if I talk about the spleen, it's a blood forming structures. It's a blood forming organ in the fetus life, but it is a blood destroying organ in the postnatal life. It is also considered to be the graveyard of RBCs. Worn out RBCs are collected spleen, so they are called a graveyard of RBC. So the so exactly what is the function? It filters the blood-borne antigens and microorganisms from the blood. These are the most important histological features of the spleen, general features. Now let's talk about the spleen general features, connective tissue framework. Actually, the connective tissue framework and the supporting part of the spleen will be formed from the fibrous capsule. The fibrous capsule will have trabeculars and reticular fibers and the stroma which will give support. The reticular fibers and stroma will have reticular fibers in it which will give the support. The parenchyma, if I talk about the parenchyma will have white pulp and the red pulp. If I am talking about the white pulp, what do you mean by the white pulp? The white pulp is made of lymphoid tissues and lymphoid structure. The red pulp is made of splenic sinusoids. Okay. So, just below the fibrous capsule of the spleen, there is a space that is called a just below the fibrous capsule. From the fibrous capsule, there is a trabeculase which is given inside in the interior of the spleen, which will divide the spleen into the lobes. So, if I talk about, we will come to the white pulp and all. So basically, firstly, I want you to show the low power. This is the capsule, fibrous capsule. From the fibrous capsule, you can see this is the fibrous capsule. From the capsule, you can see we will have the trabeculase which is given inside, and we will have a germinal centers. In the we will have the lymphatic aggregation which is forming the white pulp, which is formed by the lymphocyte aggregation, and in that we will have in the center the GCs. What is GCs? GCs is germinal center, in which we will have the location of central arterioles. The location of central arteriole is not in center, but it is eccentric in location. I will give you the concept why it is eccentric in location. That is important for you to understand. Actually, it is pushed towards the periphery. From the trabeculase, the trabecular arteries and the vessel traverse, from that the central artery arises, and the central artery will go inside the white substance or lymphoid aggregations, and this will push the central artery into the periphery. So the central artery, which was initially in the central location, has now become eccentric in location, and the presence of white pulp with the eccentric location of the central artery is a characteristic feature of identification of the spleen. And here you can see this is the enlarged view of the white pulp, which will have an outer dense part which will have mature lymphocyte. The center part will have GC, which is having the germinal center with lighter in staining and less density of lymphocyte, and the central arteriole will be pushed towards the periphery, and it will be eccentric in location. Okay. So basically, I just want to write few important points, not much detail about the white pulp. So when I am using the word white pulp, it's important for you to understand what do you mean by white pulp. So when I am using the white pulp means it is consist of aggregation of lymphocytes. It is consist of aggregation of lymphocytes. And if I talk about it consists of aggregation of lymphocytes, and the white pulp will have the lymphatic nodule. It will have the lymphatic nodule. It will have the central artery, which will be in the eccentric location. The central artery will be in the eccentric location. The central artery is eccentric in location. So actually, I also want to tell the central artery and the lymphocytes. Lymphocytes which is surrounding the central artery, is called as pulse. It is called as pulse. What do you mean by pulse? Periarterial lymphatic sheath. The full form is, it is called as the periarterial lymphatic sheath. So this is periarterial lymphatic sheath, that is the lymphocyte initially which is surrounding the central artery. So here means this will be the pulse. So the central arteriole and it's initially surrounded by the lymphatic sheath is the pulse. Okay. Let me see. Yeah. In this diagram, you can see the pulse also. So see here. If I talk about the white pulp, which is a lymphatic, if we talk about the white pulp, you can see there is lymphatic aggregations. This is the lymphatic nodule, this is the lymphatic nodule, this is the lymphatic nodule, and this is the central artery, CA for central artery. And we will also have the the lymphatic aggregation which is surrounding it. The lymphatic aggregation which is surrounding the central artery initially is called as the pulse periarterial lymphatic sheath. And we will have the cortex, and we will have the white pulp with whole of lymphocyte aggregation, and the in between we will have the red pulp which contains splenic venous sinusoids. Now, so done. So when I am talking about the red pulp, if you will see the red pulp, so again you will see the red pulp. So if you will see the red pulp will have the artery. So red pulp will have the it's a modified lymphoid tissues part. So red pulp is basically, when freshly cut, it will be red in color. It is having blood. It contains splenic cord of Billroth. It contains splenic venous sinusoids. So it is actually consists of splenic venous sinuses in between the cells, and the splenic cord contains sponge of network of reticular fibers. So here we will have a splenic cord and venous sinusoids. We will have splenic cords of cells and splenic venous sinusoids which is present in the red pulp. Actually, there is a schematic diagram to make you understand. So first thing is that you should know what lies in the red pulp. So red pulp is having a red when freshly cut. It contains anastomosing splenic cord of Billroth. It contains splenic cord of Billroth, and it contains splenic venous sinuses. Sinusoids or sinuses. So basically, splenic venous sinuses is lined by an elongated spindle-shaped cells, which is exactly, I just want to show you one important feature. So see here, this is the part of red pulp. You can see the splenic sinusoids are there, and this splenic sinusoids is having a spindle shaped structure. The splenic sinusoids is covered by reticular fibers. What you can see, it is covered by reticular fibers, and you can see it is appearing in the shape of barrel shape. So exactly, splenic sinusoids is elongated in shape, and it is surrounded by externally. If you will see, it is having a shape of wooden barrel. It is a wooden barrel shape, and it is called as stave cells. The other name is stave cells. So many times the MCQ comes, stave cells is associated with structure, lymphoid tissue, lymph node, thymus gland, and spleen. The right answer is spleen. So there is a gap in between the endothelial cells of the splenic venous sinuses, which will be important for engulfing the worn out RBC. So this is how the representation, actually the representation of reticular fibers surrounding and presence of splenic cords of Billroth along with the stave cells, endothelial cells, all will appear along the wooden barrel shape. So it is called as stave cells, which is present in the red pulp of the spleen. So done. I would also like everybody to understand the theories of circulation. So theories of splenic circulation. So actually there are two proposed theories of splenic circulations. One is the open theory and the other is closed theory. So according to this theory, there are two types. So one is closed theory, in which the blood plasma directly passes from arterial capillaries to splenic venous sinuses. So here you can see this is the closed circulation. So if the blood directly passes from arterial capillaries to that of the venous splenic veins, it is called as the closed circulation. So there is one more diagram for it. See here. In this you can understand. Okay, So here what happens, this is the pulse. What is pulse? As I told you, this is trabecular artery, then it is called central artery, and it is surrounded by lymphocytes. So the lymphocytes which is directly lying in the periphery, the lymphocyte which is lying directly in the periphery of the lymphocyte which is directly lying in the periphery. So the lymphocytes which is directly lying and surrounding the central artery is called periarterial lymphatic sheath. And here we can see we will have this as a sinusoid trabecular vein, and we will also have the artery. So from the blood from the arterioles is directly going, if it is directly going to the veins, then that type of circulation is called as closed circulation. And if there is a different kind of circulation in which is called as the open circulation, in that case what happens, the blood is not directly the blood arterial blood will pass through the cords of Billroth, and then through the spaces. So it will pass through the spaces in between the endothelial cells, and thereafter it will traverse in the open cell. In that process, old out or worn out RBCs are engulfed by the macrophages. So in that process, so if the direct exchange of blood between the capillaries and venous sinusoids doesn't happen, it goes through the spaces, it goes through the spaces of Billroth in between, and the worn out RBCs are engulfed. That is called as open circulation. So these are the two splenic circulation which has to be known to you. So done. Now we will, so I would like to tell about the MCQs asked in the previous year of examination from these topics. So please solve it. All of the following are the components of white pulp of the spleen except. Vascular sinus, antigen presenting cells, B cells, periarterial lymphatic sheath. So please mark the right answer. HSC, ma'am, this is enough for passing FMG December. Only this live session, HSC. Yes, that is more than enough. Yes, dear, that is more than enough. But let me see actually what I want. I will ask with the academic team of Sir's platform, YouTube platform. Before your exam, I just want a 100 MCQ session or 200 MCQ session or 100 MCQ session. Most important, that will add on. Okay. So that I will take in the later months of November. I think I will just ask with the team. That will be very useful for you to crack the exam. Okay, it's HS. That will be, so my live sessions are enough, but you will also have to go through an test and discussion kind of thing. So that will be a test and discussion kind of thing. And the other is like 1 and 2 hours for neuroanatomy, please. Yes, I know that sometimes 1 hour 2 hour session is there, so the concepts becomes very easy. So yes, I will try to take it like that. Okay, okay, doctor. Okay, now please solve this MCQ. This will be highly beneficial for you. All of the following are a component of white pulp of the spleen except. All of the following are the component of white pulp of the spleen except. All of the following are components of white pulp of the spleen except. So please mark the right answer. Okay, doctor, please mark the right answer according to you, which is not a part of white pulp. It will be a part of red pulp. It will be a part of red pulp. This, Debasi, they. B cell is the part of white pulp only, no? B cell is the part of white pulp, which is the part of red pulp. Red pulp. Anyone? RBCs. Okay, RBCs is there. So that means a better word in this option will be vascular sinus. So the right answer is vascular sinus will be present in the red pulp. Other than that, all these three, periarterial lymphatic sheath, as I told you, periarterial lymphatic sheath and B cells, antigen presenting cells, all will be present in the white pulp. Yes, yes, Debasmeet, vascular sinus, it is present in the red pulp. Yes, yes, venous sinuses in the red pulp. Absolutely correct. So I would also like to show you the histology of the spleen diagram. So this is the spleen where you can see the white pulp and the red pulp. So in the white pulp, you can see lymphatic aggregations are there. So in the white pulp, as you can see, this is a lymphatic aggregation. So there is also the location of central arterioles. So there is the location of central arterioles in this lymphatic aggregation. There will be germinal center, the inner part where will be the less dense lymphocyte aggregation, and in between is the red pulp. So if we have to identify the slide of spleen, how you are going to identify? The identifying features will be thick capsules with the trabeculate traversing inside. Divide the interior of the spleen into white and red pulp. Lymphatic nodules are there in the white pulp of the spleen with the central arterioles. Red pulp contains splenic cords of Billroth and sinusites. Now, the last lymphoid structure which I want everybody to understand is the lymph node. So, basically, yes, students are telling ma'am neuroanatomy. So, actually, after completing this lymphatic structure, I will cover the general histological aspect or general part of neuro. So, I want neurology you should understand, because neurology part histology is also completed here. That will cover up the peripheral nerve histology, the structures of neurons, the structures of cerebellum, cerebral cortex, spinal cord. So that will again cover up the neurology question. So I want you to present after the lunch. So I will complete the lymphatic one. Then I will give you a lunch break of 20 minutes, 25 minutes. Is it okay? Small lunch break, and then we will start with the general neurology and then the systemic histology. Okay, so here lymph node. So if I talk about the lymph node is a bean shaped structure situated along the course of lymphatic vessels. They serve as a filter. So what is the function of lymph node? They are filtering the lymph from the particulate, contamination and matters, any kind of infections, and they are controlling the spread of infection. So lymph nodes are all obviously arranged in group, like we will in our body will have axillary group of lymph node, we are having inguinal group of lymph nodes. Lymph node is having many afferent vessels which is entering through the convex surface, and we will have an efferent lymphatic area from where the efferent lymphatic structures are leaving through the concave depression near the hilum. Okay, I will show you an image for it. That means hilum is traversing the blood vessels and also the nerves. The lymph vessels is provided with the valves in such a way that lymph will flow in one direction. So here you can see this is the kidney shaped, bean shaped structure is the lymph node, which is having a convex area. The convex part of the bean shaped structure is having lymphatic, afferent lymphatic vessel traversing inside. Then we will have the efferent lymphatic vessels at the hilum part, seen in the hilum part. And we can see clearly if we talk about. So from the hilum, the efferent lymphatic vessels, as you can see, is going out, and we will have the whole of the interior of the lymph node will have a cortex, paracortex area, and the medulla. Okay, and the whole of the lymph node is covered by fibrous capsule, and beneath the fibrous capsule there is a space that is called as subcapsular sinus. Okay, now let's talk about the components of the spleen, of the lymph node, sorry, of the lymph nodes. If I'm talking about the components and the structure, it is again having a connective tissue framework. The connective tissue framework is formed by capsule, trabeculae and reticular stroma. So it will have capsule, it will have trabeculae, it will have reticular stromas. The parenchyma, if I'm talking about the parenchyma is formed from cortex, paracortex and medulla. Is it okay? Connective tissue framework is having fibrous capsule, will have the trabeculae going inside, will have a reticular stroma which is acting as a support system for the lymph node, which is consists of reticular fibers, and the whole parenchyma which has the lymphatic aggregations will be divided into outer area as the cortex. Then we will have the paracortex region, and the inner is medulla, which contains medullary cords and sinuses. So if I have to tell about the histology part, it will have an outer fibrous capsule From the capsule there will be trabeculase which is given inside. What is the importance of trabeculae? It will divide the lymph node into different lobes, and then it will have a reticular stroma which will have the reticular fibers for supporting it. It will have the parenchyma, and this, and beneath the fibrous capsule there is subcapsular sinus. There is subcapsular sinus. The parenchyma is again having three zones which you have to know. There will be cortex, there will be paracortex area, and there will be the medulla area. Okay. Now see here, the lymph node section, it is a kidney shaped structure. You can see the outermost part. If I slight enlarge it, yeah, so you can see the outermost fibrous capsule is there, and just beneath the fibrous capsule, if you will see, there is a space which is called as subcapsular sinus. Actually this is only present in the lymph node. Subcapsular sinus is only present in the lymph node, and from the fibrous capsule the trabeculase going inside. These are the trabeculase which will carry the vessels, and the entire if you will see the zones, what you can see, the outermost part of the lymph node is cortex, and we will have a T dependent zone here which is called as the paracortex region. So this is the paracortex, which is called T dependent zone of the of this lymph node, thymus dependent zone, and the inner part we will have the medulla. This is the medulla part. So medullary, if I talk about the medulla part of the lymph node, it contains of medullary cords and medullary sinuses. The so you can see medullary cords and medullary sinuses are there in the medulla part. Paracortex region of the of this lymph node is thymus dependent zone, and the cortex is having the meshwork of reticular fibers along with the support system of reticular fibers and lymphatic aggregations. And this is the hilum where the efferent lymphatic vessels has been shown. The flow will also be shown to you. So direction of the lymph flow, the flow chart is here. Please go through this. So exactly on the afferent lymphatic vessels will traverse through the trabeculae and all, and will enter the subcapsular sinus through the trabeculase. Then it will enter the medullary sinus. Efferent lymph vessels will move and will emerge out from the hilum and will go to left subclavian vein and to the general circulation. This is the direction of lymph flowing through the lymph node. Okay. Now this is the diagram where you can see the histological aspect of the lymph node. You can see here the fibrous capsule. You can see the subcapsular sinus very nicely in this image. So you can see the subcapsular sinus here. From the capsule, you can see here from the capsule the trabeculase are given, which will divide it into lymphatic lobes and all, and lymphatic nodules are there. The interior of it is GC, that is the germinal center, which will have less density of the lymphatic aggregations, and here we will have the inner part is the medulla and the outer part is the cortex. Again the cortex is divided into the into different areas which we will talk about. So here, as I told you, in the case of cortex, we will have the subcapsular sinus. Capsule is there. This is again the lymphatic. So just see here. We will have the capsule. Then we will have the subcapsular sinus. The trabeculase has been shown, which is going inside. As you can see, these are all trabeculase. This is GC, this is the germinal center, less dense. As you can see the lymph node, you can see in the GC we will have the germinal centers of lymphatic nodules are less densely packed as compared to outer lymphatic nodule part. Okay, other than that, we will have the paracorticus, we will have the cortex. So exactly cortex part is having the subcapsular sinus, fibrous capsule, lymphatic nodule aggregation, and the paracortex is the inner zone, which is the T. So if I talk about paracortex, it is having T lymphocytes only. Why? The cortex and all is having B lymphocytes, but T lymphocytes are only present, is the presence of paracortex. This is called thymus dependent zone. And the medulla. The medulla has having the medullary cords, branching anastomotic cord of typical lymphoid structure. So which will have the branching pattern of lymphoid structures. And we will have medullary sinuses in the medulla, and the medullary sinuses in the medulla. So done. Now I just want to show the enlarged view of lymph node, where you can see the subcapsular sinus, a characteristic feature of identification of lymph node. Just below the fibrous capsule, the slight space is there, that is subcapsular sinus. Then the dense, these are all trabeculars. This is the lymphatic nodule. So we will have the lymphatic nodules. This is the medulla, which is lying inside, which is lymphatic nodules in the cortex. So the identifying features, if I have to write about the spleen, we will have thin fibrous capsule, the subcapsular sinus is there. We will have lymphatic nodule, which will also have germinal centers. We will have medullary cords and medullary sinuses. We will have the medullary cords and medullary sinuses in the interior of the lymph node. So these are the features which you have to know about the lymph node. Now let's talk about the question to be asked here. So is it okay, everyone? Can we solve an MCQ related to this topic? Yes, Ahmad, reticular fibers. If I talk about reticular fibers, they are the connective tissue framework. They are spread in between the parenchyma. So they, Ahmad, they are present in the whole part of the spleen, lymph node and lymphoid structure for giving support, to the lymphoid organs. Okay. Okay, Ahmad. So can you tell me, in the lymphoid organ listed above, reticular fibers are found in which of the following structures? No, reticular fibers are not found. The question is, reticular fibers are not found in which of the following lymphoid structures? Everyone, reticular fibers are not found in which of the following lymphoid structure? Whether it is thymus, lymph node, bone marrow, spleen, which is the right answer. So they, in place of reticular fibers, yes, Ahmad, that is actually, yes, Ahmad, that is a connective tissue framework. Though that is giving connective tissue framework will give support to the lymph node and spleen. So reticular fibers are present. Only one of the lymphoid organ is there, where in place of reticular fibers, there is certain other structure which is supporting it. Can you tell me the answer for question number? This has been asked in previous year NEET PG INICT exam. Select the correct answer. Debas Smith, Dr. U, Ahmad, Dr. Ahmad, Dr. Harshit, Dr. Arobo, Dr. Vijay, Dr. Satish, anyone please give the answer. The lymphoid organ listed here is all having reticular fibers as a connective tissue framework, but one of the lymphoid structure is not having reticular fibers as a connective tissue network. It is having epithelio-reticular cells. So can you, I have given the hint also. Which of the following structure is having epithelio-reticular cells as the supporting network? Epithelio-reticular cells as the supporting network. Epithelio-reticular cells as a supporting framework. And the right answer is dear thymus gland. Thymus gland, one only. Thymus gland is the odd man out along all the lymphoid structure. Thymus gland is having epithelio-reticular cells as the supporting network. It is not having reticular fibers. In place of that, it is having epithelio-reticular cells, which is developed from the endoderm of third pharyngeal pouch. Okay, dear. Now identify the histological slide, whether it is tonsil, lymph node, thymus gland or vein. Identify the histological slide. So can you identify this histological slide? This is an image based question. Which histological slide is shown in the image? Which histological slide is shown in the image? So this is the lining epithelium. This is the lining epithelium. So the hint is lining epithelium. And what is this? This is anyone? Which is this slide? Whether it is which is this slide? Whether it is tonsil, lymph node or thymus gland? Actually, this is tonsillar crypt. This is tonsillar crypt. So if there is a tonsillar crypt and the lining epithelium is stratified squamous non-keratinized epithelium along with lymphatic nodules. Also, you are seeing a lymphatic nodule along with it. So definitely this becomes a slide. If there is a lymphatic nodule, there is a stratified squamous non-keratinized epithelium. So definitely this becomes a slide of tonsil. So which slide is this? This is the tonsil slide. So definitely it is a slide of tonsil. Okay. Got it? Because lymph node is not having tonsillar crepes and stratified squamous non-keratinized epithelium. Thymus is not also having this epithelium. Vein will have the simple squamous epithelium. So you can see this is a slide of tonsil which has been shown, and there is tonsillar crepes along with the lymphatic aggregation along with stratified squamous non-keratinized epithelium, which help us to identify the slide. Now one more question, very easy. Stave cells are present in which of the following? Stave cells are present in liver, stave cells are present in spleen, stave cells are present in pancreas or gallbladder. So please mark the right answer, dear. Stave cells are present in which of the following structure? Liver, spleen, pancreas and gallbladder. Please mark the right answer. Stave cells are seen in, I have explained the barrel shaped structure which I have explained, which is spindle shaped, that is the splenic venous sinusoids, and have a covering of endothelial reticular fibers engulfing the worn out RBCs. The right answer is spleen. So the right answer will be spleen. Sri Roth, it will be spleen. Till now liver I have not told. Liver, spleen is having the stave cells. Okay, no worries. If you have joined late, you can see the session from the beginning, but I just want everybody, now you continue with seeing with understanding the session right itself with along with me, so that you can ask your doubts also. So that is the stave cell. So you can see here, this is stave cells here. Shri, please see here, this is the stave cells. This is spindle shaped splenic venous sinusoid. So this is the splenic sinusoids, and this is having reticular fibers, and it is in the presence of wooden cascade, and this is present in spleen. This is present in spleen. Okay. Now we have done with this. So actually we have finished with this. Now we have finished the first part of histology session, and I want you to give a break. After this I would like to start with the second part, that is most of systemic and the neurohistology. So in this session I will tell you about the systemic histology and the histology of neuroanatomy. So this is very important. Have your lunch and again be connected for it. I will give you a 20 minutes break, so that you can have quickly your lunch, and we will connect it for the histology second, which will be of systemic histology in brief and also the neuroanatomy histology. Is it okay everyone? Have a break and then again be connected after 20 minutes. Thank you. Okay. Hello everyone, am I audible so that we can start the session? Please let me check. Hello everyone, am I audible so that we can start the session? I was just checking. Okay. It's okay. I was just checking whether everything is all right or not. Yeah. So everything is clear and we can start the session. Okay. So now this is the histology part 2, and I would like to start with the nervous system. Actually, neurology session is already done, but in that in this, yes, yes, Anchal Sen, class is going on. Yes, dear, class is going on. Yes, yes, class is going on, dear. So anatomical classification of the nervous system, if we talk about the anatomical classification of the nervous system, we know that the nervous system can be categorized as the central nervous system and it can be categorized as the peripheral nervous system. Okay, now the central nervous system is again categorized as the brain and the spinal cord, and the peripheral nervous system will be categorized as the cerebrospinal nerves and autonomic nervous system. The autonomic nervous system has got two components: the sympathetic nervous system and the parasympathetic nervous system. Okay, now I would like to describe the different types of ganglia as unipolar and that of as unipolar, bipolar, multipolar and pseudopolar. So this is again an important MCQs which has been asked in the previous year of examination. The morphological classification of the neurons. So the morphological classification of the neurons is subsequently we have got a unipolar neurons. So we are having a unipolar neurons, we are having a bipolar neurons, and we are having multipolar neurons. And there is a fourth one that is called as pseudo unipolar neurons. Okay, so basically we are having these kind of neurons: the unipolar, the bipolar, the multipolar and the pseudo unipolar. What is asked in examination is the example of each type. The first thing is that you have to understand how we classify along the with the process of the neurons as the different kinds of neurons. So when I am using the word unipolar, it means it is having a single process. So unipolar means it is having a single process, and the best example is mesencephalic nucleus of trigeminal nerve. Bipolar means it is having two processes, one axon and one dendrite, and the best example is the spiral and the bipolar cells of retina. Multipolar is the most common type. It is having an axon and it is having many dendrites. So we have got autonomic neurons, autonomic ganglion, motor neurons. All these are the multiple. Pseudo unipolar is there is a single process which divide into axon and a dendrite. So cranial and spinal ganglia are sensory neurons. So basically we will come to this once again. Now I just wanted to show this image where you can see unipolar, there is one process, the mesencephalic nucleus of trigeminal. Bipolar, two process is there, the bipolar and the sensory neurons. Then we will have the spiral neurons in case of auditory tubes. The pseudo unipolar, there is one process and it divides into the two. Sensory neurons, multipolar, most common time, the autonomic neurons, which is having many dendrites and one axon. So this is showing you the shape and how you are dividing the neurons in the morphological basis of unipolar, bipolar, pseudo unipolar and multiple polar. Now my dear students, here examples has been asked in the previous year of examination, so you should know which is the unipolar example, that is the mesencephalic nucleus of trigeminal, which is the bipolar, which is the sensory neuron. Bipolar example is bipolar cells and of retina and spiral ganglion. Then we have got multipolar, the autonomic neurons, ganglions and motor neurons, and pseudo unipolar is the cranial and the spinal ganglion, that is the sensory neurons. Now the next is based on the sensory classification or the function, the classifications will be okay based on the sensory classification. So let's come up with the sensory classification. Functional classification. So in this category we will have the major type, that is sensory and motors. So in this classification we will have the major type, that is the sensory and motors, and it is important for you to know the categorization of all. So that is highly important for you. The functional classification. So now let's talk about the functional classification. So we will have the sensory neurons which will conduct impulses from the receptors and take it to the central nervous system. So if we are talking about the if we are talking about so basically if we are talking about the sensory neurons is receiving the stimuli from the receptors and carrying it to the central nervous system. The motor neurons is conducting the impulses from central nervous system to that of effector organs, and the best example is, so we will have sensory ganglions as the sensory neurons, and we will have ventral horn cells as the motor neurons, and interneurons are the neurons which is connecting the motor and the sensory as a functional unit. So this is the functional classification. Now let's see this image where we can appreciate the structure of typical neurons. Okay, here you can see this diagram is showing you the structures of typical neurons. So we are talking about the structures of typical neurons. So we will have here as the cell body, which is also called as the soma. So cell bodies is actually shown, and we will have the dendrites, which is highly the tapering end. So if we talk about the dendrites, it is having highly tapering ends. The other name of cell body is soma, and it is also called as pericrione. So it is approximately 5 to 150 micrometers in dimension, and it contains nucleus in the center. As you can see, it is also having the nasal granules or the nasal substance. So it is having the nasal granules and nasal substance. Actually, they are basophilic, and there is large dense accumulation of nasal granules. Golgi complexes will be also contained in the cell body and the soma. And we will have the other important picture. So if I talk about the cell body and soma, what all structure is contained, so I would like to show you another image for it. So here you can see this is the cell body. So I'm talking about the different parts of the neuron. So this is the cell body, which is also called as the pericrione, and it is also called as the soma, pericrione, 50 to approximately 5 to 150 micrometers. It is having a central nucleus. As you can see, it is having the nasal granules, which is extending till the axon helix, but it is not going into the axon. It is not traversing in the dendrites also. So basically, nasal granules are actually large aggregation of rough endoplasmic reticulum. So these are consist of rough endoplasmic reticulum, and they are actually basophilic clumps, and they can extend into dendrites but not into the axon and axon hillock. So basically, this part is the axon, the tapering end. So nasal granules can one or two, you can see it is extending in dendrites. So it can extend into dendrites, that is very important, but it is not extending into axon, hillocks and axon. So please mark it. If I have spoken wrong, please correct it. So this is the soma, and this is the nasal granules, which is seen in the cell body and also can extend into dendrite, but it is absent in axon, hillocks. Now, other than that, as I told you, the cell bodies contains the mitochondria, the Golgi complex. It also contains melanin pigment and lipofuscin pigment. Now, dendrites are highly branched. So if you will see dendrite, it is highly branched. So if you see the dendrite, it is highly branched. And this receives the sensory stimulus. Axon is a long cylindrical structure. As you can see, this is the axon, and this is a long cylindrical structure. Here also you can see this is the axon, the long cylindrical structure, and this is the axon terminals. So here if we talk about, so this is exactly showing the structure of multipolar neurons. So long cylindrical process of the neuron is called as the axon, and it does not branch profusely. One of an important point about axon is it is not branching profusely, and the cytoplasm of axon is called exoplasm. The cytoplasm of axon is called as exoplasm, and axon is, in the common language, if I talk about axon, axon is commonly referred to be as nerve fibers. It is commonly referred to be as nerve fibers. Okay. Now, what is the important function of this is conducting impulses from cell body to axon terminal. So, this is the lower end where we have the ending point of axon as axon terminals. So, it is conducting impulses from the cell body to that of axon terminals. So, conduct the impulses away from the body to axon terminals. This is an important function for the another target cells. So, axons are commonly referred as nerve fibers, and often it is surrounded by a myelin sheath. So, you can see the covering of axon is called as myelin sheath. It is often surrounded by myelin sheath as shown in the diagram. Here also you can see the myelin sheath is surrounding the axons. So, another important point is that axons regeneration, if I talk about the regeneration of axon, when it is possible. So, regeneration of the axon will be possible only when the cell body is not destroyed, and it is also important to know it is covered by a myelin sheath. So, in case of peripheral nervous system, the axons are enveloped by squamous cell which provide both structural and the metabolic protection. So, you can just see this. This is an axon, okay, and this is a squamous cell. So exactly squamous cells is providing the myelin sheath over the axon, and it is longitudinally whole covering the axons, as you can see, and a single nerve fiber is having a deep fascia covering, which is called as endoneurium. Nerve bundles, if I talk about the entire nerve bundle, the entire nerve bundle is surrounded. So we will have nerve bundle or nerve fasciculus, and this entire nerve bundle and nerve fasciculus is surrounded by again another modification of deep fascia, which is called as perineurium. So what is it? This is the perineurium. So this is the perineurium. So single nerve fiber is surrounded by endoneurium, and the nerve bundles on fasciculus is surrounded by the perineurium, and the entire nerve, if we talk about the entire nerve, the whole of the nerve bundles and the entire nerve is surrounded by epithelium. What is it? It is surrounded by the epithelium. Okay, so it is exactly surrounded by epithelium. Now, there is a gap in the areas. So also you can see this is knots of Ranvier. So there is gaps in the axons. There is gaps in the covering of myelin sheath. So there are gaps in the area and the axons which is not covered by myelin sheath at a regular interval, which is called as knots of Ranvier. So exactly in large myelinated axons, the nerves impulses jump from one knots of Ranvier. So from one node to the other, and this conduction is called as, this type of conduction is called as the saltatory conduction. This type of conduction is called as saltatory conduction. So that is important. And the space between the two knots of Ranviers is called as internode. So let me show one more image. Yeah. So this is knots of Ranvier, and there will be another knots of Ranvier. So the space between two knots of Ranvier is called as internode. So myelin sheath. So and also you can see in this diagram. So here one point you please write down that in case of, so there is central nervous system and there is peripheral nervous system. So myelin sheath is formed by which structure? That is very, very important for you to note down. So please, in peripheral nervous system, the myelin sheath is formed by squamous cells. The myelin sheath is formed by squamous cells. And in central nervous system, the myelin sheath is formed from oligodendrocytes. The myelin sheath is formed by oligodendrocytes. Okay, it is formed by oligodendrocytes. So that is very important for you to understand how this myelin sheath is formed. Now, oligodendrocytes. So now here we can see the myelin sheath shows a cone-shaped cleft. So exactly you can see there is a cone-shaped cleft in the myelin sheath, that is called here the squamous cell nucleus is there, because squamous cell is forming the myelin sheath in peripheral nerve fibers, and also you can see there is also a cone-shaped cleft is there. So this cleft is called as Lantermann cleft, that is called schimodid Lantermann cleft. This is the area of remnants of the cytoplasm of squamous cell which is present in the myelin sheath. So exactly what is this Lantermann cleft which is seen in the myelin sheath? So this Lantermann cleft which is seen in the myelin sheath is actually the remnant of the cytoplasm of the axon cell which is present within the myelin sheath. So this is very, very important for your examination, for your MCQs. Now talking about the peripheral nerves. So I would like to show you two sections. One is the peripheral nerve cross section or transverse section. Another image will be the longitudinal section. So the connective tissue framework is well appreciated when you see the cross sectional image. So here you can see the individual. So when you see it's a dense connective tissue. If we talk about a loose connective tissue composed of, so if we talk about the coverings of the nerve fibers, individually it is the endoneurium. If we talk about the nerve fasciculus and all together is covered by, then that is the nerve fibers as a together or flattened sleeve of specialized epithelial cells surrounding the entire nerve bundles is the perineurium, and epineurium is the whole of the nerve is surrounded by the connective tissue surrounding individual nerves as a whole is epineurium. Now, in case of optic nerve, it is surrounded by meninges. Yeah, so just one of an important point here I want to tell, which has been asked. Optic nerve is an odd man out, where the optic nerve, the entire optic nerve is covered by meninges. Optic nerve. So if we talk about optic nerve, the optic nerve is having a covering of whole of the meninges. What is meninges? Is the covering of the brain. So optic nerve is having the meningeal covering, and in between you can see the blood vessels. These are the bundles of nerve fibers. Together the whole of the muscle bundle fasciculus is covered by perineurium, and entire nerve is covered by the epineurium. Now one more image is there, where the cross sectional image of the histological section. So here we can see the perineurium covering the entire muscle bundle, the loose connective tissue, and the bundle of nerve fibers has been shown. So exactly in this case, bundle of nerve fibers has been shown, and perineurium surround each bundle of. So here the nerve bundles, these are the nerve bundles, and here you can see the nerve bundles are surrounded by the perineurium. The darkly stained myelin sheath is also shown. Now again this is a high power view. So this is a high power view. In this, so you can see the remnants of the myelin sheath, the axons has been shown, the nerve fibers has been shown, and each of these nerve fibers are surrounded by endoneurium. The nerve bundles. So here if we talk about the nerve bundles, so these are the nerve bundles, and these nerve bundles are surrounded by perineurium, and entire nerve will be surrounded by epineurium. So this is again the TS of transverse section of peripheral nerve. Now, this is the longitudinal. Next is the longitudinal section. And in the longitudinal section, if I talk about the longitudinal section, again you can see the longitudinal section. The squamous cell nucleus has been seen with the squamous cells of the peripheral nerve, which is forming the myelin sheath, the axons and the myelin sheath nerve fibers, and you can see this appearance of longitudinal section of the nerve. So peripheral nerve longitudinal section will give a snake-like appearance. So a longitudinal snake-like fencing appearance has been shown. So snake-like fencing appearance has been shown. Done. Now I would like to talk about ganglia. So let's talk about, actually two types of ganglia are there and differences of each type of ganglia. you have to know. So if I am talking about the ganglia, they are oval bodies, which are made of aggregation of cell bodies of the neurons. So exactly, they are aggregation of the cell bodies of the neurons which is lying outside the central nervous system. They play an important relay center for neuronal pathway. So basically, definition of ganglia, I know many students, they are not exactly knowing the definitions of ganglion. So it is important that you should know what exactly is a ganglion. So ganglion is aggregation of cell bodies of the neuron outside central nervous system. They have got a covering of dense connective tissue capsule which is called as epithelium. The cell bodies of neuron are enveloped by a cuboidal cells that is called as satellite cells. So that means cell bodies, ganglia are aggregation of cell bodies outside central nervous system and outside brain and spinal cord. They are surrounded by epithelium, the dense connective tissue capsule, and they also have a cuboidal cells surrounding it. That cuboidal cells which is surrounding it or enveloping it is called as satellite cell. Two types of ganglia are distinguished on the basis of morphology, function. So it is very important that we should know the difference between the motor and the sensory ganglia. It's very important that we should know the difference between motor and sensory ganglia. So let's see this image. Okay. So one side we have got the sensory ganglion and the other side we have got motor ganglion. The motor is the sympathetic ganglion and the sensory is spinal ganglion. Now, if I am talking about the sensory ganglions, it is of which type? It is pseudo-unipolar. So it is pseudo-unipolar and large, its neurons are, if I talk about the neurons, it is of large rounded ovarian varying sections has been seen. So we can see the pseudo-unipolar neurons, it is large rounded. Nucleus is in the center. If you will see the nucleus of these, so if you will just see this, you can appreciate that the nucleus are in the center. So in this case, the nucleus are in the center, no doubt about that. The nucleuses are in the center and they are formed in groups. So they are found in groups. So in case of sensory ganglions, if I talk about the sensory ganglions, they are large rounded varying pseudo-unipolar neurons which is lying in the groups, and they are also nucleus is located in the center, and they have got a well defined satellite cell. So you can see they have got well defined the satellite cells which is surrounding it. These are all satellite cells. If I am talking about motor ganglion, the next is the motor ganglion. If I talk about motor ganglion, multipolar neurons are there and satellite cells are also there. Multipolar neurons, small, angular and uniform size, they are not in group. They are found scattered. So if you are talking about sensory one, they are in group, pseudo unipolar, and they are in group. But if I am talking about the sympathetic motor ganglion, they are not in group. They are scattered and poorly defined satellites. So you can see these are the satellites and which is well defined, but with here we have got poorly defined satellite cells. So basically these are the primary difference between the sensory ganglion and that of motor ganglion. Now I just want you to show two images where you can have an idea of the both types. So the first is the spinal one. The first is the spinal ganglion. So we will talk about the spinal ganglion. Okay. So in case of spinal ganglion, there is pseudo-unipolar neurons. Pseudo-unipolar neurons, the sensory neurons. So it is having the pseudo-unipolar neurons, as you can see. It is bundle of nerve fibers are there. Satellite cells are well defined and also epithelium is shown. So if you will see, and you can see the pseudo-unipolar neurons are in groups. So they are in groups, they are not scattered. Well defined satellite cells are there, and also they are the pseudo-unipolar neurons are in group. Okay. Now if I am talking about the sympathetic or the motor ganglion, it is having multipolar neurons. And you can see this multipolar, if I am talking about this multipolar neurons, this multipolar neurons are not lying in group, but they are scattered. So here you can see the multipolar neurons. The multipolar neurons, if I talk about the multipolar neurons are scattered. They are scattered and they have got stellate cells but fewer stellate cells not well defined, and bundle of nerve fibers along with the epineurium has been shown in case of sympathetic ganglion. So done with the neurons, and the next is the neuroglial cells. If I am talking about neuroglial cells, they are actually supporting cells. Neuroglial cells are supporting cells for the neurons, and they provide structural and metabolic support to the neurons. So what is the function? They are providing structure and metabolic supports to the neurons. There are exactly 4 types of neurons in central nervous system, which is called as neuroglial cells. We have got astrocytes, we have got oligodendrocytes, we have got the ependymal cells, and the microglial cells. So 4, we have got together 4 neuroglial cells in the central nervous system, which you have to know. We have got the astrocytes, we have got the microglial cells, we have got the oligodendrocytes and ependymal cells. So if I am talking about ependymal cells, we have already seen the ependymal cells in the epithelium session, where I have told you ependymal cells are lining the ventricle walls on the central canal of the spinal. To structure the ependymal cell is lining. It is ciliated columnar epithelium cells which is lining the cavities of the ventricles and also the central canal of the spinal cord. So, and so we have got about the ependymal cell, no need to have a separate separation for it. So we are now knowing the ependymal cells. So ependymal cells function we are already knowing. It's a low columnar ciliated epithelium lining the central canal of the spinal cord and that of ventricles of the brain. The next other one which we want to discuss is the differences. So this is a table which is showing you the differences between the other 3 types of neuroglial cells, that is the astrocytes, oligodendrocytes and microglial cells. So when I am talking about astrocytes, the astrocytes is again divided into 2 types, that is that is a protoplasmic and the fibrous astrocytes. So we have got 2 important varieties of astrocytes. We have got fibrous and protoplasmic astrocytes. The other is oligodendrocytes and microglial cells. So if you will see the protoplasmic and fibrous, it is more or less similar. It is large and oval. It is having large and oval nucleus, as you can see, and the cytoplasmic process is a short thick process. But in case of the fibrous astrocytes, if we see the fibrous astrocyte, it is having the long slender process, and oligodendrocyte is medium size. It is having few short beaded process, and microglial cells are short thin processes which is also having the spine. So it is small elongated appearance is microglial cells which is having processes with spine. Oligodendrocytes have short beaded processes, fibrocytes have slender processes, and if I am talking about protoplasmic astrocyte, it is having thick process. Now here again the cytoplasm of the protoplasmic process. The cytoplasm of the protoplasmic process, when we are talking about the cytoplasm of the protoplasmic process, it is granular. The fibrous is fibular, and basically if I am talking about astrocytes, protoplasmic, it is present in the gray matter, and the fibrous one is present in white matter. The function of both these astrocytes will be supporting and nutritive function. So they are acting as a barrier to toxic material, and the both type of astrocytes are embryologically originating from neuroectoderm, from the neural ectoderm. Oligodendrocytes basic function is myelination in the central nervous system, and they are present in white matter. Microglial cells are present in both gray and white matter. The function of microglial cells are the phagocytosis. If I talk about embryologically, development of microglial cells is mesodermal in origin, and neuroectoderm is again the origin of oligodendrocytes. So this is a comparison of difference between the different types of neuroglial cells which has been shown in this table. Now let's talk in brief. Any doubt you can ask me. If I am talking briefly about the cerebral cortex, so we should know about the histology of cerebral cortex and also the cerebellum. So cerebral cortex, if I talk about the cerebral cortex, it consists of gray matter and white matter. The white matter will have the nerve fibers and the gray matter will have the cell bodies. The cortex is made of, cortex of the brain surface will have the sulci and gyri. It is based of number of cells of nerve fibers, neuroglial blood vessels and neuroglial cells types. So it is important to know the types of cells. So we will have different types of cells like pyramidal cells. So basically there are pyramidal cells are the basic most important cells which is found in the cortex, but the sizes vary. So it is present in the cerebral cortex, and we have got 5 types. The first one is pyramidal cell, which is the most common and the most abundant types of. Plenty of the pyramidal cells is found in the cerebral cortex. It is pyramidal in shape and their size ranges from the 10 micrometer to 120 micrometer. And if I talk about the biggest one, or the giant pyramidal cells of Betz cells, which is also called as Betz cells, the size can go up to 120 micrometers. It is distributed in 2 to 5 layers, and as deeper you go in the cerebral cortex layer, the size of these cells will increase. So as more deeper you go, the size of these cells will increase. That is the pyramidal cells or Betz cells. Stellate cells are the other form, that is also called as the granule cells. So stellate cells are also called as granule cells. They have got short axons terminating nearby the neurons. Fusiform cells are actually spindle shaped and they are at right angle to the surface in the deeper layer. So fusiform cell will be of spindle shape. We have also got a horizontal cell of Cajal. So how it is pronounced? Not C, it is horizontal cell of Cajal. K, it is pronounced as K. And they are also spindle shaped shell, well oriented horizontally. They are lying parallel to the surface of the superficial layer of cerebral cortex. The next is the cells of Martiniti. The cells of Martiniti is small multipolar cells found in layer 3 to 6. The axons are directed towards the cortex and generally they end in the molecular layer. So if I have to summarize the name of the cells of cerebral cortex, it is pyramidal cell is there. The largest pyramidal cell is the Betz cells. We have got other than that we have also got the other cells like granule cells and stellate cells. We have got fusiform cells. We have got the cells of Martiniti. We have got the horizontal cells of Cajal. Okay. Now coming to distribution. So here in this diagram, we can see the different types of cell types in the cerebral cortex. So we can see the horizontal cell of Cajal more superficially in the superficial layer. We have seen the small pyramidal cells and we can see the medium pyramidal cells and the largest pyramidal cells, which is basically seen in the internal pyramidal layer, which is called Betz cells. We have got multiform cells. We have also cells of Martiniti. We have got the cells of Martiniti, the stellate cells and the granule cells. Stellate cells, which is also called as the granule cells, and we have got the spindle shaped fusiform cells, which is directed vertically. Now, it's important to know the layers of the cerebral cortex. So, now the important feature is to know the layers of cerebral cortex and which all cells are lying in each layer. So, the layers are named according to the type and density of the cell it contains. So, it is important to know the type of the cells residing there and the density of that cells. So, the first layer is called as a molecular layer, which is also called as a plexiform layer. It is the most superficial defined layer and it mainly contains horizontal cell of Cajal. What does it contain? It contains horizontal cells of Cajal and also the nerve fibers. The most superficial layer, molecular layer. The next layer is external granular layer. So the word granular layer is used and we know that stellate cells are also called as granular cells. So it will have stellate cell and small pyramidal cells. The external, after external granular layer, we have got external pyramidal, the third layer, which will have medium sized pyramidal cells. So it will have medium sized pyramidal cells and also it will have few stellate cells and the cells of Martiniti. It will have few stellate cells and cells of Martiniti. Coming to the fourth layer, that is internal pyramidal cell, which is mainly composed of it is packed with the stellate cells and it is having a horizontally running nerve fiber band. This horizontally running nerve fiber of band which is residing in the fourth layer is called outer band of Ballarger, and internal pyramidal layer is called as ganglionic cell layer. Why it is called as ganglionic cell layer? It is having more of cells of Martiniti and large pyramidal cells of Betz. It also contains horizontally running fibers which is called as inner band of Ballarger. Actually, this has been asked in MCQ. Where is the inner band of Ballarger? It is in the fifth layer of cerebral cortex. Where is the outer band of Ballarger, which is in the fourth layer of the cerebral cortex? And where is the largest cell of pyramidal cells located? That is cells of Betz, which is present in the fifth layer. The multiform layer is the polymorphic layer. It is the deepest layer of the cerebral cortex, which contains predominantly fused cells, Martini cells, which is fixed with the fusiform cell layer. And deeper to it, we have got the white matter of the brain, which is mainly made of nerve fibers. So here we can see layers of cerebral cortex, layers of cerebral cortex. Okay, so here if I just enlarge it, you can see the molecular layer, the first layer, which is having mainly the horizontal cell of Cajal. We have got small pyramidal cell layer. Then we have also got the granular layer. So we will have the granular layer. Then we will have the this is the sixth layer. Then we will have the again we will have the outer pyramidal, outer granular, inner granular and inner pyramidal layer, and then we will have the polymorphic layer. So here we will have this is the internal band of Belarger. This is the horizontal fibers running. This is the outer band of Belarger. So inner band of Belarger is lying in the layer 5th, and it also contains the large pyramidal cells of Betz. Now here we will have another diagram where we can see the cerebral cortex histology part. So when we are talking about the cerebral cortex histology part, you have to understand the important features. So we know the outermost layer is the molecular layer. Then we have got outer granular layer. Molecular layer is composed of the horizontal cell of Cajal. Granular layer will have ciliate cells and the small pyramidal cells. Outer pyramidal layer will have also few pyramidal medium size, inner granular layer, and then ganglionic or the inner pyramidal layer, which is containing the largest pyramidal cells of Betz, and polyformic layer, which is containing the plexiform layer, which is also having the Martiniti cells and other cells. Now cerebellum. Cerebellum, as you can know, it's a small brain. It is highly folded. The folds of the folias of cerebellum are separated from each other by the presence of transverse fissure. So there is a presence of transverse fissure. Each folium contains a white core matter covered superficially by the gray matter or the cortex. Now, actually in the cerebellum, you have to know that there is 3 layers. So I just want everybody to understand the cells, the name of the cells and the layers. So exactly if I am talking about cerebellum, there are 3 layers. Okay, so here itself I just want everywhere, there is the outermost layer is the molecular layer. Then we have got the middle layer, the Purkinje cell layer, and the inner is the granular layer in the cortex, and then we will have the white matter. So this is exactly the white matter, consists of nerve fibers. 3 layers. So exactly if I am talking about the superficial layer is the molecular layer, and mainly it consists of, mainly the molecular layer will have few nerve fibers, and mainly it contains the cells. It contains stellate cells. Actually it contains the stellate cells, and also the axons of basket cell. It also contains the stellate cell and axons of basket cells. The inner granular layer will contain mainly of the granule cells, and also contains few Golgi cells. The Purkinje layer is just consists of Purkinje flask-sept cells, Purkinje cells. It also contains basket cells. So basically 5 cells are there. As you can see in this diagram, we have got 5 cells in the cerebellum. In the outer superficial molecular layer of the cerebellum cortex, we have got the stellate cells and the basket cells. In the middle layer, we have got just the flask-sept cells, that is the Purkinje cell layer. And very nicely, actually image based question has come so many times in the FMG exam also, where you have where an arrow is marked over the flask cell and asked about the identification of these cells. So these are what? These are Purkinje cells. And we will have the inner granule and Golgi cells. Actually, Among all the cerebellar cells, among all the cerebellum cells of the cortex, granule cells are only the excitatory cells. Excitatory cells. Other cerebellar cortex cells are inhibitory. Okay. So this is the high power view where you can see the molecular layer. Then we can see the Purkinje cell, and the Purkinje cell layer, the deeper is the granular layer, and we can see the white core of the cerebellum. Okay. So flask sept. So so many times image based question has come, and you have to identify this flask sept cells. So Purkinje cells are present in the cerebellum cortex, which is seen in the high power view. Now next is the spinal cord. So exactly in spinal cord, in the transverse section, you will have an H-shaped gray matter. In the center there will be a central canal, and this gray matter will be surrounded by white matter. So exactly, if you will see the spinal cord transverse section, so you will get the figure like this. So exactly, you will have a transverse section, and you will have a central canal. You will have a butterfly shaped or H-shaped structure, that is the gray matter, and here we will have the central canal lined by ependyma. The central canal is lined by ependyma. What is ependyma? It is ciliated columnar epithelium, and which is the anterior part. Anterior part will have a deep anterior fissure, and posteriorly there will be a posterior median septum. So more deeper is the anterior median. How we are going to identify this is the anterior part and this is the posterior part? Because anterior medial fissure will be more like a furrow, and like a septum is the posterior median septum. So then again the gray matter, which is mainly made of the cell bodies. So we'll have an anterior or ventral horn, we'll have a dorsal horn, and we'll have a central canal lined by ependyma. The white matter is mainly made of the nerve fibers, and then outer covering we will have from inside to outside. We will have the pia, then we have the arachnoid, and the outermost meningeal covering will be of the dura mater. Is it okay? So this is the transverse section of the spinal cord. Again, this is an enlarged view showing the central canal of the spinal cord, where you can see the ependyma. So where you can see the ependyma, which is forming the lining epithelium of central canal, which is lined by the ciliated columnar epithelium. This is the cross section of the spinal cord taken from D. Furey's atlas. Are you understanding, dear student, or not? This is the cross section. So here you can see the cross section. Everyone, are you understanding? Any doubt, please ask me. So this is the cross section of the spinal cord or transverse section taken from D. Furey's histology. Basically, this may be from the thoracic region because it is also having lateral horn. So this is the L for the lateral horn. This is A for anterior horn. This is P for the posterior horn. The anterior horn is motor and the posterior horn is sensory. The central canal lined by the ependyma. And the outer part we will have the coverings. We will have the pia, arachnoid, and dura. So from inside to outside there will be pia, arachnoid, and dura as the covering of the spinal cord. And the deep furrow, which will be the anterior aspect, this will be the anterior fissure, and this will be like a septum. This is posterior median septum. This is posterior median septum, and this will be in a anterior median fissure, which will have the anterior spinal artery running in it, in the entire course. So this is about the transverse section of the spinal cord, which has to be known to you. So done with this. The next topic, so we are done with the histology of the neurons. Next important thing which everybody should understand is the histology of GI tract. Is it okay? Can we start with the GI tract? Can we start with the gastrointestinal tract histology? Please let me know. Everyone, please let me know. If you have got any doubt, please let me know. Just a minute, I will just check with the students. If you are having any doubt, please let me know. No. So let's start with the histology. So first structure which I want everybody to understand in the histology part is the tongue. So we'll talk about the tongue. So tongue gross anatomy is already done. Its anterior part is called as, its anterior part is having the papilla. So following types of papillas is there: filiform, foliate, fungi, and circumvallate papilla. So this is the anterior 2/3 of the tongue. And this is the posterior 1/3 of the tongue. So posterior 1/3 of the tongue is having lingual, tonsil, lymphatic aggregation, and the largest papilla is the circumvallate papilla. Now, if the question comes about the lining epithelium of tongue, the answer will be stratified squamous non-keratinized epithelium. But if the question comes about the lining epithelium of filiform papilla, which was asked in the NEET PG exam, this year this question has come for the NEET PG exam, that was the lining epithelium for the filiform papilla. The answer is stratified squamous keratinized epithelium. What will be the answer? The answer is stratified squamous keratinized epithelium. Okay. Now, if I talk about the general plan of GIT, that we will also talk about the general plan of GIT. I think firstly, let me explain the tongue, then we will come to the general plan. So now, as I told you, this is the dorsum of tongue, and it is divided into anterior 2/3 and posterior 1/3 part by sulcus terminalis. So here in the anterior part of the tongue, we will have following types of papillae. So we will have the filiform papilla, which is again a conical projection. The mushroom shape is the fungiform papilla, and the most circumvallate papilla is the larger side, which is having it truncated like this. Like this is the shape. This is the groove, and this groove is having the taste bud. This is the foliate type, which is only rudimentary in human beings. So the circumvallate papillae will be lying anterior to sulcus terminalis. Anterior 2/3 will have the filiform and the fungiform papillae. The shape of filiform papilla is conical. The shape of fungiform papilla is mushroom shape. Inverted truncated appearance. Cylindrical is foliate, and inverted truncated appearance is the shape of circumvallate papilla. Now the characteristic features will be that the filiform papilla is present all over the surface and the most numerous one. Also the fungiform is present in between, and only anterior to sulcus terminalis is circumvallate papilla. Taste bud is present many on the lateral aspect of circumvallate papilla in the trench on the either side of inverted truncated structure, and also the maximum of the taste bud is lying there. We will also discuss the cells of taste bud, and will have Van Ebner's Serous gland. There is no taste buds in the glandular association, and taste buds is absent in filiform papillae. Okay, few taste buds are present in the fungiform papillae, and foliate is rudimentary in human beings, so I am not discussing that. Again, the lining epithelium. If I want to tell the lining epithelium of the tongue, the lining epithelium of tongue is stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. And if I talk about the lining epithelium of filiform papillae, the filiform papillae is having keratinized epithelium. It is very important for you to note down that filiform papillae will have keratinized epithelium. Stratified squamous keratinized epithelium. Now, tongue, as you can see, this is the images of the tongue taken from D. Furey histology book, and you can clearly see the lining epithelium is stratified squamous non-keratinized epithelium. The tongue itself is a muscular organ, so there will have the muscles cut in different sections. Will have the glands associated, will have hair follicles associated, glands will be there, sweat glands and all, and we will have the cut section of erector pylorem muscle, and also the intrinsic muscles of the tongue will cut in the different direction. Now this is a diagram of circumvallate papillae. So actually circumvallate papillae has been asked so many times. It was asked in 2021 MCQ of NEET PG examination. An image based question come from this topic. Circumvallate papilla has got a moat like truncated upper part, inverted truncated upper part, and this is exactly the moat on either side, depressed trench on which on the lateral aspect we will have, if you will see clearly, we will have here, these are the taste buds. So we will have the taste buds on the lateral aspect of this truncated moat on either side of the furrow. This is the taste bud, and maximum number of taste bud in circumvallate papillae. Also the serous, van Ibner's serous ducts and the cut part of the secretory ducts has been shown. And we will have the seromucous glands here. The muscle fibers are cut in various direction has been shown here. Okay, now this is again a anterior 2/3 of the tongue. Will show more of the villi and fungi. As I told you, anterior part of the tongue is having more of villi and fungi papilla. So if we see the villi, it is like this. If they see the fungi, it is like this, mushroom shape. And we will have all our skeleton muscle fibers running in various direction. Along with it, it will have the nerve fibers, it will have the secretory unit of the seromucous gland and the anterior lingual glands. Now, this is a diagram in which we can see the taste buds. So this is showing the spindle shaped structure, that is the taste buds. So this is the taste buds, and here in the taste buds we can see the opening here in the interior. This is the taste pore. We have got three types of cells. We have got the gustatory cells, we have got the sustentacular supporting cells, and we have got a basal cells. So we have got three cells. The maximum number of taste bud is present in circumvallate papilla, lateral trench or the lateral margin. We have got three types of cells. We have got the most numerous gustatory cells, then we have got the supporting sustentacular cells, we have got also the basal cells. We have got microvilli and taste hairs as shown in this diagram projected toward the taste pores. Okay. Now, taste buds. So, as I told you, the taste buds are present in the epithelium of fungiform papilla and circumvallate papilla. And other than that, it is also present in the foliate papilla, which is rudimentary in human beings. It is also present in soft palate and oropharynx, and we will have the lining epithelium of the tongue as stratified squamous non-keratinized epithelium. The taste buds are mainly elongated spindle-shaped cell arranged perpendicular to the surface of epithelium, and the free ends of these taste buds converge over the epithelium in the form of taste pores. In the form of the apical ends, the apical end is the taste pore, and it also bears taste fibers, that is microvilli. Microvilli. Now, there are three types of taste buds, as we have seen in the image also. We have got three types of taste buds. We have got the gustatory taste buds, which is the type 2 cells. We have got the gustatory taste bud, that is the type 2 cells. Lightly stained elongated cells having microvilli at the apical end. Unmyelinated nerve fibers are associated with these cells. So, the first type of the cell is gustatory or the taste cells. The second is the sustentacular type 2 type. So this is the type 2 cells are taste or gustatory cells, please note down, and supporting cells is the type 1 cells, which is associated with unmyelinated nerve fibers, have longer microvilli, and they support the gustatory cells. The basal cells are small pyramidal cells close to the basement membrane, and they give rise to the taste cells and the sustentacular supporting cells. Now, this is a diagram in which you can see the taste buds, which is distributed all over the surface of the dorsum of the tongue, and this is the distribution of the taste. So, we will have following types of taste distribution. Any doubt you can ask me, dears. So, we will have sweet at the tip. So, sweet is at the tip, salt and sour. So, it is on the lateral margin, more on the anterior aspects, more on the lateral aspect, slight posterior is the sour taste. Posterior most we have bitter taste, and over the entire surface of the dorsum of the tongue we have got umami taste, that is of the taste of the Chinese food, that is Ajinomoto taste, bicarbonates. Now, here we can see the filiform papilla. The filiform papilla can be identified by its conical shape, stratified squamous keratinized, parakeratinized epithelium. Will also have the skeleton muscle fibers as shown in this diagram. We will have the fungiform papillae as the mushroom shape. Stratified squamous non-keratinized epithelium, muscle fibers are cut in different direction. We will have the taste buds as seen in the lateral buds. So, we will have the taste buds here. These are the taste buds which is visible here, few of it. And these are the taste buds which are seen in the in the truncated moat on the circumvallate papilla. So the circumvallate papilla has got inverted moat-like appearance, inverted trunk, and it is stratified squamous epithelium. Taste buds are clearly seen in the trench on either side, that is called a circular furrow. Now this is the taste bud and large view, high power view. This is the taste bud and this is the taste pore. So taste buds are there, and stratified squamous epithelium, the circular furrow of the circumvallate papilla has been shown. Which taste bud will have sustentacular cells, which have the gustatory cells and the basal cells. Now let's talk about the GI tract plan. So I would like to tell about the entire gastrointestinal tract. So the first thing which I want to explain you is the general plan of GI tract. So general plan of GI tract, firstly let me show this image. So from inside to outside, the first layer is the mucosa. The first layer is the mucosa, that is the epithelium. So mucosa will have, the first layer is mucosa, then we will have the submucosa, then we will have the muscularis externa, and the outermost is the adventitia or serosa. So mucosa, submucosa, muscularis layer, and the outermost is serosa. Here the mucosa is again, if you will see this luminated structure of the small intestine, of the loop of the GI tract, the mucosa again is made of 3 layers. From inside to outside, the mucosa is having epithelium, which is simple columnar epithelium in the most of the part, lamina propria, muscularis, mucosa. The submucosa, so epithelium is basically most of the places of GI tract is columnar epithelium, like esophagus will have stratified squamous non-keratinized epithelium. The lamina propria, if it is having glands. The muscularis mucosa, the muscle fiber, the submucosa layer will have again the important structures residing. So if I talk about the submucosa layer, it contains fibroelastic connective tissue. The muscularis externa is most cases it will have longitudinal muscle and circular muscle, and the serosa or adventitia. If the covering is having peritoneum covering, then it is serosa. If it is not having peritoneum, then it is the fibroelastic connective tissues outside, that is called as the adventitia layer. Good. So general plan of the GI tract, which I have told you. So from inside to outside, the first layer is the mucosa, which is having following layers. Innermost is the epithelium, then is the lamina propria, and then is the muscularis mucosa. The submucosa layer, the second layer, the muscularis externa, inner circular, outer longitudinal, and the fourth layer is serosa or the adventitia layer. Is the serosa or the adventitia layer. So this is the general plan of GIT, which will help us to understand the entire histology of the GI tract. So let's talk about the general features of histology of the esophagus. So let's talk the first slide, that is histology of the esophagus. So if I talk about the general features, it will be similar to the GI tract. So the first layer will be mucosa. And as I told you, mucosa will have the epithelium. So what will be the epithelium of esophagus? It is stratified squamous non-keratinized epithelium. It will be squamous. It will be stratified squamous non-keratinized. So this is the first layer. Then we will have the lamina propria layer. The lamina propria layer will have, in this category, we will have esophageal. We will have the esophageal cardiac gland proper. We will have esophageal cardiac gland. And then we will have the muscularis mucosa, which is made of a single layer of longitudinal muscle. So there will be single longitudinal muscle layer, no circular muscle core. Now, if you will see this, this is the features of, this is stratified squamous non-keratinized epithelium. Lamina propria is there, muscularis mucosa, esophageal cardiac gland will be in the mucosa layer. It will be in the mucosa layer. If I talk about the histological features of esophagus, here again stratified squamous non-keratinized epithelium, the lumen is also shown. Then we will have the lamina propria, muscularis mucosa, which is containing cardiac gland, but some mucosa will contain the esophageal proper gland, muscularis layer, and the outermost is, most of the part will have the adventitia layer. Okay, so we have already written about the mucosa layer. And this, so exactly, I just want everybody to understand here itself. Yeah, so we have done with the mucosa layer. In the esophagus, if we are talking about the next layer, that is the submucosa. So we have written about the first layer, then the second layer is the submucosa layer. So if I talk about the submucosa layer, it contains esophageal proper gland. And esophageal gland proper is mainly of mucous type, and the third is muscularis externa. And then is the adventitia layer. Actually, here I just want to point on few odd features. So exactly, if we talk about the muscularis externa layer, it will have three, it will be made of, it is divided in three parts. The upper one third of the esophagus will have only skeleton muscle fibers. The middle one third part of the esophagus will have both skeleton and the smooth muscle fibers, and the lower part of the esophagus will have only smooth muscle fibers. The adventitia is having the similar pattern as the GI tract. The esophageal gland submucosal layer is containing many fibroelastic connective tissue, and it is regarded as the strongest layer of the esophagus. So submucosal layer is having fibroelastic connective tissue, and it is regarded as the strongest layer of the esophagus. So now, basically at the previous year of examination also this question has been asked, where the strongest layer of esophagus has been asked. And just now I told you which will be the strongest layer of esophagus, whether it is mucosa, whether it is submucosa, whether it is muscularis externa or serosa. So yes, students who are live, they can give the answer, and just now I told you the right answer will be submucosa because it contains dense fibroelastic connective tissue, esophageal gland proper, and this is the strongest layer of the esophagus. This is the strongest layer of the esophagus. Done. Now let's move on to the next slide, that is the stomach. So if I am talking about the stomach, actually general features will be similar, that it will have mucosa, it will have the some mucosa and all, but so that four layers will be similar, four layers. It will have the four layers. Okay, so it will have the first layer as the mucosa, it will have the submucosa, it will have the muscularis externa, and it will have the serosa layer. So here if I are talking about the mucosa layer, it is again made of three layers. So it is again made of epithelium, it is again made of lamina propria and muscularis mucosae. So here the epithelium is simple columnar epithelium. So if I talk about epithelium, it is a simple columnar epithelium. The lamina propria is having the gastric glands, and the muscularis mucosae, if I am talking about the muscularis mucosae, it is actually similar to the GI tract, it is made of smooth muscle. The submucosa, if I talk about the submucosa, it is also similar to GI tract. And if I talk about muscularis externa, one of an important feature which is different in the stomach as compared to other muscularis externa is that in the other layer of GI tract, it is inner circular and outer longitudinal, but in case of muscularis externa of the stomach, we have got three layers. So here it is composed of inner oblique, here it is composed of inner oblique, middle circular and outer longitudinal. And the outer is the serosa, which is having the peritoneum covering. So basically this is the general plan of the stomach histology part. But what we have to understand is the glands. We have to know about the gastric glands and all the cells which is contained in this gland. So let's talk about. So basically if I am talking about, so I just want to show you the image. So here in the stomach we have got the gastric pit and we have got the lamina propria. So we have also got the fundus. So this is the fundus part of the stomach, and when you will see the histological aspect, the fundus part of the stomach will appear beaded appearance, and the reason of beaded appearance is the presence of chief and parietal cells. So basically fundus part of the stomach is having the chief and parietal cell. The histological features of the chief and parietal cells I will tell. Then we will have muscularis mucosa, the submucosa, the circular muscle, longitudinal muscle, and outer serosa layer. So in the case of, so basically you have to understand that when we are talking about the fundus part, the fundus, the stomach, a fundus part, it is having shallow gastric pit. It is having shallow gastric pits. So it will have shallow gastric pits. One of an important point is it will have shallow gastric pits. But in case of pylorus part, it will have a deep gastric pit, and it will have a beaded appearance due to the presence of the fundus gland, fundic gland, which contains the parietal and the chief cells. This is why, because the fundus gland is beaded because of the presence of parietal and chief cells. Now seeing the slide of the pyloric part, of the here you can see the gastric gland, gastric pit is deep. So this will be deep. Columnar epithelium is the similar part. Pyloric gland, no parietal and oxantic cells. Muscularis externa is there. So these are principal difference which is seen in the slides of the low power of the pylorus and the fundus part. Then we will come to the cells. I will come to that. Before that, I just want that you should be aware of few of the cells of the gastric gland. So it is very important that you should be able to understand the gastric gland cells. So let's talk about that. So it's very important that you should know about the cells. So it's very important that the cells should be known to you. Okay. So for that, I just want you to show the diagram. Okay, so let's see the diagram of the stomach, where you can have the fundus part and you can see the cells. Okay, so that is very, very important. Okay, let's talk about this. So exactly here we can see the glands. Okay, so we have got two histological image where I just want everybody, so we'll come to this, but I just want everybody to first go through the fundus and the body parts. So which I have explained as I am telling you, the lining epithelium of the stomach is simple columnar epithelium. Now in the case of fundus part, I told you the fundus part, the pits are shallow. Okay, and we will have the fundic glands in the lamina propria, and we have to know the cells which is lying in the fundus part. So exactly the fundic gland is, if I am talking about the fundus of the stomach, it is consist of mucous neck cells. So it is having the mucous neck cell. It is having the mucous neck cell. The mucous neck cell is located in the neck region, and it is secreting the acid mucus. It is secreting mucus, and it is in the low columnar cells. It is low columnar cells in the region of the neck. The parietal or oxantic cell, it is mainly large pyramidal. The parietal and oxantic cells are large, and it is the pyramidal cells. It's a large pyramidal cells found in the upper half of the gland. The cells can be easily identified by the acidophilic cytoplasm. So there is an acidophilic cytoplasm, and these cells secretes HCl. What does this secrete? These are secreting HCl and gastric intrinsic factors, which is necessary for the absorption of vitamin B12 in the ileum part, which is important for erythropoiesis. Okay, so till now we have seen two cells. One is the mucous neck cell, which is important for mucus secretion in the neck region. The second is the parietal oxantic cell, which is actually present in the upper half of the gland, and it is having acidophilic cytoplasm. It secretes HCl and gastric intrinsic factor, which is required for vitamin B12 absorption. Then we will have the chief and zymogen cells. If we are talking of chief zymogen cell, it is found in the deeper part of the gland, and they are identified by the presence of basophilic cytoplasm. So if we are talking about the parietal cell, they are acidophilic, but they are basophilic, and these are secreting pepsinogen, which is converted into active pepsin in the environment, and they also secretes lipase and amylase. The other one is enteroendocrine cells. Enteroendocrine cells are also formed in the basal part of the gland, and they are also identified by the presence of secretory granules in the basal part. They belong to APUD cell series, amine precursor reuptake decarboxylase. They secretes enteroglucagon and amines. What is the function? They are secreting enteroglucagons and amines. Okay, so we will have the following. Will have the enteroendocrine cells, we will have the parietal cells, we will have the chief and zymogen cells. Chief zymogen cells are basophilic, found in the deeper part, the parietal oxyntic cells in the upper half, and mucous neck cell in the neck region. So again, I just wanted to show this. So this is high power view of the fundic gland. And here the larger one, if you will see the larger and brightly stained, this is giving the beaded appearance. So when you see the histology part of the stomach, you can see the parietal cell which is giving the beaded appearance because of the presence of large parietal cells, and in between we will have the chief zymogen cells which is basophilic. So which will be the basophilic, and chief zymogen cells is more towards the lower aspect in the fundic gland. But if we are seeing the beaded parietal cells, it is more into the upper part. Also, we will have in the neck region the mucous neck cells. This is again another diagram which is showing the fundus and the body part, where you can see the parietal cells, which is very clearly seen as a beaded appearance. The mucous neck cell in the upper part neck region, the chief cells, which is the basophilic, these are small cuboidal like cells, chief zymogen cells, and enteroendocrine cells or to the basal aspect. Now talking to the pyloric, so this is the fundic gland showing the different part of the cells. We have got mucous neck cells in this diagram. This is the gastric pit. This is the gastric gland. This is the neck region, mucous neck cells. This is the parietal cell, the prominent acidophilic and the bigger in size as compared to the zymogen cells. Chief zymogen cells towards the basal aspect, along with the enteroendocrine cells. Enteroendocrine cells, that is belonging to APUD cell series. The pylorus part of the stomach. So if I am talking about the pylorus part of the stomach, it is marked by the presence of gastric pits which is lined by simple columnar epithelium. So if I am talking about the pylorus part, this is having a deep gastric pits. So these are having deep gastric pits, and these are lined by simple columnar epithelium, and the pylorus gland is having pyloric gland in the lamina propria, and the middle circular layer of the pylorus gland will form a anatomical pyloric sphincter. So in the pylorus gland, we will have just the pyloric gland, no beaded appearance, no chief cells, no parietal cells. Pyloric gland is there, and the pits are very deep. If you will see the pits, which is very deep in case of pylorus gland, simple columnar epithelium, also lymphatic nodule has been shown. So basically, have this comparative table which is showing you the comparison between the fundus and the pyloric part of the stomach. So this is the fundus, fundic gland, and this is the pyloric gland. So basically, the fundic gland is present in the fundus and the body, pyloric gland in the pylorus part. It is of simple tubular type. The fundic gland is simple tubular type. Simple coil type is the pyloric gland. The glands open in the pits, and only 3 to 7 glands, but 3 to 4 glands opens in the pit in the pyloric. Ratio of the depth of the pit and gland is 1 to 3, but the pit is more deeper in case of pylorus gland. 3 parts: neck, isthmus base, only base, neck may be present, and there are cells in the gland which is missing in the pyloric. The cells which is lying in the fundic gland is parietal, chief, mucous, and APUD cells, enteroendocrine cells. Now, I just want everybody, chief cells are found in which of the following? So please mark the right answer. Very easy question has been asked in the previous year of examination. Chief cells are present in which part of the stomach? Neck, pit, body, fundus. Chief cells are found in which part of the stomach? Chief cells. Chief zymogen. So we already know it is found in the fundus part of the stomach. Now let's talk about the other GI structure. So vermiform appendix. So Now, in the systemic histology, I will brief about important histological aspects, because if we go into details of each and every aspect, it will take much more hours. So, I just want to finish the important aspects. So, let's continue with this. So, vermiform appendix. When we are talking about vermiform appendix, small angular lumen, and this correspond to the thick wall. So, vermiform appendix is a small tubular structures having thick wall, no villi. So, appendix is not having any kind of villi. No villi is there. Few short crypts are there. Ring of lymphoid follicles are there with germinal centers. So, ring of lymphoid follicles are there with germinal centers in the lamina propria. And the other feature which is seen in the case of appendix is it is having disrupted muscularis mucosae. What is having? It is having disrupted muscularis mucosa. It is having disrupted muscularis mucosa. That means vermiform appendix features can be enumerated. So it is a tubular structure. So the lumen will be there. Lining epithelium is columnar epithelium. Lymphatic follicles and with germinal centers in the middle, located in the lamina propria layer. Ring of lymphoid tissues. Disrupted muscularis mucosa. Now here I just want you to show the histological features of the appendix. When you will see the histological features of appendix, you can clearly see the lumen. You can see the lining epithelium which also have the goblet cells. The lining epithelium is columnar epithelium. The lining epithelium is the columnar epithelium. We will have the muscularis mucosa. We will have the submucosa layer, and we will have the muscular layer outside, inner circular, outer longitudinal, and we will have the serosa. Why? Because the we will have the serosa as the outermost layer. Why? Because it is having mesoappendix in the outermost layer. It is having mesoappendix, the layer of peritoneum covering it. Disrupted muscularis mucosa is there, and lymphoid follicles. So we can see around the lumen there is a ring of lymphoid follicles. There is a ring of lymphoid follicles which is seen around the lumen, and also in the center there is GC, which is a lighter stain. Why? Because it is containing the immature lymphocytes. Now liver. Next slide is of the liver. So dear students, are you understanding? Please let me know. Now next slide is of the liver. So liver is a very important structure. Actually, it's a structure is the heaviest organ. It's a heavy organ which is approximately 1.2 to 1.4 kg with a range, and it is located in the right hypochondriac epigastric, and part of it is extending to the left hypochondriac region. It is covered by fibrous capsule. It is covered by Gilliason's capsule and peritoneum covering, which is mesothelium. And we have to know actually from this Gilliason's capsules, the interior of the liver is divided into regions which sends trabecules inside and divide the parenchyma into incomplete lobules. The trabeculae, what does the structures passes to the trabeculae? So the trabeculae, the branches of hepatic artery portal when hepatic duct traverses. So that area is called as portal triad or portal space or portal canal. So please note down, this is important. We have got a Gilliason's capsules that is lying. The outermost covering will be of the peritoneum. Beneath the peritoneum, we have got the capsule, Gilliason's capsules, from which trabecules will extend inside and will divide into the liver into lobules, incomplete lobules. Okay. Now, in the lobules, we will have the structures traversing. We will have the hepatic artery, portal vein, hepatic duct, and lymphatics. And this structure is called as the portal triad. This structure is called as the portal space, portal canal, or portal triad. Okay. Now, let's talk about the histology of the liver. So the liver lobule has got a classical, more if we will see the histological aspect of a pig liver, a classical hexagonal shape will be there. In that case, we will have a classical hexagonal shape. But in main, exactly hexagonal shape is not there, but will be somewhat like that, which is called as the liver lobule, form the structural, functional and structural unit of the liver. Now, we will have a central vein in the center of this hexagonal lobe. So, we will have a central vein in the hexagonal shape of the lobule. We will have imaginary lines connecting the portal triads, and this will also have at the corners hepatic cells will be there. Hepatocyte cells of hepatocytes will be there, and we will have central vein in the center. So exactly the main structural functional unit of liver is hepatocyte. What is the main structural and functional unit of the liver? It is characterized as hepatocyte, which are arranged in one cell thick. So it is what is the arrangement? The arrangement is in the form of thick plate of the cell. So through the central vein of the which is lying in the center of the hexagonal liver lobule, we will have the central vein. From that, plates of hepatocytes will be radiating. So plates of hepatocytes will be radiating towards the periphery of the lobule, Now you can see this is exactly the histology of the liver, which I want to appreciate to you. So here you can see this is the central canal. This is the central canal. And as you can see in this diagram, approximately this is the hexagonal shape. Here the central vein is the center, and you can see what is this? This is the what we are seeing here in the cords. You can see cylindrical cords like structures which is running. What are that? That is the hepatic cells. They are hepatocytes. So these are the hepatocytes, which is plates of hepatic cells. So in other words, you can use the word plates of hepatic cells. And this is the porta. This is the portal area. Why? What lies in the portal area? So we can see in the portal area we will have the bile duct, hepatic artery, and portal vein. So it's an hexagonal shaped structure. At the corners of the hexagonal structure, we will have a portal tract which contains the portal vein, hepatic artery, and bile duct. And in the central, there is central veins and radiating cords of hepatocyte cells. Now here we can see the liver. Again, we can see the liver. So this is the central vein, and this structure, as you can see, is this structure is the central vein. This is one hepatic lobule. So here in this hepatic triad, we have got the portal vein, the branch of hepatic artery, and the hepatic ductules. In the center, we have got the central vein. This is CV, the central vein. And in between the hepatic cells, plates of hepatocytes. So we will have radiating plates of hepatocytes, which is radiating from the center. So if I talk about these are the radiating hepatocytes which is running, plates of hepatocytes which is running, and this plates of hepatocytes are running, and in between we will have the sinusoids. So again, this is an enlarged view. So what I want you to show, this is an enlarged view. So here what happens, this is an enlarged view. This is again the central vein. This is the plates of hepatocytes. So what is this? This is the plates of hepatocytes which is radiating from the central vein towards the periphery. This is the hepatic plates. These are all hepatic plates, as you can see, with the nucleus in the center. The sinusoids, actually what happens, some of endothelial cells some of the endothelial cells get modified to form Kupffer cells, phagocytic cells, and which will phagocytize the worn out RBCs. So I just want to write one of the important point here. So the space between hepatic plates of cells are occupied by liver sinusoids. These are the space occupied by liver sinusoids and lined by discontinuous. This is lined by discontinuous fenestrated endothelial cells. So some of the endothelial cells will become, if I talk about some of the endothelial cells which will behave as the Kupffer cells and will phagocytize the old out and worn out RBC. So some of these cells, so that means Kupffer cells are in association with that of liver, and they will phagocytize the worn out RBC. So here also we can see another image where we can see the central vein. We can see the plates of hepatocytes radiating. The sinusoids, the endothelium. Now, this is the high power view of the central vein. We have clearly seen the endothelial cells, some of which becomes the Kupffer cells. We can see the hepatic plates of the cells, and in between the space is the fenestrated discontinuous capillaries, that is called as sinusoids. Done. That means if we have to identify, that means what will be the identifying features of the histology of liver? If I have to take the identifying features of histology of liver, it will have a polygonal hepatic lobule. So there will be a presence of polygonal hepatic lobules. There will be also the presence of central vein. There will be portal triad at that hexagonal ends, which contains the portal vein, the bile duct and hepatic artery. Radiating hepatic cords of cells will be there, and in between the radiating hepatic cords of the cells there will be sinusoid. So these are four features which is present to identify that this is the histological features of the liver. Now I would also like to tell you about two important space which has been asked number of times in the examination. Two spaces I will explain. One is the periportal space of, one is the perisinusoidal space of Dice, and the other space is space of Moll in context of the liver. And I will also tell you about the other important aspect, that is about the different functional unit of the hepatic lobes. We will also talk about that. So just a minute. So if I am talking about a perisinusoidal space of Dice, so many times this MCQ has come in the previous year of examination. That is, what is perisinusoidal space or space of Dice? What do you mean by the term perisinusoidal space or space of Dice? So it is a space exactly which is located between the hepatocytes and the sinusoids. So this perisinusoidal space location is between the hepatocytes, that is plates of the cells, that is the hepatocytes, and the liver sinusoid, which is having discontinuous, which is a fenestrated discontinuous type of capillary, which is having the discontinuity not only in the endothelium layer but also in the basement membrane. It contains, what does the perisinusoidal space of Dice contains? It's a very important question, has been asked so many times in the previous year. It contains blood plasma, it contains microvilli of the hepatocyte cells extending into the space, and it also contains the ito cells. So what all it contains? It contains ito cells, it contains microvilli of the hepatocytes. Okay, it contains blood plasma. So it contains ito cells, blood plasma, and microvilli of hepatocytes. So exactly the function of perisinusoidal space of Dice containing ito cells are, or which is also called as lipocytes. What is the function of it has been asked? So it stores vitamin A in the characteristic form of lipid droplets. So what does it do? It store vitamins A in the characteristic form of lipid droplets. So again, so here there is another image where I want you to show the space of Dice. So this is perisinusoidal space of Dice. What is it? So around the sinusoid we have got the space of Dice, perisinusoidal space of Dice, which is very importantly containing ito cells, the hepatocytes, microvilli, and blood plasma. The other space which I want everybody to understand, that is the space of Moll. What is it? Space of Moll. So the space of Moll is called as, the other classification which is given to it is called as a periportal space of Moll. What is it called as? It is called as periportal space of Moll. So two different spaces are it. Both are in relation to which structure? Liver, has been asked in the previous year of examination. So periportal space or periportal space of Moll is exactly the space which is located within the stroma or portal canal and the outermost hepatocytes. So that means in between the stroma of in between the stroma of the portal canal and the outermost hepatocytes, we will have the space, and lymph originates in this liver. What does originates and what is this importance? It is the one of the space where from which the lymph originates in the liver. It is around the portal canal. So this space is around the periportal space, is the space around the portal canal. Okay. Now we are already talked about hepatic lobule. I want you to give the definition of portal lobule and hepatic SNS. It's very important that you should be aware of these important functional classification of the liver lobes. So we have already done about the liver lobule. Now I want you to know about portal lobule. What is portal lobule? So understand the pathological condition related to the liver. The functionally we divide the liver in the portal lobules. How we are dividing the liver into portal lobules? The portal lobule is a triangular shape and can be visualized. How we are going to define the portal lobule? It can be defined by drawing an imaginary lines, and this imaginary line is connecting with structure? Central vein of 3 adjacent liver lobules. That means for understanding the boundary of the portal lobule, we have to connect the adjacent part of the central vein. So that means 3 adjacent liver lobule will be connected with the central vein, and this will have the portal triads in the center, which is called as the portal lobule. So let's see this portal lobule image. So this is an image where you can see. So here we have got one liver lobule, we have got the another, and this is. So this is one, this is second, and this is the third liver lobule. So exactly how you are going to understand. So connecting the central vein of these 3 liver lobule, we get a portal lobule. We get a portal lobule, which is the important for understanding the pathology related to the liver. So it is the functional unit of the liver called as portal lobule, which connects the central vein of 3 adjacent hepatic lobule. Now coming to the next, that is the hepatic sinus. So what is the definition of hepatic sinus? So another functional unit which you have to know is the hepatic sinus. It is actually aerated by, if I am talking about the area of hepatic sinus, it is the functional unit of liver which is aerated by the branch of portal vein and hepatic artery. So it is diamond shaped. It is diamond shaped, and it is located in between 2 classical liver lobules between the central vein. So in this case, we will take the 2 classical liver lobule with the central vein. Corners of the diamond shape is formed by central vein and the portal triads, which is distributing the vessels in the center. In relation to the proximity, we can know which part of the hepatic sinus will be first to be infected. So zone 1 is the first to be affected by the incoming or the outgoing blood, and vice versa. So we can have, this is hepatic sinus, we can take adjacent liver lobule, this is one liver lobule, this is another liver lobule, and a diamond shaped structure connecting, as you can see, it is connecting the central vein of one hepatic lobule with the other, and on other side we can have the portal triad. So that means if we have to know about hepatic SNS, it is a diamond shaped structure which is connecting the central vein of 2 hepatic lobule with portal triad on the either side. So it was approximately diamond shaped structure. Again we can describe as its zone 1, zone 2 and zone 3. So zone 1 is the first area to be affected in the pathological conditions or the blood flowing pathology, incoming and outgoing blood flowing through this region. So actually structural unit will be the hepatic lobule. To understanding the pathology of the liver, again the liver is divided into hepatic SNS and portal lobule, and I hope you are quite aware of the definition of portal lobule and that of hepatic SNS, which is quite clear by this diagram. Okay, so this is one hepatic lobule. This is one hepatic lobule which is exactly hexagonal in shape, which is the structural unit of the liver. And we have studied the histology by taking the consideration of hepatic lobule. But for understanding the other important aspect, we have divided the liver into functional unit. One is the portal lobule and the other is hepatic SNS. So these 3 lobules and SNS has definition should be known to you. So we have done with this. Now the next slide is the pancreas. So in brief, we are also knowing about the pancreas. We have also done with the pancreas, and we also know the pancreas is a both exo and endocrine gland. It is both exo and endocrine glands. Pancreas is a why I will tell you, its exocrine part of the pancreas is similar to the serous part of the salivary gland, and its endocrine part is similar to the islets of Langerhans. So that means pancreas is having 2 parts, the exocrine part and the endocrine part, and you have to know the details of both the part. When I was taking the class of glands, I have already told you the difference between the exocrine part of pancreas and the parotid gland exocrine part. Now, general features, as you have to know about pancreas, it is it is having different parts. It is having the head, it is having the neck, it is having the body and the tail. The tail is located in the linorenal ligament in the hilum or spleen extending. The head of pancreas is in the C-shaped concavity of the duodenum. That is already done. So if I talk about the pancreas, exocrine part, if I talk about the exocrine part, it is formed by serous SNM. And the endocrine part is formed by islets of Langerhans. So basically, it is very important to know the features of exocrine and the features of endocrine part of pancreas. So I one by one I will tell you about each of its parts, and then I will tell you about the cells. Okay. Okay. So if I talk about the exocrine part of the so let me just so if I am talking about the exocrine part of the pancreas is having serous acini. So if we compare the serous acini of the exocrine part of pancreas, it is different from the parotid duct exocrine part. What is the difference you have to know? So please see this. So this is exactly the pancreas histological image in which you can see the exocrine part has been shown. So basically, if you will see, the pancreatic acinus is the exocrine part, and this lighter structure, can you see, this is one, this is one, and this is one. What is this? This is the islets of Langerhans. So basically there will be islets of Langerhans, which is the endocrine part of pancreas, which will be seen, and we will have the exocrine part, which is having the serous acini. Now there are certain differences which is lying between the serous acini of the pancreas and that of serous acini of parotid duct. If I am talking about the serous acini of the pancreas, it will have less number of ducts as compared to the serous acini of parotid duct. Also, the striated duct will be not present in the pancreas, but striated duct will be present in the parotid gland. That is one difference. The other difference is, if you will see the serous acini along with islets of Langerhans, that becomes a slide of pancreas. Now, here actually other important point, this is an enlarged view where you can see the islets of Langerhans. So it is lighter stain, and in this islets of Langerhans we will have alpha cells, we will have beta cells, we will have delta cells, and it is important to know which all structures are secreted by it. In between we will have the intercalated duct. Actually, intercalated duct is present in the case of pancreas, but it is in the form of centroacinar cells. So centroacinar cells are only present in the case, centroacinar cells are only present in the case of pancreas, which is absent in the case of exocrine part of parotid gland. That is important for you to understand. So actually I would like to give you the understanding of centroacinar cell. What do you mean by centroacinar cell? So when I am using the word centroacinar cells, when I am using the word centroacinar cells, that means the initial part of the duct, that means the initial part of the duct of pancreas is regarded as centroacinar cell. That is actually the duct. As you can see, this is the centroacinar cell. This is the duct of the exocrine pancreas, which is arising from the interior of the circular structure, that is acinus. That means generally when you will see the duct of serous acini, as in case of parotid gland, the initial part of the duct is intercalated. But in the case of exocrine pancreas, the initial part of duct is incorporating from the inside of acinus. Means inner aspect of the acinus only the duct start, and that looks like a big spherical football is there, and a straw or has been pinched inside, and that straw in part which has entered inside that ball is the centroacinar cell. So this is the most initial part of the exocrine pancreatic duct. Now here I just want you to show the structure of exocrine pancreas, the centroacinar cells. So you can clearly see here the islets of Langerhans. Okay, so centroacinar cells has been shown, the islets of Langerhans has been cell, and adjoining area we have got rough endoplasmic reticulum and secretory vesicles. So centroacinar cells are characteristically present in the exocrine pancreas only. Now the duct of exocrine pancreas, you can see the centroacinar cell is there, which is arising from the interior of acinus, then intercalated duct, then interlobar duct, and then the main excretory duct. Here another important point of exocrine pancreas are they are devoid of striated duct. They are devoid of striated. What do you mean by the word they are devoid of striated duct? Striated duct is a characteristic feature of identification. If I am talking of striated duct, this is a characteristic feature of identification for the parotid gland and all, but it is absent in case of exocrine pancreas. And also the ducts. The ducts are, if you will see the field of vision, under the microscope of pancreas histological image, what you can see, there is paucity of this punched out lumen of ducts. So duct will be less in number in the exocrine pancreas as you compare it with that of the as you compare it with the parotid gland. Now the duct system, again you can see the centroacinar cell arising from the inside of the acini, intercalated duct, interlobar duct, and then comes the main pancreatic duct, which is having the serous secretion. Now here we can see the duct system of the pancreas, same, the centroacinar cells, the interlobular ducts, the intercalated interlobular ducts, then we have got the main pancreatic duct. Now endocrine pancreas, if I have to talk about the endocrine pancreas, what I told you, the endocrine pancreas is made of islets of Langerhans. So it is mainly made of islets of Langerhans. So we will have following. So it will secrete following structure. It will have the alpha cells. So it is having the alpha cells. And if I talk about the alpha cells, can anybody tell me what does the alpha cell secretes? Any idea? Alpha cells? What does the alpha cell secrete? So it is actually of all the cells of the islets of Langerhans, alpha cell is forming the 20% of the population, and it secretes mainly glucagon. What does it secrete? It secretes mainly glucagon. Now the next is the, so here you can see the endocrine pancreas having the alpha cells, which is mainly secreting the glucagon. We have got the beta cells, which secretes the insulin. We have got also the other cells like delta cells and all. So here also you can see. So basically let me write, then I will come to the this view, that is the paranomic view and all. What else cells it secretes? So what about the beta cell? What does the beta cell secrete? So here itself you can write the beta cell secretes. It is containing 70% population of the cells of endocrine part, and beta cell secretes insulin. Other than that, we have also got the other cells, which is not the delta cells, and the delta cells of the pancreas are secreting somatostatin. And also, so we have got basically the alpha cells, we have got the second one, the beta cells, we have got the third one, the delta cells, and the fourth one is, if I talk about the fourth one, it is the F cells or PP cells, which secrete polypeptides. Which secretes the polypeptides. Got it? So now I would like to show you the whole of the histological features of the pancreas in one slide. For that, I am just enlarging this image so that the entire histological aspects can be seen. So we can clearly see here the islets of Langerhans, that is the pancreatic islets of Langerhans, and surrounding we have got the serous acini, which is having the zymogen cells. So what is it? It is having the serous acini, zymogen cell, the pancreatic islet cell, which will be lighter stain as compared to serous acini. Duct will be less in number, so few ducts are there, but centroacinar cells are there, and few ducts will be there, but it will be less. Islets of pancreatic islets of endocrine part of pancreas will have alpha cell secreting glucagon, which is 20% of the cell population. 70% of the cell population in the islets of Langerhans will be that of the beta cell secreting insulin. The other are the delta cells secreting the somatostatin, and polypeptide secreted by the F cells or PP cells. The exocrine part will have the centroacinar cell, which is absent in case of the parotid gland, and also will have the striated cell absent in the case of the exocrine pancreas. So basically it is very important that you should know the differentiating features of the exocrine pancreas and that of the parotid gland. Now let's talk about the histology of small intestine. So we have finished with the important many important structures of the GI tract. Now in short I would like to tell about, so basically if I talk about the objective of this session, basically I am going to tell you about the small intestine general features. I would like to tell you about the details of the histology of duodenum, jejunum and ileum, and also I will tell you about the cells of small intestine. So when I am talking about the cells of small intestine, Students, are you get over exhausted? Anyone? I think everyone is exhausted. Please let me finish with the small intestine, whole of the GI tract. Then I will give you 5 minutes break, and then I will quickly cover the endocrine and the respiratory part. So that is next which I want to complete. Everyone, is it okay? Okay. So small intestine is actually a convoluted tubule. We have got a duodenum, we have got a jejunum and ileum. So small intestine has got three parts. So we will know about the individual characteristic features of duodenum, jejunum and ileum. So when I am talking about small intestine, it is 5 to 7 meters long. And for descriptive purpose, we have to know the differentiating features in the histology of duodenum, jejunum and ileum. Now, the main function of small intestine is the digestion of gastric content, absorption of the nutrients in the blood capillaries and the lymphatic lacticles. This is the most important. And the absorption is increased by the presence of more of microvilli, which is increasing 20 folds more the absorption. And so increase largely the absorption. Surface modification of small intestine, which is important for you to know. We already have seen that the surface modification which is present in small intestine to increase the absorption of the nutrients and the fluids is via formation of pilique circularis. My dear, what is pilique circularis? So this question has been asked in the previous year of examination. Pilique circularis is also called as valve of Kirkering. What is the other name? It is also called as valve of Kirkering. It is present in the mucosal lining of the interior of the walls of small intestine. It is also having villi and microvilli. So microvilli will increase the absorption, and the regular arrangement of microvilli along with the glycocalyx layer is found in the small intestine, which increase the absorption. Villi will be longer in duodenum, will be longest in duodenum, then jejunum and then the ileum, which is also increasing the absorption. So for increasing the absorption, the modification which is present in small intestine is microvilli, villi and the pilique circularis, which is a mucosal fold in the interior of the small intestine tube, which is maximum present. Pilique circularis is maximum present in the jejunum. Pilique circularis, as I told you, is a circular fold which is called as, also it is termed as valve of Kirkering, pilique circularis or valvulae convitans. It is a large valvular flaps which is seen as a projection in the interior of the lumen of small intestine. So if you will see this image, you can see there is projections here. So there is valvular projection, mucosal lines and valvular projections has been seen. These are increasing the absorption in the case of jejunum loops. Pilique circularis are permanent spiral elevation mucosal fold which is submucosal core, and it is lying in the interior of the intestinal lumen. It is more prominent. If I talk about the prominence of this pilique circularis, which is a valve of Kirkering, it is more prominent in the proximal part of small intestine, where absorption has to take place, and it decreases more in the ileum part. Now the next modification is villi. Next modification is villi. When I am talking about the villi, it is a permanent finger-like projection of lamina propria which is seen, and villi is lined by, so the lining epithelium of, if I talk about the lining epithelium of intestine, it is simple columnar epithelium. I am not telling about the general GI tract because we have already talked about the general GI tract. And villi will be longer in duodenum, increasing, and there will be lacticles in the central core of this villi. The height of villi decreases as you go more distally in the small intestine. That ileum will have the shortest villi as compared to duodenum. In the center core there is a lymphatic capillary which is called as lacticle, which is shown here. Here we can see the lacticle in the center core of the villi, and these are the surface projection, the villi. The villi has a core of lamina propria filled with blood vessels. So it is having blood vessels. It will have the loose irregular connective tissue. It will have the nerves. It has the capillaries, and inside we will have the lacticles, which is going inside the core of the villi. Lining epithelium is simple columnar epithelium. Now here the lamina propria is storehouse of the cells like mast cells, macrophages, eosinophilic lymphocyte. Smooth muscle fibers extends into the muscularis mucosa and it is responsible for the movements of the villi. So we will have the muscles, muscularis mucosa muscle, which is important for the movements of the villi containing lacticals and capillary network. Microvilli. So yes, dear students, please don't get please be connected for another 1 hour work, because after the GI tract, just quickly we will cover up the respiratory, endocrine, two more system, I think. Only the endocrine and respiratory, and slight points about the urinary system which I have to complete. Okay, so I take another 1 hour I will take. Okay, then we will be finished with the whole of histology, whole of the histology. Microvilli, cytoplasmic projection covering the apical intestinal absorptive cells. And if we see the microvilli which is present in small intestine, it is actually the striated. Can you see the microvilli is having a regular arrangement and it is called a striated border in case of small intestine. So, if you will see the electron microscopic view, if you are going to see the electron microscopic view of the small intestine, you can see the microvilli is having another glycoprotein coat or glycocalyx lying there, which also contains enzyme, that is lactase, it contains sucrase, it contains lipase, and these are important for the digestion. So the function of glycocalyx layer is, it is concentrating the ions before absorption. It is concentrating the ions before absorption, and we can see the glycocalyx layer in this electron microscopic view. Now let's talk about the cells of small intestine. The different types of cells in small intestine is, it is having absorptive cell, which is the most common types of the cells in the intestinal epithelium. It is also having the tall columnar cells, brush border cells of microvilli. It is having glycocalyx layer. It is having this absorptive cells. It is having this goblet cells. So here you can see the goblet cells are present. If I talk about the cells of a small intestine, goblet cells are present in between the absorptive cells of the intestinal epithelium. It increases towards the distal region, and if I see the crypts of enterocytes, if we see the crypts of small intestine, Paneth cells is lying in the basal aspect, which secretes the lysozyme. Goblet cells are present in between the columnar cells. Stem cells is giving rise to another forms of the cells. Undifferentiated cells located in the basal aspect, the function is to the stem cell to burn out different cells and give, it's acting as a stem cell and give rise to other forms of the cell. Paneth cells is located toward the basal aspect of the intestinal gland, and it is presents eosinophilic granules in their cytoplasm. The M cells are present is covering the lymphatic nodules and Pierce patches. M cells are phagocytizing the luminal antigens. And we have got enteroendocrine cells. We already know that enteroendocrine cells, which we have also seen in the fundus part of the stomach, it is similar to the APUD system, that is amine precursor uptake recarboxylase cells. Now, so we have done with the usual features of the small intestine. Now just give the differentiating feature of the jejunum, duodenum and ileum. So when I talk about duodenum, so many times the image based question has come for the identification of duodenum. The other features are similar, that it will have the simple columnar epithelium. It will have the mucosa, submucosa, muscularis externa and that of adventitia. So it is having a Brunner's gland. The most important features in case of duodenum will be, it is having Brunner's gland in the submucosal layer. Can you see the features of Brunner's gland? So Brunner's gland is only present in duodenum. It is not present in any other part of small intestine. Brunner's gland are present in the submucosal layer of the duodenum, which is characteristic feature. So Brunner glands are branched tubuloacinar glands, and they discharge their products at the base of intestinal glands. Now, if I talk about, so this was about duodenum, and if I talk about ileum, what is the most characteristic feature of ileum? So the ileum is having Pierce patches. So other features are similar. The distal most part, if I am talking about the distal most part of the small intestine, that is the ileum. The ileum will have maximum number of lymphatic nodule, and that is called as Pierce patches. So this is the Pierce patches and this is the Pierce patches as lymphatic aggregation, which is having germinal centers in the center, and this is maximum in the case of villi. So a cell having villi and Pierce patches will be the cell of will be the slide of histological slide of ileum. So this is having lymphatic nodule in the lamina propria, and the lymphatic nodule collection Pierce patches of the ileum will be traversing towards the submucosal layer of the ileum. Now, duodenum histological slide, the basic features of the goblet cells, the mucosa, submucosa, and the cells, like we will have nerve plexus in the submucosa layer, which is called as Misner nerve plexus. We will have the Meinrich nerve plexus in the muscular layer, which was asked in this NEET PG exam, that which nerve plexus is lying between the different layer of muscularis externa. So in between the circular and longitudinal muscle layer, we have got Meinrich Ioback nerve plexus in the case of the small intestine. Also, we can see the Brunner's gland. The most important is the duodenal gland, which is called as the Brunner's gland, which is seen in the submucosal layer of duodenum. The jejunum. The jejunum is having no Brunner's gland, no Pierce patches. It will have lining epithelium as simple columnar epithelium. It will have villi. It will have goblet cells. It will have simple columnar epithelium. It can have 1 or 2 lymphatic follicles, no Brunner's gland. It will have inner circular and outer longitudinal layer. The intermediate length will be of the villi. So a feature of tract of GI tract, which is having all the features of small intestine, histological feature, but no duodenum gland, no Brunner's gland, no Pierce patches, that becomes a slide of jejunum. So ileum, again you can see the histological slide with so many intestinal glands, lacticles, simple columnar epithelium, and the most common features for identification is the Pierce patches, which is in aggregation in the lamina propria layer, which is traversing towards the submucosal layer, and other layers are similar to GI tract. Intestinal glands with the Paneth cells. So the cells of intestinal glands. So we can see the mitotic cells. We can see the intestinal gland. We can see enteroendocrine gland, mitotic cell, goblet cells, and the Paneth cells containing zymogen granules. The lacticles. So villi containing goblet cells. So we will have the goblet cells. Simple columnar epithelium, microvilli. The goblet cells, actually goblet cells will increase as you move more distally in the GI tract in the colon. Central lactical unit, capillary in the central lactical unit. Now coming to the histology of large intestine. So if I talk about large intestine, learning objective is to know the general features of large intestine. You too have to know the general features of colon and difference between small and large intestine. So if I talk about large intestine, it is extending between the anus and the terminal end of ileum, and we have got the parts like transverse, descending, ascending, sigmoid, colon, rectum, and anal canal as the part of large intestine. Basically, there are 3 cardinal features in the large intestine. We will have the 3 features here. We will have the longitudinal muscle cord, which is called as the tinea coli. We will have the appendices epicoli, the fat pouches. We will have hostrations. We will have the hostrations. So these are sacculation or hostration. So these are the 3 features. So we have tinea coli. All the tinea coli converges at the root of the appendix, at the root of appendix or base of appendix. Sacculation, appendix epicoli, the fat pouches. So large intestine is extending from ileocecal valve, and it is very important that the residue of so basically unabsorbed, undigested food from small intestine is forced into large intestine, and then it will forced out. It will be more the strong peristaltic movement or action of the smooth muscles and muscularis externa will protrude it and form as will convert into a semi-solid state. Histological features, if I talk about histological features of colon or large intestine, it is similar to that of small intestine. Only the difference is that villi is absent. Now, large intestine is not having any kind of villi. It will have more number of goblet cells. The layer is similar, mucosa, submucosa, muscularis layer, and the outer will be either serosa or adventitia. But the major part is that it will have no villi and it will have definitely large number of goblet cells. So the whole of slide will be having many goblet cells. So if we talk about underlying submucosa layer, it contains connective tissue layer, fibers and blood vessels. Muscularis externa is there, and also the mesentery. Wherever mesentery like transverse colon and sigmoid colon is having mesentery, so they will have the outermost layer as the serosa. Otherwise, the other reason they will have the adventitia layer. So I just wanted to show the histological features of large intestine. So here we can see the lumen, we can see the muscularis externa, and this white structure which has not taken the stain. This structure which you are seeing, these are all goblet cells. What is it? These are all goblet cells. So these are all goblet cells. So whole of the slide will have many goblet cells. So will have many goblet cells. The histological features, let's talk about the histological features. So the histological feature, the colon does not have villi, does not have valve of Kerckering, which is called as the pilique circularis, and also it will have undistended colon. The mucosa and submucosa will have only temporary folds, will have lymphatic nodules also, but will have no villi and will have much more number of the goblet cells. Outermost layer will have three longitudinal band which is called as tinea coli. Tinea libra, tinea mesocolica, tinea aumentalis. Three tinea coli will be lying on the outer aspect which will converge at the base of appendix. So this is a image showing histological features of large intestine. We can see absorptive columnar cells, goblet cells. So here this was the important point which I want everybody. Can you see so many goblet cells? So whole of the slide you can see many goblet cells are there. So this wine-like structure, these are all goblet cells. So goblet cells are high in number in the, if the slide comes for colon, the goblets, all of the epithelium, you can see the goblet cells are there. Lymphatic nodules will be there, but not like Pierce patches. And all other part will be having the similar GI tract histological features. Now, if we talk about the large intestine, there is also present a menintric nerve plexus. Actually, 2000 this year NEET PG they have talked about menintric nerve plexus. What is menintric nerve plexus? The parasympathetic ganglion, which is also called as menintric nerve plexus or Iobac nerve plexus, is found between the layers of muscularis externa. The transverse and sigmoid colon will have transverse and sigmoid mesocolon, which will have mesentery. Other layers will have outermost adventitia layer. The large intestine paranomic view, you can see the lumen. You can see the three tinea coli. These are the three tinea coli. You can see few of the submucosa and lymphatic nodules collection also. You can see outer longitudinal inner circular muscle layer and lymphatic nodules. All other features are similar. No villi. Here you can see lamina propria, intestinal gland and goblet cells are much more in number. No villi, much more on number goblet cells. Now, in short, we have finished with the GI tract, but I just want everybody to just go through the differences which is found in between the small intestine and large intestine. So, if I talk about small intestine, its length is just 6 to 7 meters, but large intestine, its length is 1.5 meters. Caliber will be narrow in small intestine and will be wider in large intestine. Tinea coli will be absent in small intestine. Tinea coli will be large in large intestine. Sacculation is absent. Appendices epicoli. Actually, the three features, cardinal feature of large intestine, that is tinea coli, sacculation, appendices epicoli, which will be absent in small intestine, and these three features will be present in large intestine. The villi is present in small intestine, it is absent in large intestine. Pilique circularis, valve of Kerckering, the inner mucosal fold will be present in small intestine. Pierce patches will be present in ileum, absent in large intestine. Crypts of Lieberkühn containing Paneth cells and absorptive cells will be present in small intestine, and here in the crypts we will have more number of goblet cells in the large intestine. So my dear students, we have finished with that of major part of the GI tract. I just quickly want you to know about the difference of the slides of the esophagus, stomach and large intestine, small intestine. What about the epithelium? The epithelium in small intestine, large intestine and the stomach will be simple columnar. Only the esophagus have stratified, squamous, non-keratinized epithelium. The difference of epithelium is very important. In case of esophagus, we have stratified, squamous, non-keratinized epithelium. Rest all will have columnar epithelium. Lamina propria contains esophageal gland, fundic cardiac pyloric gland in the stomach, intestinal gland in the large and small intestine. Some mucosa contains esophageal gland. The duodenum contains Brunner's gland in the submucosal layer. Muscularis externa only in case of esophagus. Upper part is skeleton. Middle part of esophagus contains both skeleton and smooth muscle fibers. Lower part is containing the smooth muscle fibers. In the case of stomach, we will have inner oblique. We will have inner oblique, middle circular and outer longitudinal layer. In case of small intestine, inner circular, outer longitudinal layer. The serosa and adventitia layer, the outermost layer in esophagus is more of adventitia, serosa in stomach. The serosa in small intestine except the duodenum, and the adventitia layer is present in rest of large intestine except the transverse colon and that of sigmoid colon, where we will have the serosa layer because it is having the pancreatic, the peritoneum covering. Now, then we will have, I just want to cover up the gallbladder, then I will give you a 5 minutes break. Is it okay, everyone, those who are live? I will give you 5 minutes break after gallbladder, 8 minutes break, then I will cover up few more histological aspect of respiratory tract. Quickly we will cover up the endocrine and that of the urinary tract. So I will just give you 5-7 minutes break. Okay, so what we can do now, I am giving you a break of 10 minutes and then we will start. I have to take 1 hour more session because I want to cover. Is it okay, Robo? Yeah. So I want to cover few important points. 1 hour more I will take a session to complete it. Now I am giving you a break of 10 minutes. Is it okay? 10 minutes break. So have your tea and coffee, take 10 minutes break. Okay, dear? Thank you. So just take 10 minutes break and again we will join with the Jitin. Yes, just 1 hour more is there. So take coffee, tea and we will meet. Okay, thank you. So break just for 10 minutes. Uh, Hello everyone. Yeah, what happened? Mm. So is it okay? Is it visible? Please let me just check. I will also check with the students. Let me just check. Am I audible? So just few important points is still remaining in the histology part. So let me just complete it. So I'm just going to check, am I audible or not? So audible? Audible everyone? Yeah, I'm audible. So yes, now, so exactly I'm audible. So exactly, the thing is that gallbladder is still remaining, and the histology of gallbladders is the basic point which you have to understand in the histology of gallbladder is very important, which we can't leave here. So if we are talking about the learning objective of this session, this will to know the function of the gallbladder and the histological features. So here we know that gallbladder is storing the bile, and it is connected with cystic duct and hepatic duct to form the common bile duct. So gallbladder is a muscular sac-like structure, and it is consist of mucosa. It is consist of adventitia or serosa layer. The walls of gallbladder does not contain. So this is the most important point. So if you will see the slide of gallbladder, you will see a honeycomb appearance. So the whole slide will have a honeycomb appearance, and it will have, the gallbladder will not having any muscularis mucosae or submucosa layer. So you can see this is the simple columnar epithelium the gallbladder is having. Lamina propria is there, and there is absence of two layers. So there are two layers which is missing in the case of gallbladder. What is that? It is not having the submucosa layer, and it is not having the muscularis mucosa layer. So two layers are missing. Then it will have the serosa layer, as you can see here. So the two layers which is missing has been asked so many times in the MCQ, and which two layers are missing in the gallbladder? The gallbladder is not having any muscularis layer or the mucosa layer. This is very important for you to understand. No muscularis and no submucosa layer. Yes, dear, it's already started. Now, I would also like to tell Jitin that already we have covered the skin histology part. Already we have covered the skin histology part, dear. We have already covered at that. Okay. Now, gallbladder is consist of simple columnar epithelium. It is having loose connective tissue, and it is having diffuse lymphatics tissue, blood vessels, venules, and arterioles. So, the honeycomb appearance, simple columnar epithelium, lamina propria, no muscularis mucosa, no submucosal layer. This is the characteristic feature of the gallbladder slide. Now, in the non-distensive phase, the gallbladder will show temporary mucosal fold, and the mucosal fold which is seen in the case of gallbladder will be similar to the villi of small intestine. So, it will be similar to the villi of small intestine. In between the mucosal fold, there will be indentations, and also the lamina propria will resemble as a tubular gland in the case of gallbladder. So most important thing which is asked in examination is the missing layer, which you should not forget. And Jitin, what is the missing layer in the gallbladder? Tell me the answer. What is the missing layer in the gallbladder? Which two layers are absent in gallbladder? Jitin, worry. Jitin, which two layers? The submucosal layer and the muscularis mucosa layer. The gallbladder is having a dense surrounding smooth muscle layer, blood vessel, arteries and nerves, and the serosa is covering the unattached part of the gallbladder. Other part it is having adventitia. The functional correlation is that the primary function of gallbladder is to store, concentrate and expels the bile when it is required for emulsification of the fat. Okay. It is actually bile is continuously produced by the liver hepatocyte, and it is transported by the excretory duct to the gallbladder for the storage. Now, I just want to solve an MCQ related to it. One of the MCQ which is related to the GI, gastrointestinal tract. Can anybody give me the answer? Centroacinar cell is present in which of the following structure? Centroacinar cells are present either in pancreas, in parotid gland, in prostate, or none of the above. Centroacinar cell. Centroacinar cell is present in pancreas, parotid gland, prostate. Anyone? Centroacinar cells are present in which of the following structures? I told you that centroacinar cells is present only in the serous part of one of the structure, and the right answer is it is present in the serous part of anybody. It is present in the serous part of its important structure. It is present in the serous part of It is present in the serous part of, my dear student, it is present in the serous part of its structure. It is present in the serous part of pancreas. So the pancreas is the right answer. Okay. Now space of dyes is present in which of the following? Space of dyes is present in spleen, liver, lymph node, bone. Space of dyes, I just explained. Space of dyes is present in which of the following structures? Space of dyes is present in, the right answer is, space of dyes is present in liver. Both space of dyes, perisinusoidal, and space of mole, that is periportal, is present in case of liver. All of the following cells are found in small intestine except. All of the following cells are found in small intestine except stem cell, goblet, neck, and Paneth cells. So one of the cell is there which is more present, which is present in the case of large intestine. Which is present predominantly in large intestine. Anyone? Goblet cells are predominantly present in large intestine. Now endocrine system, so I will go briefly with the histology of other parts. So let's talk about endocrine. In this I would like to tell about the histology of thyroid gland and parathyroid gland. So when you see the histological image of thyroid gland and parathyroid gland, so we know that thyroid gland will have follicular cells. So two important histological aspect you have to know, that that is the characteristic features of thyroid gland will have colloid. So when you see the histological slide of thyroid gland, you will have the colloid seen in this image. You will have follicular cells, which is simple cuboidal epithelium. You will have parafollicular cells. Okay, so you will have histological features. We will have thyroid follicle lined by simple cuboidal epithelium. You can see this is simple cuboidal epithelium. Thyroid follicle will be lined with simple cuboidal epithelium. And also the colloid will be there. And can you tell me the colloid is made by which structure? The answer is colloid is made by thyroglobulin, and in between interfollicular space will have parafollicular cells. So in between the follicles and in between the thyroid follicles we have got the parafollicular cells. So thyroid gland histological features will be follicular cells, that is thyroid follicle lined by simple cuboidal epithelium. Actually here I want you to tell one of an important point. Most of the time it is simple cuboidal epithelium, but sometimes it will be simple columnar. I will give you the difference, don't worry. It will have colloid which contains thyroglobulin. In the lumen it will have colloid which contains thyroid globulin, and it will also have parafollicular cells, which is called as C cells or clear cells, which is called as C cells or clear cells. Now, other than that, if we talk about the thyroid gland, so it's also important that what is the function of follicular cells. So the follicular cells is actually responsible for the synthesis of thyroid hormone, that is T3 and T4. What do you mean by T3? Triiodothyronine and thyroxine. So it is important for the secretion of triiodothyronine and thyroxine. And the follicular lumen, thyroid follicle, inside the lumen there is thyroglobulin, which is the inactive form of the thyroid hormone. Other than that, if we talk about the other structures which is seen, so we will also have the parafollicular cells seen. So basically the parafollicular cells is secreting calcitonin. So please note down, parafollicular cells will secrete calcitonin, which is just having the antagonist. So it secretes calcitonin. So we are knowing follicular cells secrete T3 and T4, and parafollicular cells will secrete calcitonin, which is having the antagonist action of parathormone. So it is antagonist of the parathormone. So you can see this is the thyroid follicle. Histological characteristic features: the thyroid globulin in active form, the inside, that is the colloid is there. This is the colloid. Thyroglobulin, the connective tissue stroma, the capillaries, the parafollicular cells, which is secreting calcitonin, antagonist of parathyroid hormone, and we have follicular cells having simple cuboidal epithelium. This is showing you the thyroid follicle having colloids, interfollicular connective tissue which is having parafollicular cells. Now, basically what I told you, that the lining epithelium of the follicle is also depending on the resting phase or active phase. So, we have got two phases of thyroid follicle. One is the resting phase and another is the active phase. So, follicles are large in the resting phase, and in that resting phase it can be surrounded, follicular cells will be surrounded by simple squamous epithelium or low cuboidal epithelium. It will have few microvilli and large amount of colloid in the lumen. This is the resting phase. When in the active phase, the follicle is small and it can be surrounded by cuboidal or low columnar. Please note down, this is an important question which was asked in the previous year of NEET PG exam. What is the lining epithelium of active follicle? And the most appropriate answer in this of the active follicle lining epithelium will be low columnar epithelium other than the cuboidal. It will be lined by low columnar epithelium. The nucleus is epithelial scapoid appearance, and the amount of colloid will having the scapoid scapoid borders, and less amount of colloid will be there. The parenchyma of thyroid gland, the C cells, the parafollicular cells, in the interfollicular stage, the colloid and the follicular cells. Here also we can see the parafollicular cells which are bigger in size. So exactly we have talked about parafollicular cells, and no. So we will have the parafollicular cells as shown here. Now the parathyroid gland. So actually if I talk about the parathyroid gland, it will have chief cells. What is the important features of parathyroid gland? It will have the chief cells, and it will have oxyphil cells. Two cells are there in the parathyroid gland. One is chief cells and other is oxyphil cells. So you can see here the principal chief cells is there. Oxyphil cells is also shown here, which again we can't know the important features of this. Exactly, it is important that we should know the features of oxyphil cells. Anyone is knowing can tell me the features of chief cells, parathyroid gland cells? Can anybody tell me? So parathyroid gland is regulating the calcium. What is the function? It is regulating the calcium. It is maintaining the calcium balance, and it is if we talk about PTS hormone, parathyroid hormone is secreted by the chief cell. Still the oxyphil cells function is not known, but we know that principal C cells, chief cells of parathyroid gland is releasing the parathormone. Is it okay? So this is the slide where both the thyroid colloid has been shown, the follicular cells, the parafollicular cells. Also here we can see the oxyphil cells of the parathyroid gland, and we can see the chief cells, the principal cells, which is having the function of releasing the parathormone. Okay. Now let's talk about the other uh, endocrine glands. So we'll talk about the suprarenal or adrenal glands. What is suprarenal, adrenal gland? They are two. We have got semilunar suprarenal gland in left side, and we have got triangular suprarenal gland in the right side. So here The weight is approximately 5 to 8 grams and they are located in the upper pole of the kidneys. Okay. Developmentally, it is very important. Actually, the MCQ which come from the adrenal cortex is that developmental aspect is often asked about the suprarenal gland. So, pituitary, it has got two parts, adrenal cortex and adrenal medulla. So, if we talk about the parts, adrenal cortex and adrenal medulla, actually adrenal, they are developmentally derived from other parts. So, the cortex, the adrenal cortex, if I talk about adrenal cortex, it is mesodermal in origin. And if I talk about the medulla is actually derived from the neural crest cells. Neural crest cells. So, if I talk about adrenal cortex, it is mesodermal in origin and medulla is actually derived from neural crest cells. It is derived from neural crest cells. So, the cortex is forming the major part of the adrenal medulla. The cortex is forming the major part of the adrenal medulla, which is again having three zones, zona glomerulosa, zona fasciculata and zona reticularis. So, we have to know how we are going to identify the slide of adrenal or suprarenal gland. We know that major part of the suprarenal gland is composed of cortex by 90% of weight. It is having a central zone of medulla and the cortex is producing steroid hormone and mainly the medulla is secreting catecholamines, that is epinephrine and norepinephrine. This is the important function of adrenal gland. So, adrenal cortex is having three zones as I told you, from superficial to deep. It is having zona glomerulosa is the superficial layer, zona fasciculatus and the deepest layer is zona reticularis. So, three zones are there in the adrenal cortex. As you proceed, as you move from superficial to deep, glomerulosa, fasciculata and zona reticularis. Then we have got the deeper medulla region. The cells of cortex show steroid synthesizing cells and also the cells of cortex is having the lipid droplets. So, basically it is important to know about the structure. So, it is very important that you should know what does the important structures contain. So, we have the first layer, that is zona glomerulosa, which is lying beneath the fibrous capsule. This zone is lying just beneath the fibrous capsule. And it is actually, it is corresponding 15% of the total volume of the adrenal cortex, and the main important function is that it is actually it is important for secreting mineralocorticoids. So, it is secretes mineralocorticoids, that is primarily aldosterone. So, basically this is asked in examination that zona glomerulosa is secreting which structure. So, it is mainly secreting the mineralocorticoids, primarily aldosterone. Now, coming to the next layer, that is zona fasciculata. So, it is an intermediate zone. This intermediate zone is corresponding part is corresponding the adrenal cortex 65% part, and actually what is the importance of zona fasciculata? It also contains lipid droplets. In this layer, how you are going to identify this is zona fasciculata layer, because we will have the lipid droplets in this region which is called as spongiocytes. And the important structure secreted by it is glucocorticoid. It secretes glucocorticoids. Now, what about the innermost layer is the zona reticularis. The innermost layer is zona reticularis, which occupies 5 to 10% of the entire area of adrenal cortex, and zona reticularis is secreting androgen. It secretes androgen. Androgen, it secretes DHEA. So, actually the cells of zona reticularis secretes androgen, that is dehydroepiandrosterone, and also some amount of glucocorticoids. Done. Now, so here we can see the outermost fibrous capsule, then the zona glomerulosa layer. The major part is of zona fasciculata containing the spongiocytes, zona reticularis, and then we will have the adrenal medulla. So if I talk about the adrenal medulla, it contains capillaries. Actually, it contains clumps of cells called as chromaffin cells. What does adrenal medulla contains? Clumps of cells called as chromaffin cells. Actually, they are polyhedral. These chromaffin cells are polyhedral in shape. They are polyhedral cells and shape, and actually they are capillaries. The cells are supported by reticular fibers. So actually they are chromaffin cells are, apart from chromaffin cells, few parasympathetic ganglions will be also seen in the adrenal medulla. There will be some ganglionic cells which is also seen in the adrenal medulla. So they are part of modified sympathetic ganglionic cells. So this is the histology of adrenal gland: capsules, zona glomerulosa, the zona fasciculata containing spongiocyte, zona reticularis, and the medulla, the deepermost layer. So this is how it looks: fibrous capsule, glomerulosa, fasciculata, reticularis, and the chromaffin cells contains in the medulla, that is modified sympathetic post-ganglionic neurons. It contains modified post-ganglionic, it is containing the modified post-ganglionic neurons. Modified sympathetic post-ganglionic neurons is contained in the medulla. You can see the zona fasciculata will be lipid droplets, so it is appearing lighter stained, and it is having spongiocytes. So done with this, now we will talk about the, so again this is the enlarged way. This is again showing you the cells of glomerulosa, the spongiocyte cells in the fasciculata layer, the reticularis, and the deepest sympathetic nervous system adrenal medulla. Now let's talk about the pituitary gland. So I just give you a brief about these structures. So if I talk about the pituitary gland, it is again have two parts: anterior pituitary and posterior pituitary. Okay, so pituitary gland is located in the pituitary fossa, and it is actually weighing approximately 0.5 grams, and it is located in the middle cranial fossa in the sella turcica, and it is enclosed in diaphragma sella, which we have already talked in the meninges of brain class. So if I talk about the parts of pituitary gland, it is attached to the infundibular stalk, and it is having two parts: anterior pituitary and posterior pituitary. So it is regarded as the master endocrine gland because hormones secreting by the pituitary gland controls the activity of other endocrine glands. So developmentally also pituitary gland is very important, and developmental aspect question comes: which is the source of origin of anterior pituitary and what is the source of origin of posterior pituitary? Posterior pituitary is called as neurohypophysis, and it is derived from neuroectoderm as a downgrowth of infundibular process or diencephalon. If I talk about anterior pituitary adenohypophysis, it is derived as an outpouching of ectoderm, the Rathke's pouch. The anterior pituitary, you can see the anterior lobe. The posterior pituitary known as the neurohypophysis. The subdivision of adenohypophysis and the neurohypophysis is done, and we know that the adenohypophysis is mainly secreting hormones, and neurohypophysis is storing the neurohormones which is received by hypothalamus. So if I am subdividing the pituitary, the master gland, master endocrine gland, which is having two parts, the anterior and the posterior pituitary, developmental aspects are different, which we have discussed. The anterior part produces and secretes hormones. The posterior part is actually storing the released neurohormones received from hypothalamus. So here we can see the important parts of the pituitary gland. We can see the infundibulum part, the pars tuberalis, the pars hypophyseal clefts, the distalis, the pars nervosa, and pars intermedia. These are the parts of pituitary gland. This image is showing you the parts of pituitary gland. I would also like to give you more detail. Actually, adenohypophysis, this is the anterior pituitary, and it is subdivided into three parts by a row of follicles, and actually it has got three parts. Pars distalis is the main anterior part in front of hypophyseal cleft. Pars tuberalis is the cranial projection, and pars intermedius is the part lying between neurohypophysis and hypophyseal cleft. That means pars intermedia, pars tuberalis, and pars distalis. So this is pars intermedia, pars. That means anterior pituitary parts are pars intermedia, pars distalis, and pars tuberalis. Pars nervosa is a part of posterior pituitary. The neurohypophysis is divided into infundibulum and pars nervosa. Posterior to the pars intermedius is the pars nervosa, and infundibulum is a stalk which is connecting pars nervosa to the hypothalamus, or you can say it is connected to the floor of third ventricle. Now you can see here, actually here we can see the whole paranomic view of the pituitary gland. Pars nervosa is shown. In between we have got colloid vesicles as shown in the pars intermediate part. We have got the pars distalis, and we can see infundibulum and pars tuberalis part, and we can see important, actually the cells which is residing in the pituitary gland, which has been asked in examination also, is the acidophils and basophils, that is the chromophobes and chromophils we have to know. So here again we can clearly see in this diagram, we can see the pars distalis part containing the chromophobes and the chromophils. So pars distalis part will contain the chromophobes and the chromophils. The pars intermediate, what does it contain? If I am talking about pars intermediate, it is containing unmyelinated nerve fibers, unmyelinated nerve fibers and pituocytes. And pars intermediate, this is containing pars nervosa. So here unmyelinated, please. Okay, so just a minute. The pars nervosa is containing unmyelinated nerve fibers and pituocytes. Pars distalis is containing chromophobes and chromophils. Now your doubt will be, what does pars intermedia contain? So if I am talking about pars intermedia, it is actually separated from pars distalis by a hypophyseal slit. So here you can see this is the hypophyseal slit, which is basically separating it from the pars distalis, that is the pars intermedia. Major structures secreted or released by pars distalis and that of pars nervosa. So here we can see high power view of hypophyseal cleft. We can have the in the pars distalis only we will have the acidophils, basophils. This is the pars intermedia region, and nerve fibers and pituocytes are seen in the pars nervosa part. Now coming to this, so exactly what is asked in examination, I am concentrating on that part. So different characteristic cells and the important chromophils means chromophils are again that is of acidophils. As we know, the pars distalis is the major part which is containing the chromophobes and chromophils. So you have to know the important chromophils are of two types, acidophils and basophils, and what does it is secreted. So we have got acidophils as two forms, somatophobes and lactophobes. Basically the shape of somatophobes are round and oval. What is the affinity? The orange G is the staining used for it. Lactophobes we have erythrocene and charamycin. Chromophils, so let's talk about the chromophils gonadotropes, which is stained by aniline blue, large. Basophils we have got thyrotropes and corticotropes, and they are polyhedral and polygonal in shape. So actually this is showing the granule size is also compared, and we have got large granule size as in during the somatophobes, and comparative granule size are shown here. Actually you have to have an idea about staining, which you must study in the pathology part. So somatophobes are stained by orangey, lactophobes are stained by the erythrocyanine and caramine. Aniline blue is used for the staining of gonadotropes. Thyrotropes and that of corticotropes are stained by aniline blue. Now, so basically the hormones secreted by somatotropes are growth hormone. Lactotropes will secrete prolactin. Gonadotropes will secrete luteinizing and the follicle stimulating hormones. Thyrotropes will stimulate the secretion of thyroid stimulating hormone. Corticotropes will stimulate the secretion of adrenocorticotorphin and MSH, which is important. Melanin stimulating hormone, which is important for the pigmentation of the skin. So basically I am not going into much detail because these cells, where it is located and what all hormones is secreted, that is asked in the examination. Okay, so here we can see the cells of pituitary gland. the acidophil cells and the basophilic cells. Bluish acidophilic cells will be pinkish and brightly stained as compared to the basophil cells, and we have to see the important hormone secreted by it. Now we have done with this. Now I just want everybody to know about urinary histology part. So in case of the urinary system, we are already knowing in case of urinary system that urothelium is the lining epithelium, which we have studied also. So we have to know about the neuroepithelium. So we have to know the skin. We have to know about slight histological aspect of the kidney and the histological features of the urinary bladder, and the ureter. So when you see the microscopic view of the kidney, you can see the renal hilum, where the renal vein, artery, and also you can see the we can see the papillas are there, the pyramid is there, renal column of Botany. The renal column Botany is the space which is lying in between the renal pyramid. The major and minor calyces has been shown. So also you can see the sagittal section of kidney showing the hilum, which has got the anteriorly there will be vein, then renal artery, and then the renal pelvis. The cortex and the medulla, we will have the renal pyramid as seen here. In between the space is column of Botany. In this pyramid, we will have the major and minor calyces. So let's talk about the important features. So I would like to talk about the microscopic structure of the kidney cortex. So basically, when you see the histological features of the kidney cortex, you can see the fibrous capsule, you can see the cut section of PCTs and DCTs, which is having the lining epitheliums of cuboidal epithelium. You can see the renal corpuscles. In between there will be renal corpuscles. So basically the distal convoluted tubules, basically when you see in high power view very clearly, you can see the proximal convoluted tubule will have the brush border. What do you mean by the brush border? The microvilli irregular and DCT will have no brush border. And also there will be renal corpuscles. If you see the kidney cortex high power view, you can see the distal convoluted tubule, the proximal convoluted tubule, the glomerulus epithelium and the glomerula. Medulla. So what about the medulla? When you see the medulla, you will see more of the collecting duct and the loops of Henle. You can see the ascending and the descending loop of Henle. You can see no PCTs and DCTs. So here you can see the vasa recta part also. You can see the loop of Henle, which will have, if I talk about loop of Henle, it is also lined by cuboidal epithelium. And if I talk about collecting duct, please note down collecting duct, collecting tubules will be lined by columnar epithelium. It will have the lining epithelium as the columnar epithelium. Okay. Now the ureter. So we know that ureters, if I talk about the ureter, so ureter is a muscular tube which is extending from the renal pelvis to the urinary bladder. So if you will see the ureter, you will have the lining epithelium, transitional epithelium, and you will have a star-shaped lumen. So the ureter will star-shaped lumen, and you can see it is multi-layered epithelium. So multi-layered epithelium will be there. This is the multi-layered epithelium which you are seeing, which is having stratified layer and with the capacity of getting stretched. The linings of the ureter will be three. It will have mucosa, muscle coat and adventitia. So it will have a lumen, it will have the mucosa which is also having lamina propria, it will have the muscular coat, and the outer will be the adventitia layer. So structure of ureter, as you can see in the cross section, the mucosa will have the lining epithelium as transitional epithelium, lamina propria, the muscularis layer, and the outermost is adventitia. So you can see the layers as you go from above. So just quickly, we have seen in this image, but I want that whenever you see the slide having the lumen along with transitional epithelium, along with the muscle layer, we will have the identification as the ureter. So basically in case of ureter, the most important features for you to identify in the slide of ureter is that you will have the mucosa. The mucosa is of transitional epithelium. It will have also the lamina propria supporting it. Then this is the first layer. Then we will have the muscular layer. The muscle layer will be arranged into two layers. So actually in the upper part, it is two layer, but in the lower part of ureter it is three layer. So in the upper part it is of two layers only, that is that will be inner longitudinal and outer circular. So it will have inner longitudinal and outer circular. But in the distal part, when I am talking about the distal part of ureter, it will be three layer. It will be three layer. That will be inner longitudinal, outer circular, and the outer again longitudinal, and the outer again longitudinal. So total there is three layers. Total there is, so muscular layer, it's a muscular tube like structure. In the distal part of ureter it is three layer, but proximal part of ureter is two layer, and the outermost layer will be of adventitia. And we know that adventitia layer is having lymphatic vessels and surrounding fibroconnective tissues. Now coming to the urinary bladder, before that I just want you to show the lumen of the ureter, star shaped transitional epithelium, the adventitia layer mixing with the adipose tissues and all, adventitia layer, the muscle layer, you can see the circular and the longitudinal smooth layer. So basically it will have three layers in the distal part of ureter. It will have inner longitudinal, middle circular, again outer longitudinal layer in the distal part of the ureter. Urinary bladder, let's slide as the urinary bladder. So urinary bladder is again having the lining epithelium as the transitional epithelium. So it is again having a capacity of 200 to 300 ml in a normal case. And again we know that if I talk about urinary bladder, so the inner layer will be mucosa. Again the inner layer is mucosa. The lining epithelium is again transitional epithelium. It will have a transitional epithelium. If we talk about, so other than that, it will have three layers of muscle coat, three layers of muscular coat. So it will have again inner longitudinal, middle circular, and again outer longitudinal. So I'm just writing briefly only, and adventitia is the outermost layer. The third layer is the adventitia, which is the outermost layer. Okay. And the lining epithelium is similar. So here we can see the slide. So the folds of the mucosa, transitional epithelium along with the lamina propria, the bundle of smooth mycel fibers running in different direction, the three layers are there. So thick muscular coat is there and thick smooth muscle directed in different directions, separated by connective tissue, and the glands are absent in urinary bladder. Urinary bladder, there is no glands. So here you can see the umbrella, the outermost layer of the urinary bladder is called as umbrella cell. Intermediate cells and the basal cells are shown. The outermost ballooned out cell is the umbrella cells. This is cuticle, which forms the cuticle, which is exactly which is protecting the inner of the urinary bladder from the deleterious effect of the toxic material in the urine. We will have superficial layer as the umbrella cells, which is ballooned out in the relaxed stage, the basal layer, the lamina, and the smooth muscle running in different directions. This is the lining epithelium or the urothelium is present in renal calyces, in the initial part of urethra and urinary bladder, which we have covered in the epithelium class. This is the two collapsed and the distended state. In distended stage, it is 2 to 3 layered. So it is 2 to 3 layered in the distended stage, and it will be 3 to 5 layers in the collapse in the relaxed stage. I just want to check with the students. Ravi Ranjan Kumar, yeah, hello. Yes, yes, posterior. Yes, you are right, Punit. Yes, you are right, Punit. Yes, you are right, Punit. You're absolutely right, Punit. So in the last, I have slightly, actually too many things were there. So I have slightly rushed to complete it. Don't worry, these are all basic facts. There was not much of conceptual points. So I have rushed to these points. So respiratory tract. Now quickly we will talk about the respiratory tract. If I am talking about the respiratory tract, it is important to know we have basically talked about the pharynx. So So in the pharynx and larynx, we will talk about epiglottis, which is a double-edged sword. So you have to know the two lining epithelium of the epiglottis, the oral and the respiratory part. This is showing you the layers of pharynx as you proceed from. As you proceed from inside, it is the mucosa, then is the smooth, then is the pharyngobasilar layer, which is corresponding to smooth muscle layer. Then we have the muscle layer, and outermost layer is the buccopharyngeal fascia. So these are the four layers of the pharynx as you proceed from inside to outside. Now, epiglottis. So basically question has been asked from the epiglottis, and it is called as a double-edged sword. Can anybody tell me why it is called as a double-edged sword? Can anybody tell me, Dr. Puneet, Dr. Ravi Ranjan Kumar? Double-edged sword because it is having two aspects. It is having oral surface and it is having a pharyngeal part which is towards the respiratory part. So orangeal, if I am talking about the part which is facing the oral aspect, it will have stratified squamous non-keratinized epithelium. So that epithelium will be stratified squamous non-keratinized epithelium. Is it okay? And if I talk about the pharyngeal aspect towards the more of the respiratory side, it will have pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium. Is it okay? So only epiglottis is called as double-edged sword. So epiglottis having stratified squamous epithelium towards the lingual aspect. This is the epiglottis two aspects. So we will have the pseudostratified ciliated columnar aspect in the respiratory aspect and stratified squamous epithelium towards the oral aspect. It is a leaf-like structure on the posterior aspect of the tongue. Trachea, important features in the trachea which you have to know. So most important features I will tell. So trachea is a 10 centimeter long tube, and we know that it is having a hyaline cartilage. It is having a C-shaped hyaline cartilage posteriorly, which is connected by smooth muscle. What is the smooth muscle name? Trachealis. The lining epithelium will be respiratory epithelium. So if I talk about the trachea, the lining epithelium will be the respiratory epithelium. So you can see the slide. We will have pseudostratified ciliated columnar epithelium in trachea, lamina propria. Tracheal glands are there, and the type of cartilage which is present, the C-shaped hyaline cartilage is present in trachea, and posterior aspect it is connected. The end of C-shaped hyaline cartilage on the posterior aspect will be connected by the smooth muscle trachealis. Pseudostratified ciliated columnar, tracheal glands and hyaline cartilage. This is the trachea where you can see the hyaline cartilage. So this is the trachea slide where you can see this is the hyaline cartilage having perichondrium covering. It is also having the seromucous gland. Posteriorly, we have the trachealis muscle which is connecting the C-shaped loop posteriorly. Pseudostratified ciliated columnar epithelium and tracheal glands. This is the high power view, seromucous gland. The cartilages of the chondrocytes in the lacuna of the hyaline cartilage, the goblet cells in the pseudostratified ciliated columnar epithelium, the seromucous gland, the mucus and the serous gland. Both serous and mucous gland is seen. The lungs. So basically, if I talk about the general features, so I just want to talk about the general features of the conducting part. So if I talk about the general features, again it will have mucosa, then it will have the submucosa layer, then it will have the cartilage layer, and then it will have the adventitia layer. So actually if I talk about four layers of the respiratory tract from inside to outside, it will have mucosa, it will have submucosa, it will have cartilage, and it will have the adventitia layer. So basically what happens, there is certain things which has changed. The epithelium will, so if I talk about epithelium, the epithelium will gradually decrease in height. So the epithelium will gradually decrease in height. So decrease in height as you go from the lower aspect, from the conducting part more lower, the epithelium height is increased. Goblet cells will also decrease in number. So goblet cell will also decrease in number. Glands will decrease in number as you go lower down in the conducting part of the respiratory tube. The cartilage will also gradually decrease. Actually, cartilage is present till the level of principal bronchus, and the smooth muscle fibers will increase. What increases as you go gradually down? The smooth muscle fibers will gradually increase. The elastic fibers will gradually increase. So these are the features which you have to know in the case of conducting part of the respiratory epithelium. Now the parts of bronchus has been shown. So till the level of intrapulmonary bronchus, we have got the presence of cartilage ring. So till the presence of intrapulmonary bronchus. So in the intrapulmonary bronchus also, if I talk about intrapulmonary bronchus also, we will have a wavy mucous appearance, mucosa with a lining epithelium of pseudostratified ciliated columnar epithelium. We will also have the seromucous gland. We will have the piece, actually the C-shaped hyaline cartilage. When you see the slides of principal bronchus, the C-shaped hyaline cartilage is in the form of plate of hyaline cartilages. This is the intrapulmonary bronchus. You can see the hyaline cartilage has been broken down in the form of plates, not the C-shaped. Other features are more or less similar. We will have the respiratory epithelium only, that is pseudostratified ciliated columnar epithelium. The goblet cells are decreasing, the seromucous glands are decreasing. Now bronchioles. So if I talk about the bronchioles, what are the things? So in case of the lungs, we will have the, so basically there will be then bronchioles, then there will be respiratory bronchioles. I just want to show. So here this is showing you the terminal bronchioles. If it communicates with the alveoli, then it is respiratory bronchial. So the epithelium has decreased. As you can see, the epithelium level has become simple columnar epithelium. So this is the terminal epithelium, simple columnar epithelium. In case of respiratory bronchial, it shows communications with the alveolar duct and alveolar outpouching. As you can see, this is the alveolar duct and it is showing communication with the alveolar outpouching. Now this is the alveoli. So actually lung, if you will see the lung, so this is a slide of lung which I want you to know. So pulmonary alveoli will be seen, and if you will see the lining of alveoli, it will be simple squamous epithelium. It will be having simple squamous epithelium. Honeycomb appearance, the slide will be of honeycomb appearance. Bronchioles, cut part, simple squamous epithelium will be there. Now what is much more important in the alveoli which I want, you just want to know the two cells of the alveoli, which is very important. So I will come to the two cells. I just want everybody, there is two cells in the alveoli. One is type 1 pneumocytes and the other is type 2 pneumocytes. So one is type 1 and the other is type 2 pneumocyte. So type 1 pneumocyte are squamous. So if I talk about type 1 pneumocyte, it is squamous. Epithelial cell, it covers 97%. If I am talking about type 1 pneumocyte, please confirm. Type 1 pneumocyte covers 97% of the alveolar surface and it is of squamous cells and it contains the pinocytic vesicle. It plays an important role in absorption of surfactants. What is the function of type 1 pneumocyte? It plays an important role in absorption of surfactants. And if I talk about type 2 pneumocyte, it is covering the 3% of the alveolar surface and it is alveolar cells. Type 2 pneumocytes are cuboidal and it is also bearing microvilli and it is actually containing laminated bodies and it is also having laminated bodies and it forms pulmonary surfactants. It forms the pulmonary surfactants and it lowers the tension and prevent the alveoli from collapsing. So we have got type 1 pneumocyte, the squamous type, the type 2 is the cuboidal type. Type 1 is present in 97% of alveolar surface, type 2 is present in 3% surface. Lower the surface tension and preventing the alveoli from collapsing is the function of type 2 pneumocytes, and type 1 pneumocytes play an important role in the absorption of surfactants. So done. So basically, can you tell me hyaline cartilage? So can you tell me hyaline cartilage? All of you, can you tell me hyaline cartilage is extending in the respiratory tree till which level? Till which level hyaline cartilage ends? At which level? So the correct answer is principal bronchus. So at the level of principal bronchus, the hyaline cartilage will end. At the level of principal bronchus, the hyaline cartilage ends. All of the following cells are present in the lung except. So we have Clara, breast cells and Purkinje cells. All these cells will be present in the lung. Langerhans cells are present in the skin and it is important for immunity. So the right answer is Langerhans cells D, because it is present in the skin and it is important for immunity. So done. Now I am not going into the details of retina. I just want, so basically you just know the 10 layers of the retina. So I just want everyone, so go through this and know the 10 layers of the retina in this image. So exactly there is pigment. So microscopic of the retina will show the 10 layers and it is the photosensitive part and it is composed of the outer. This is simple cuboidal epithelium will be the pigment epithelium. So the first layer will be pigment epithelium. Then we will have the layers of rods and cones. The pigment epithelium is involved in the absorption of light. The next is the layers of rods and cones, the photoreceptor cells, external limiting membrane. The third is external limiting membrane. Actually, if I talk about the nervous cells, it is present. Photoreceptor cells are present in retina, bipolar cells and ganglionic cells are present. Okay, so we will have the layers. We will have the external limiting membrane. Then we will have outer nuclear layer, then we will have outer plexiform, then we have inner nuclear layer, we will have inner plexiform, we will have ganglionic cell layer, we have nerve fibers of the ganglionic cell layer, and the innermost layer is internal limiting membrane. The innermost layer is internal limiting membrane, which is formed by the expanded end of Muller cells. Actually, so basically I have tried my level best to complete each and every aspect. Why I am ending here, I just go through the 10 layers of the retina as you proceed from the as you proceed, as you can see, starting from the pigment cell layer. So exactly pigment layer is formed by the cuboidal pigment layer. It is actually attached with the Bruch membrane of the choroid. So adjacent to the choroid, we will start with the pigment layer and then we go in the inner aspect and the deeper aspect. So go through these layers, that is the 10 layers of the retina, which has been asked in the previous year AIIMS entrance examination. So I have done with this. Basically, if we go into the concept of each and every histology part, it will take much time. So basically in the last few topics only I have rushed the topics, because most important characteristic feature I have just briefed you. I hope this session is useful for you. So just go through all these topics. It is highly beneficial. Is it okay? Have you understood today's session? Please let me know, my dear students, so that I can end the session. Histology part, Dr. Punit, is it okay? Is it okay? So we have done with the histology part. I have explained all the histological factors and the parts and the slides in much more detail. Only in the last 3-4 topics, I have just given the most important points only, because time was less and already we have got a long duration of histology series. Is it okay? Can I end the session now? Please let me know, my dear students. Everyone, can I end the session? Dr. Ravi Ranjan Kumar, Dr. Punit, Jiten, Anchal Sen, ROBO, Deba, Sheet, is it okay? Can we end the session? We'll meet in the next session. And now I think most important points have already covered in the revision series. The embryology part will be taken by me. Is it okay? I will tell you about the date when I will cover the embryology part. All the best and keep studying. So most important, when I am just coming to the end of this histology series, and if you want to know that most important things which you should know about the histological aspect, the most important things which you should not leave, I will definitely tell in a quick in the quicker aspect. The most important things which you should not forget. Is it okay? 2024 year, yes. So lymphoid structure, lymphoid organs, the cartilage, the glands and the epithelium. So if you have to tell most important things, so you should go definitely in the details of epithelium part, the glands and also the lymphoid spleen, thymus, lymphoid structure, thymus gland, the tonsil, the GI tract, the histology of the GI tract, the stomach cells, the small intestine, the large intestine, the esophagus, and the differentiating feature of all. Also about the sympathetic ganglion, the spinal ganglion, then the histology of cerebellum and that cerebral cortex. Also about the different aspects and the differentiating features and the types of gland is very important. Histology of whole lymphoid structure is very important, and epithelium I have covered in much more detail, so go through this. So if you want to tell you about the most important, I have covered the histology today in the two series, histology part 1, histology part 2. So histology part 1 should not be missed out for any examination. If you have less time, you can miss out only the histology part 2 series, but all of it is important, and you have to just go through the important epithelium and the characteristic feature, because we have also solved a few MCQs in between, which is highly important for you. All the best and keep studying. We will again meet in the next session of embryology part. Thank you. Thank you, dear students.